Hello, everybody. Welcome to the NJAHHP Symposium on CEUs. I want to actually thank a couple of people first before we do anything. I want to thank Sharon and Carla for actually stepping up to the plate to do just about everything that had to be done. I did like maybe 1/3 of 1%. Been dealing with some health issues, and it's going to be ongoing for a long time. But that's not the point. Point is that Sharon and Carla stepped up, and they're going to do a really, really good job. So I want to thank them, and I think everybody should thank them for putting this together for us. And I hope everybody enjoys it. So whoever's I'm turning it over to, I turn it over to.
Thanks, Ed.
Thanks, Sharon.
Okay, welcome to the conference. I just wanted to say,
Push the button.
there's one.
On top.
Got it. You guys can probably all hear me without a mic. We tend to speak a little loud in our business, so I'm sure I can project. Again, welcome. We are offering 7 credits today for you, those of you that are joining us virtually. Please stay online. We will be doing attendance checks. We need to stay in compliance with IHS so that we can continue offering these conferences for you year to year. I'd like to welcome our first speaker from IHS, our East Coast, Central East Coast Governor from IHS, to give us some updates on what's going on with IHS, what we're working on, and some government affairs. So welcome, Jordan.
Thank you. I was just telling Sharon here that I always first start off by telling everybody that this isn't my day job. So anyway, my name is Jordan McMillan. I'm a volunteer, and I have the position for its Central East Coast. It's they have the territories mixed up kind of funny, but I've been in the hearing aid profession for, 17 years. So I've been licensed for 17 years. My family's been in the profession for many generations. So I actually started out in the Midwest. I lived outside St. Louis, and like I said, got licensed about 17 years ago. Started working with my father's practice, and then worked up and got into management, started to grow his practice. His practice called Belton in the Midwest. And anyway, one thing led to another. And by the way, when I was out there, I got the position for IHS governor in the Central. So I had Missouri, Illinois, Wisconsin, Minnesota, and Iowa. So I've actually been doing this about 6 or 7 years, but it's a volunteer position. Okay, so I know whenever I saw people from IHS before, I always thought that was their day job, but it's not. We're all volunteers. We do have a great staff up in outside Detroit, Michigan, Livonia. Our full-time employees, they do a fantastic job, but I'm just here representing for this new area over here. And I purchased my own business almost 1 year ago here. So I'm based out of Roanoke, Virginia. So I drove up 7 hours last night. That New Jersey Turnpike is quite dark. It's almost in the middle of nowhere last night. But I made it, and I just want to start off by saying that. So I have quite a large business that I have to manage. So this again is taking time out because it is that important. So I'm going to go through and explain. And after being involved with IHS for this long, I really appreciate and respect it even more. And so I want to first off by explaining that. There's, by the way, on the slides up here, you can put the first slide. I have my own copy here for some notes. There's a lot of information. This was put together by Alyssa Parody and Sean Drake. Alyssa Parody is the executive director. She was the government affairs and chapter leadership, chapter relations in that position with IHS, and now she's the executive director. She's amazing. But there's so much that IHS does. She's put in all these slides. I'm going to do my best to just kind of get through this with you guys. It's kind of good we start a little late because usually I just take 15 minutes to go through this, so an hour would be a stretch for me. If you guys have any questions, I can try to answer them as best as I can. So feel free to raise your hand or anything if you want. But let's start out with IHS. What is IHS? So if you're not familiar, it's an international professional organization for all hearing aid dispensing professionals. We represent the profession globally, federally in the U.S., and partner with state-based associations, our chapters, to protect and advance the field. We also provide education, business resources, and much more to empower members and leaders in advance of practice. Basically, and this is probably one of the biggest takeaways here, if you guys don't already know, and actually, can I get, by show of hands, how many hearing instrument specialists are in here? Are there any that aren't? Any audiologists? Okay. So audiology, you guys have several different organizations that can represent your profession. Hearing instrument specialist, IHS is the only one. So if it weren't for IHS, we wouldn't have any kind of representation legislatively. Alyssa actually, it worked out this way. She lives outside DC, so she actually is on Capitol Hill, and she works with lobbying firms. And basically, we're the only line of defense. So again, when I talk about advocacy and donations and becoming a member, it really does matter. And I'm sure I was thinking about it this morning. When I got into the profession, you hear all these acronyms and stuff. Like you probably start out interfacing with IHS through the distance learning course. I think most hearing specialists take that. I would say the majority. But you hear these acronyms when you hear board certifications, and we'll talk about a little bit later too. But there's a whole lot more that the organization does. Okay. Go to the next slide here. Guys, I'm not going to read everything word for word, so I'm just going to summarize for you because it's a lot of information. A lot of this information changes on a daily basis, so that's why Alyssa provides this, and I try to keep up the best I can. It's community-based. Federal and state advocacy, education, and guidance on potential changes. Okay, you can go to the next slide here. This is pretty good. You talked about that. Okay, so current state and brief. So this is kind of like where we're at right now with our profession and really just the global consciousness or the public consciousness. It was funny last night when I got in the hotel room, I turned on TV to watch the news. There's an Eargo commercial, and there was a new one I haven't seen. There's like Eargo 6 or Max. Did you guys see that? Anybody? Anyway, it was like a 2-day sale, a Black Friday sale for that. But anyway, if you guys haven't noticed, with OTC coming on the market, it was October 17th, finally came into law. Are you guys hearing patients talk about OTC? They're bringing it up. They see the articles in the news. I had something else with AARP. There's been some articles there, so people want to bring it up. They're much more aware of it. But in general, we've been progressing towards this anyway, where many more people are aware of it. And then there's also things like Medicare, which we're going to talk about. And that's what is next. You go to the next slide. So to me, this is the past 2.5 years, this has really become kind of a hot issue, at least for hearing instrument specialists and audiologists. This has always been coming up in the past. I feel like more than 10 years ago. It always seems like every year it comes up where they want to try to add hearing aids or hearing, vision, and dental, along with Medicare, where you can bill for that, because as we all know right now, it's excluded. But in the past couple of years, it's come closer than ever to actually being included. And so right now, where we're sitting, is it actually did get passed through the House before, and this was before the last election, but you can see now the government split back again. So it is not currently, it doesn't really have much of a chance of being passed right now because of that. And you can see the last time they tried to add it into the reconciliation bill, and it lost pretty poorly there, 3-97. So if you want to go to the next slide. But just to kind of dive in a little bit more of what happened, and it's still out there. It's still, you can come back up. But at first, it was only audiologists that could be added to it. And what I just did, and this is really going through a lot here, guys, is it added us to be Medicare providers and to provide hearing evaluations and dispensing services. Also, hearing aids can be defined as prosthetic devices. And then, so beneficiaries be able to access hearing aid instructions. Yeah, so basically the same. So we can open up access. If you want to go to the next slide. So let's talk about the House bill did pass. And we were able to add hearing instrument specialists to that. Now there is a Senate finance bill, which is pending, but it's very unlikely to go through. But we also got hearing aid specialists added as practitioners and suppliers. It's just the terminology they use. And so that's pretty. Any questions about Medicare? No? It's something you want to keep your eye on. So if you go to the next slide. If you guys want to, you can go to this. It's a shortened website there. So there's advocacy page there, so you want to stay informed. And if you guys are IHS members, you'll get emails and calls to action, so we can spread the word and keep things moving along. So, all right, next topic is OTC. All right, who's tired of talking about OTC? I think when I joined IHS 6 years ago, it was like really the hot topic, and it's been drug out and drug out. I'm glad it's gone through now, and we're already there. So I don't think I have to talk a lot about this, what it is. You don't need a license. Anybody 18 and over can have one, and it's for people with perceived hearing loss. But there are a couple of changes that we've made. If we go to the next slide. So there was a period, I think it was 6 months, commenting period. And so they did make some changes, as you can see here. So they lowered the maximum sound output to 111 to 117 dBSPL. I think this one's really important. They revised the insertion depth limit to 10 millimeters as a maximum distance from the organic membrane, which we all know how powerful insertion gain is. And then all the hearing aids have to have user adjustable volume control. A lot of people want it reduced to AHHP only, and so it's requiring the manufacturers to have that. And then simplify phrasing throughout the device to make it easier for patients. All right, go to the next slide. This came up actually just around the last convention, so let's see what that's September. It was right around that time that there was a coalition. So IHS, we do work with all the other industry groups. And so there was a letter, and it was mainly had to do with, in the second paragraph, I'll just whittle this down for you. The language in the law conflicted with a lot of the state laws. And so what they're doing is they're updating the FDA laws for OTC to describe the difference between over-the-counter and what we will call prescription hearing aids. So that's a really important term you're going to start using, and I think it sounds great. Now, we do not prescribe hearing aids, okay? I want to make it really clear, because that's not our scope of practice. We don't prescribe hearing aids, but we do fit and dispense prescription devices, okay? So whenever you have people come in talking about OTC, or they have questions about it, you can start differentiating between the two, saying over the counter is what it is. It's over the counter, you don't need a licensed professional, it's self-fitting. And then prescription devices, you have to go to a licensed professional. So that's what we deal with. You know, I used to call them, you know, medical, because they were medical grade equipment. So I think that's a big takeaway there. You guys can take back to your practices right away. I can go to the next slide. So that's what I was talking about. They met, and so they would just send our concerns, and they responded. And that's what the next slide is. One last thing on the next slide, one more. This is important to have this link here, and I can make these slides available to everybody, and also there's information in the back there. But if you need to file a complaint, this is where you send it. And I don't think we should be shy to do that. I don't think we should go out of our way. It's legit, but there's certainly going to be issues coming along, and so we need to make that available to other people and to our patients. So next slide, again, there's advocacy for that. Any questions on OTC? Hey, you guys have all heard this. Okay, next one is Fit to Serve. Does anybody here work for the VA? Sometimes, okay. Are you guys familiar with Fit to Serve, what it is? It's a bill where basically it says in here there's 170 VA medical centers, but the number one health issue in the VA is hearing loss, and I heard the second one is tinnitus. So they're inundated. I think we all know that they're inundated with people who need help with veterans who have hearing loss, and because there's the backup there, and it's actually not just with hearing loss; it's many other things that you guys know about the VA. But this law was actually signed at the end of 2016, and there's also another bill signed in 2020 that allows hearing instrument specialists to work inside the VA. It's been a slog going through and working with the VA for them to accept and adopt this and integrate it into their facilities. You know, it's politics, and I know it's a lot of detail, but they had to put some hiring qualifications together, and they're not really sufficient so that everybody can work in these locations. But if you look at the bottom there, we actually finally, so we're actually seeing this come to practice, is you can see in some of these states down here, Arizona, Colorado, et cetera, where we are seeing job postings. So that's a pretty big, you know, leap. It's end of 2022, and this began in like 2015. So you can see how long it takes for these things to go through. Next slide here. This is important that, so when the federal government has national qualifications for hearing instrument specialists, it's the first time they've actually recognized our profession. If you look at the second one down there, it also then kind of paves the road for us to go to a community care program. I don't know if that's what you participate in, but that's where they can go outside of the VA and use their benefits there. So that's probably the next steps there that we're looking for. All right, next slide. I'm going to skip through the next few, guys, if you don't mind. It's pretty quick. Yeah. So there's advocacy. We have international standards. It's basically that's, I think you guys are familiar with that with like ANSI. And then next slide is donate. Of course, we're going to ask you to donate, but the money really does go to a good cause, guys. We have a staff of about 12 people. All they do is they work full time on promoting our profession and protecting it and everything you're seeing here. Such as, if you want to move to the next slide. One more. So who here has taken the ILE? You guys don't have to take it in New Jersey? Written the ILE, the International Licensing Exam. Oh, okay. I was like, really? Hey, believe it or not every state has adopted it. So there's like 45 states, I think, that have adopted it. But to prepare for that, if you guys have anybody in training, There's the trainer toolbox. So this is also for the trainer. There's a new trainer manual that's coming out. And it basically is just a collection of tools and everything for everybody to use and to prepare for becoming licensed. There's a new test prep. I think that's the next slide. Yep. This is actually very helpful. I've had employees take this, and so what they do is they take previously used exam questions and they put it on this online portal, and people can practice and take, it tells you your core competencies, areas that you need to work on. So you're not just going in and taking the written test blind. There's flashcards, and then there's actually now 2 practice exams, so you know right away how well you're doing. So I think it's like $89 for a month, but it's well worth it because you know the time that it takes to sign back up if you don't pass the licensing exam. Does anybody have anybody in training right now? One, yeah. So I highly recommend it. All right, next one. You guys might have heard about this. I have some information. The background of it, there's a tetanus care provider certificate program. They hold it a few times a year. I've heard really good things about it. It's basically just a weekend certification program, but it just allows you to learn more about providing tinnitus care, and you get that certificate at the end. I want to say there's been over 100 people who come through it now. So the next one is virtual. I think that just changed. Usually they did actually all meet up, but I think they changed it to this being a virtual, at least for this next one. So it's comes up at the end of January. Next one is the convention. It's going to be in Palm Springs next year in September. It's usually in September. All right, you can move on. And so here's one thing that people are usually confused about is NBC, HIS, and IHS are not the same organization. They're actually separate. But to confuse you even more here, IHS does manage NBC, HIS now. So they've kind of like married back up, but they're still actually separate organizations. They have different boards and everything. But in the past 4 to 5 years, to become board certified, there's a lot of really neat tools that come along with getting this. And so there's a branding guide. There's that, if you see that badge there at the bottom right, you can actually have a digital badge where if you put it on your email or on social media or anything, people can click on it and it takes them to ICE, which is International Certifications something, but it's a group that basically verifies your accreditation. You get a newsletter, then again, you get more tools to put that out there, because really this is the only other step for hearing instrument specialists is to become board certified. So if you go to the next slide, some people aren't sure about who qualifies. And actually, I just learned for myself, because I always knew that you had to be licensed and that you'd have to have a minimum of 2 years. I thought it was 2 years of licensure. It's not. It's 2 years of experience. So your training actually can still count too. So just keep that in mind. It has to be within the past 5 years, or in this, something you'd have to check with NBC HIS is if you have a diploma from an accredited program like this specific hearing instrument sciences program. You fill out the application. It's $225. I think is there an auction item?
Yes.
Yes. Okay, so they're going to be auctioning off a test taken here to schedule the exam. So one thing I do want to let you know is that they actually are updating this test, so I recommend you take it sooner than later. But along with this update, they're doing a new study guide. So that's going to be more helpful, but if I were you, if you're interested in getting your board certification, I would do this sooner than later. All right, next slide is just some quotes. Some people say, I know about it, I just know I need to get it done. It's one of those things that always kind of put off, but people are very happy once they do that. As long as if you go to the next slide, you use these, there's a really nice certificate you put on the wall. You get that logo that you can use digitally, like I said. So, all right, now we're going to jump back. I don't know why they're in this order, but You go to the next slide. These are some member benefits. We'll just blow through these real quick. It's 8:40, so. This is something new, and I'm embarrassed to say I don't know. I know that acronym. Is there a way that people say that, or do they say CAQH? They do? Okay, I could have sworn people, had a little name or a way to say that. Anyway, I guess hearing aid specialists can now use that ProView, and I'm not familiar with ProView, but I know this is a big deal. We were talking about it at convention, so this is something, if you can see this gal here, Samantha Sikorsky, she's really good in what she does. And so the next slide, she also helps out with compliance. So they put together this guide. I helped a little bit with this. I didn't have much to contribute. I have other people that work with me to do this kind of thing. It's its own world, billing for insurance and staying compliant. It is one of those things that doesn't matter until it matters, so you always want to make sure you're getting ahead of the curve there, making sure you're doing things correctly in your practice and you're billing correctly, because you don't want to be, like I say, on the wrong end of that where you have somebody come audit you, and she can help with that in case you actually do get audited. So that's another member benefit. Next slide, there's a group insurance plan if you're a member. So some people didn't have access to this, especially if they're just kind of a small owner operator. So that was helpful. And then next slide. Almost done. Basically, here's all the things that IHS does for you. So again, wherever you advocate or wherever you donate money or you become a member, you're getting a lot of things with it. Free CD transcripts for you guys, or if you're applying somewhere else into another state. You actually normally have to pay for that, but it's free with membership. So that's it. Does anybody have any questions? And I went through like a ton of stuff there, just blew through it. Go ahead.
I don't know if you know this, if I have the answer to this, so I know it's gonna happen, or we did have it, do you required?
So the federal law says that it preempts state law, but on a practical level, and this is what me and other owners, we've all decided that our state still requires us to have the FDA waiver signed, and so we're still doing it. But it's a choice. It's not actually required on the federal level, but the federal government is going to come and look into patient complaints. It's the state, right? So I would rather do things according to your state. That's what I recommend. Any questions? That was the first one of the day. You need more coffee, and I know this is the most exciting stuff, but I came all this way just to let you guys know this stuff really is important, and you really should get involved. If you're not, even if you have employees, there's other associate members that you can have. It's more important than ever to stay in the loop and participate whenever these things come up. So that's it. Thank you guys.
Okay, so, is Sandra ready, or we have a few minutes?
We have a couple minutes.
Okay,
yeah.
so we have a couple minutes. One of the things I want to remind everybody is that the people sitting out in the lobby are manufacturers and exhibitors are really one of the biggest ways that we can do, they contribute to you guys getting a great education. So on these breaks, please try to visit every table, talk to them, get the knowledge that you have. And I'm going to piggyback on Jordan a little bit. IHS membership is so important. Not only does it keep you up to date, but our contributions to them allows them to work for us in government. So he's here today, and it's a good time to renew your IHS membership. So take 5, and we'll come back to Dr. Prentice talking about open enrollment in just a few minutes. Yes.
Probably start traveling again, but I've been traveling again. Yeah, just about that. Yeah. Yeah, no problem. Yeah, it is. Yes, that's the only place in the city.
Yeah.
And it's a small little city, but, yeah, I mean, the whole country has represented them. I know. No cameras in this one. You hardly see it.
Okay.
We stay in on the street and one of the shopping and bar area. So that's what we take for that. Yeah, yeah. I hear the bars get noisy. Yeah. Later. Yeah, right.
Okay.
Yeah.
Like notifications. It's end of the year. So I got it. You know what I'm doing?
I don't remember.
Well, let's not go down. Where you headed?
Yeah.
Well, actually, in November, I'm gonna take my wife and son back to Vegas, and then we're gonna do, Haggard, Bryce, and then up to Canada. She wants to go on a cruise up to Canada.
This is Paula. You're in health.
Good, good.
Hey, and everyone's getting a good break, but, I wanna, well, it's set up to,
doing, looking, valuable. The idea of retirement, crossed my mind. So what I'm doing, I'm not. I've been really happy.
When they enter your
Might have said I could do it in an hour.
We'll find out. Look at, what do you say?
Well, she's inside of her head. What she will be. Okay. Bye, so I can see you. So you're like, I see the side of your. You can't see that. Can you see this? I'm gonna bring you up. Sideways.
Yes, I can see, yes.
Okay, I just removed you. Okay, you're good, so we'll bring it.
Okay, you can hear me, okay?
Yeah. Yeah.
There won't be once we head up. Yeah. So we'll bring you live in a couple minutes, Sharon, and I see her phone over there.
Oh, okay. Is it 9:00? Because what I call Google time, which is usually 10 minutes faster.
It's a.
Everything's weird. We'll pull you up around, a little bit closer to 9. All right, thanks. Bye. Yes. Andrew, do you want more coffee?
I'm good, thank you. I had 2 cups.
Oh, wait, you know what?
No, I love it.
Hi, okay, so, there, we'll bring you on, I have your presentation, so I just forgot to say, so when you want to change the slide, I say. On the next slide, I forgot to mention that, because I have it in the system, so. Alright. No, right, yep, I'm gonna have you, full screen, your, Sandra's gonna introduce you, you're gonna be side by side, and you're gonna bring you up full screen. And when you say, okay, I have a presentation, or you're gonna start. So then they can hear you, they can't really see, you know, I can see your hand. If you wanna like do the wand. That's okay, you can do as much as you want, but anyway, just, yeah, just like say, or, you know, so next we have this, whatever, you know. With some animation in there. Oh, okay. As a, PDF, because sometimes it distorts a little bit. Yeah, I mean, let me check. I'll give you know, I haven't, oh, where this is. Particular, because this is like a process, not Zoom. So. Take away from it. Okay, okay. Yeah, no. I like just saying, thought I'd throw that out there. Okay, cool, so you're good. Okay.
Are we ready to bring Sandy on?
Yeah, so what you're gonna do is I'll put her up next to you.
Okay.
And then you can see her and you can talk.
Well, I was just gonna introduce her.
Oh, yeah, nothing's cheap up there.
All right, we're going to get started with our second speaker. This is Dr. Sandra Prentice. She is an associate professor at the University of Miami in the Department of Otolaryngology. Her specialty is cochlear implants. And the reason I asked Dr. Prentice to join us is because I don't know if it happens to you guys, but I know cochlear implant candidacy is constantly changing, and when asked about it in our offices, sometimes I feel quite fumbly. So we have Dr. Prentice here to actually update us on cochlear implant candidacy, referral guidelines, and other factors that affect cochlear implants. Dr. Prentice, welcome.
All right, thank you so much, and thank you for having me. I absolutely love giving this talk, but as Sharon mentioned, it is very difficult to keep up with the candidacy as it's been really evolving rapidly over the last few years. So on the next slide, what I'll show you is this is our team. So we have a very large team of a number of different specialties. So we have physicians, we have researchers, we have engineers, audiologists, psychologists, social work. So it takes a village really to run a cochlear implant program. And it takes a lot of different people since the criteria have become so much more complex. So on the next slide, I just wanted to review some of the learning objectives that we have. Hopefully by the end of this talk, you'll be able to understand our current cochlear implant candidacy. Understand that we do have a referral guideline if you're ever in doubt. It's a kind of quick and dirty just to see if somebody might qualify. And then to identify some other factors that we consider when we're looking at cochlear implants that don't necessarily include the audiogram. But I think it's really important on the next slide for us to really understand the responsibility we have to manage people with hearing loss. So right now, over 40 million Americans suffer from disabling hearing loss. And disabling hearing loss is classified as or defined as anything that's 40 dB or worse. It is now the third most prevalent chronic health condition, that's following arthritis and heart disease. And this disabling hearing loss is actually projected to reach over 711 million Americans by the year 2050. So the hearing loss continues to go up. And on the next slide, what is especially kind of complicating things is that we're living longer too, which is a great thing. But as starting about the age of 40, 50, the hearing loss starts to exponentially rise as we get older. And the impacts of hearing loss is detrimental. So as you know from talking to some of your patients, when you have hearing loss and you're unable to really communicate with others, you can experience depression, social isolation, you stop going out, overall poor quality of life, loss of autonomy. And one of the other really important things is cognition. So as we age, the risk of our hearing loss goes up, but also as you reach the age of about 60, the risk of having some sort of mild cognitive impairment also rises. So this kind of goes hand in hand. And I wanted to depict this on the next slide that, hearing loss and dementia are highly correlated. So the risk of dementia increases with the severity of hearing loss. And hearing loss is the single largest modifiable risk factor for dementia. And so it's interesting to see severe hearing loss, and I have it circled at the bottom. With severe hearing loss, you are 5 times more likely to develop dementia. So then you have a number of other quality of life issues that go with hearing loss as well. So when we think about hearing loss and what it can do, the impacts it can have on your quality of life, we have to look at the treatments too, because it's not just the hearing loss, but if the treatments are ineffective and they're still not able to function very well with the devices that they have, then these detrimental effects are still present. So in the next slide, we really have about 2 main treatment options. We have the non-invasive, which are traditional amplification, regular hearing aids. If you have single-sided deafness, there's contralateral routing of signals, the cross hearing aids. And then of course we have the invasive options, which are cochlear implants. And for single-sided deafness, it's bone-anchored hearing aids or bone-anchored devices. The next slide is, okay, so now we have people that are treated. So with a hearing aid, how do we know if it's unsuccessful? How do we know when to transition from a non-invasive to invasive option? So one of the big things is, well, let's ask the patient, how are you doing with your hearing aids? But if you look on the next slide, we're seeing how are they doing with the hearing aids, but really people with hearing aids aren't utilizing them the way they're supposed to. And in fact, it shows that current estimates suggest that utilization rates are as low as 21%. And those that are buying new hearing aids there's a majority of them, those sales that are going to people who are already wearing hearing aids that are upgrading their technology. So you look at some of the reasons for low utilization, and as many of you already know, cost is a big issue. With over-the-counter hearing aids now, those things may change, but there's a stigma attached to it. Some people are in denial, and in fact, there's a study that shows it's on average a person from the minute they're diagnosed with hearing loss about 10 years before they seek any sort of treatment. So at that point, they've progressed, and now we have the risk of auditory deprivation. But some of the reasons that people are not using their hearing aids are the lack of perceived benefit. So, okay, so if you're not benefiting from a hearing aid, then you know what, maybe that's when we move towards a cochlear implant. And on the next slide, there's a number of, I'm going to have you go just one more slide forward. The benefits of cochlear implants. There's a large number of benefits with cochlear implants. In fact, it's a 2020 study of the Medicare patients. The median improvement was about 53% for speech recognition in the implanted ear over the hearing aid condition. And Medicare just recently, within the last couple of months, after about 30 years, has expanded their criteria to include people with lesser degrees of hearing loss because of this benefit that we're seeing. So in a more recent study, over 400 cases are showing that a large majority of people are getting a benefit from a cochlear implant over a hearing aid. So we would think that, okay, well, cochlear implants there's a documented evidence for the benefit. And so really we would think that maybe that's why people aren't using hearing aids. They're moving towards a more invasive option. But if you go on the next slide, then what we see is that the utilization of cochlear implants in the US is actually quite low. So if we go back to what we were looking at, about 40 million people with hearing loss in America, and those that have about a severe or profound hearing loss is about 2 million people. And then as of 2019, there are about 118,000 that have received a CI. So that's a less than 10% penetration rate for cochlear implants. So I think largely what we can see here is that hearing treatments are grossly underutilized in general. So if we look at some of the reasons for low utilization on the next slide for cochlear implants, is that there's low referral rates. There's a lack of a clear referral pathway. So when I've talked to some of the hearing aid audiologists in the area, they don't know what to do once they do have a patient that they may suspect could benefit from a cochlear implant. There's no contact person or someone to really get them in the door. And one of the things that I've spent a lot of time researching this myself and looking at, some of the referral issues, and some of the audiologists that I've spoken with, they have a lack of familiarity with guidelines. And this is not just among clinicians, it's among consumers too. So if the general public is not aware of it, it's very possible they just don't have the impetus to know when to ask if another option other than hearing aids is appropriate for them. And then one of the clinics that I spoke with said that she doesn't make the referral. She relies on the physician to make the referral. And we know that the physician is the number one influencer on all hearing healthcare decisions. So if they're not familiar with the guidelines, or if they don't necessarily think that a cochlear implant would be beneficial, they may not refer. And so the patient will likely listen to a physician over anybody else. And another reason, on the next slide, there's some common misconceptions about cochlear implants, is that insurance does not cover the surgery, which indeed they do. Every insurance is very different. The private insurance does have different guidelines than Medicare, but those are the things that we look at on a case-by-case basis. But insurance indeed does cover the surgery. I've had some patients tell me that they think that the surgery involves this complicated brain surgery, which, I mean, it's definitely an invasive surgery, and they do make an incision and drill into your temporal bone, but it is an outpatient surgery, and people do go home that day with very little recovery time required. And the biggest one that I've heard is, cochlear implants are only for patients with profound hearing loss, which was the case several years ago. But now things have changed and things have changed rapidly. So it's hard to keep up with some of those guidelines. I've had some people say, well, age, my patients are too old for a cochlear implant, which age is no longer a factor. It used to be, again, a long time ago, but now we see that those with that are geriatric can benefit, and it's still safe for them as well. And in fact, my clinic is mostly adults and mostly geriatric. I live in South Florida, so we have quite a bit of an older population, but there's definitely, I would say the average age of my patients is about 75 to 80. So, and one of the other things that patients are afraid of is that patients will lose all of their hearing following surgery. And there is a risk that they'll lose the residual hearing on the ear of implantation, but that's not always the case anymore. In fact, we've been able to have new techniques to preserve their hearing. So if we look at this evolution and why this is so difficult to keep up with on the next slide, so cochlear implants have been around for approximately 30 years. And if you can advance to the next slide, I can show you a table of when this started back in 1985. I don't know if you can see the table. I still see that it's on common misconceptions. There we go. So this started about 30 years ago, and the criteria was that you are an adult, 18 years or older, you're post-linguistic, profound hearing loss, so no hearing whatsoever, and no ability to understand speech. So by 1990, 10 years later, they're like, okay, this is all right. Well, now we can do kids and adults. So they lowered the age to 2 years. But really from 1985 to 2014, the criteria kind of moved, but very incrementally. So by 2014 or by 2000, it was still moderate to profound sensory hearing loss in both ears. But now we can include pre and post linguistic patients. So the speech scores have also, as you can see, they went from 0% to less than 60% in the better ear in 2000. But really starting in 2014 is when we see the biggest jump and the rapid increase from 2014 till now. The criteria continue to change and change and change. So with the newer techniques that we've had surgically and the design of the electrodes that are slimmer and more flexible, they don't necessarily damage the hearing. And now we can have patients that have preserved hearing even after a cochlear implant. And, there's several studies that have shown the benefits of having both that acoustic and the electric input. And even up until 2020 is when we see that now the age has moved down to 9 months. And 2022, we have 2 companies out of the 3 now that are approved for single-sided deafness. So those with unilateral hearing loss, asymmetric hearing loss, and single-sided deafness with normal hearing on the one side are candidates now for a cochlear implant in the poorer ear. So what this allows us to do, the different kind of hearing configurations, now that we've had these different techniques and these different types of hearing, on the next slide, this expanded cochlear implant criteria shows us there's different ways that we can hear, and all 3 companies in the US are offering this. So there's acoustic and electric hearing, which is you have an acoustic signal and an electric signal in the same ear. So the idea is that we preserve the hearing in the lower frequencies, and they can use a hearing aid to help amplify that. And then in the higher frequencies where the hearing aids can't amplify as well or effectively, that's where the cochlear implant comes in. So you do this by using a hearing preservation electrode, which again, are small, they're thinner and more flexible, and they're long. They're not necessarily the short electrodes anymore where this started back in 2014. They're a standard size electrode. So in the event that they do lose their hearing, even later on down the road, in cases of progressive hearing loss, they can still utilize that cochlear implant as a standard cochlear implant. And for the next slide, another hearing configuration is bimodal hearing. And so this is acoustic hearing on one side and electric hearing on the other. So you have cochlear implant on one side, hearing aid on the other. All companies, again, offer some sort of option for this. Cochlear has recently partnered with Resound. So cochlear recipients can receive a Resound hearing aid at a discounted price, and that Resound hearing aid and the cochlear processors work with the same accessories, the same streaming accessories, so that they can have streaming to both ears. Advanced Bionics is a sister company now with Phonak, and they have developed a hearing aid that works with their cochlear implant. And then Medel has a number of options that they're not limited to one brand of hearing aid, but all of this offers bilateral inputs to both ears, which we know 2 ears are better than one. So on the next slide, this is why it gets confusing, right? So we have, historically, we've always relied on the audiogram to determine if the cochlear implant might be beneficial because it was really just severe. But now if we look at the criteria and we plot it on the audiogram, you can see that a cochlear implant can cover the same types of hearing loss that a hearing aid can cover. So this can cause a lot of issues when knowing when to refer, when is the best time to refer for a cochlear implant, because now we have criteria that are overlapping. And so we can't just look at pure tone thresholds anymore like we used to be able to make that referral. So on the next slide, what we know from the audiogram now is that there is no predictive value for the post-treatment benefit. So we can look at an audiogram, not just the pure tones, but also the word recognition score. So we used to be able to look at the unaided word recognition score and say, well, they have, less than 20% or less than 50%, they will likely benefit from a cochlear implant. Well, really, there's no predictive value of those unaided word scores to the post-operative aided benefit. So in fact, Dr. McCracken and his group did a study that just showed that sometimes the unaided word recognition score is better than the aided, and sometimes it's worse, but really there's no predictive value. And more importantly, as we all know, the number one complaint of people with hearing loss is the ability to understand speech and noise. So looking at an unaided word recognition score doesn't give us really any idea of how they're doing in their real life settings. And it's not common practice or routine to test speech and noise with a hearing aid. We've never really done that before. So it's hard to, make any inferences off of just looking at an unaided audiogram. So on the next slide, so what do? How do you know when to refer for a cochlear implant evaluation? So it is really difficult. And just looking at an audiogram, as we mentioned, it's very difficult to just make any sort of assumption that they will or will not benefit from a cochlear implant. So Dr. Zwollen and her group on the next slide came up with a 60-60 referral criteria. So what they did is they looked back at, it was a retrospective chart review, and they reviewed hundreds and hundreds of charts of patients who that were able to get a cochlear implant, and they looked at the unaided audiogram. And what they found is that those that were presenting with a pure tone average of worse than 60 dB at, the 5, 1, and 2, and they had an unaided monosyllabic word score of less than 60% in the better ear, that they would likely meet cochlear implant criteria. In the traditional sense, obviously not the SSD or the asymmetric, but in the traditional sense, if they meet these two guidelines, then when that's used, they had a 96% detection rate and 34% false positive rate. So, and granted, you can't just look at the audiogram, you also have to ask the patient, are you doing okay with your hearing aids? And if they are, obviously a referral is not appropriate. But if they're saying that, I'm not really doing that well, I don't feel like it's benefiting me much, their quality of life is declining, then a referral would be a good idea. So this is something that you can use in your clinic if you're having a difficult time with a patient, not knowing when to refer. Just kind of look at that, and you can always make the referral. It doesn't necessarily mean that they are signed up for surgery. It doesn't mean that they will qualify, and it doesn't mean that they will, even if they do qualify, that they will go forward with it. So that's just kind of a way to screen your patient to see if they might fit cochlear implant criteria. But with cochlear implants expanding and the criteria expanding, and it's requiring a lot more than just the audiogram. So on the next slide, you can see that when we determine candidacy, it is far more than just speech recognition in the audiogram. So we need to understand their medical history, their hearing history, their goals, their lifestyle, their demographics. You know, do they have the family support? Do they have are they able to get to the clinic for follow-up and things like that? So on the next slide, you know, it really just required an audiologist and maybe a surgeon, because all it took was a medical examination, imaging, and maybe just to make sure they have an ear, and an audiology exam. But now there's so much more that's involved in cochlear implant candidacy criteria. So it's not just the medical exam, but of course there's still imaging is very important. The audiological exam, which isn't just the pure tones anymore, it's a lot of testing with their hearing aids. There is genetic testing now, especially with the kiddos that are coming through with hearing loss. We'll do genetic testing. There's a speech to language evaluation that's necessary. As we mentioned before, you know, with the increase in age of risk of hearing loss, there's also risk of cognitive impairment. So we do have cognitive screeners now that we conduct, and all of this is just to help us more with counseling. With cognitive testing, you know, one of the signs of cognitive decline, even if you don't have hearing loss, is your inability to focus and understand speech and noise. So, so we use that very diligently when we're counseling on realistic expectations. We do have psychological exams if somebody is expressing any sort of stress or anxiety, depression, that's maybe beyond that of the hearing loss. Then we do have a psychologist on our team. We do quality of life questionnaires, making sure that we can get an idea of how they're functioning, how they feel like they're functioning in their present situation. And we do counsel a lot on realistic expectations. So before, you know, when it was just profound, we would counsel and just say, hey, you know, if you get sound awareness, that's great. Now it's, will you understand speech? How much speech will you understand? What's the sound quality going to be like? So we do spend a lot of time on that. So on the next slide, with all of those kind of things that we take into consideration, the cochlear implant team needs to be large and obviously multidisciplinary. So these are all of the team members involved, and it's not just professionals. So we do have some advocates that, you know, previously implanted peers. So those who are thinking about it, we can put them in touch with somebody who has been implanted just to talk about their experience. Family members and caregivers are an integral part of the cochlear implant team. Make sure they have the support. And again, you know, can they get to their appointments effectively? Because it's become so difficult, and there's you know, so many different ways you can evaluate. The next slide, the American Cochlear Implant Alliance has pulled together a few of us to really go through some guidelines of what should be involved in a cochlear implant evaluation. So myself and some of our other colleagues are coming up with some of the guidelines and testing that should be done once they're referred, just so that we can make sure we're looking at the whole patient and not just their audiometric profile. So what happens in a cochlear implant evaluation on the next slide is it's a extensive case history and needs assessment. So, you know, what are their goals? What do they want? what is their need for this. We do a hearing aid verification. So when they come in for testing, we'll do some real ear measurements just to make sure their hearing aids are fit. And if they don't have hearing aids, or if their hearing aids are very old, we do have stock clinic hearing aids that we can put on their ears for the purposes of testing. The aided testing is extensive. We do a lot of testing with words and sentences, which I'll show you an example of in just a minute. But the most time consuming is the counseling for the patient, counseling for the family members on realistic expectations that, this is, although cochlear implants do show a lot of benefit, they're not perfect. They're not restoring hearing back to normal. They're still, hearing and background noise is still going to be an issue. While improved, they'll still have some time. So there's got to be that expectation that if you go into a crowded restaurant and you're sitting at a table of 10 and there's music playing, that you're not going to be able to follow every single conversation that's going on. So on the next slide, this is after we verified the hearing aids, this is kind of the setup that we have. So we have a speaker. I'm not sure why she's making a thumbs down, but maybe because a lot of people get frustrated during this kind of testing, but they're seated at 0 degrees azimuth, about 1 meter from the speaker. They have hearing aids in. If it's single-sided deafness, we do spatially separated, where it's at 90 and 270 versus 0 and 180. And we do have the ear plugged or muffed on the other side if needed. And so what's involved with the speech testing, so we have on the next slide, the minimum speech test battery. There's the AZ Bio sentences in quiet. It's 4 voices, 2 male and 2 female. And the way we score it is, so they'll read, I could hear another conversation through the cordless phone. If they miss 2 of those words, then we mark those incorrect, and how many words they got correct out of the total. And then we after they finish all 20 sentences, then we score up a percent correct. We also do this same test in noise. So the noise is a multi-talker babble. It's like a cocktail party. We put that either 10 dB or 5 dB below the target, and to determine how do they understand speech and noise, and we calculate it the same way. So the next part of it on the next slide, this is the CNC word test. So we do this with hearing aids, and we just mark how many words they get correct. So for instance, on the first one, if the word is goose and they said moose, we give them credit for 2 of those phonemes. And then we calculate how many words they got correct and how many phonemes they got correct. And if you look closely at that other table, so the candidacy criteria has kind of started moving towards this score over the sentence scores. The sentence scores are still very important for us to use as realistic expectations, but the word scores are isolating more of that auditory capabilities versus the sentences, especially in noise, require a lot more higher executive function and processing. So if there is any cognitive impairment, we want to make sure that we're treating the hearing loss and not trying to treat something that is non-auditory in nature. So on the next part, so we have averages of how these patients will perform. This is a paper that was done by Dorman and Gifford. And what we see is that in as average cochlear implant user, so this is, another retrospective chart review of several hundred cochlear implant users. And if you look at the quiet score, they're near normal. Their ability to understand speech in quiet is near normal at +10, while somebody with normal hearing will get about 100%. Those with a cochlear implant average around 50 to 60%. So, and then obviously when the noise becomes louder, that score will go down. So these are kind of the averages over time. So this is what we like to show them ahead of time, that, even with a cochlear implant and surgery, it does not mean that you're going to have 100% word understanding, especially in noise. So we do counsel very conservatively, and a study by Dr. McCracken had shown that those that were set up with lower expectations at the preoperative evaluation demonstrated a higher postoperative quality of life. So we want to keep those expectations in check, because if we set them up for really high expectations, and even though they're noticing improvement and we can document an improvement, if it doesn't meet their expectation, they may not feel that their quality of life has improved. And so we can capture some of that on the next slide with some of the subjective questionnaires that we do. We do the SSQ, we do a cochlear implant quality of life profile, just to really gauge how they're doing. So we do that preoperatively, and then at 6 months and 12 months postoperatively, and then once a year after that. Another one that we do is a mental health screener to kind of gauge how their mental anxiety and depression. So if it's a certain, it's just a screener. So if they score a certain number, if it's scoring high, then we will refer them to outside resources for some management of that. And then, of course, as we mentioned before, there are cognitive screeners that we do just to see where their cognitive function is. It gets a little hairy. We're not, obviously as audiologists, we don't have the scope of practice to diagnose anybody with anxiety, depression, or cognitive decline, but we can use these screeners and say, I can tell you that the score is just a screener. It's above norm. It's above what we would expect. So we just would refer outside for that diagnosis and a more thorough evaluation. So I wanted to go over some cases of patients that we've seen in our clinic. So on the next slide, this is our first case. It's a EAS case, meaning that it's an electric and acoustic stimulation. The patient was 58 years old. He had a long-term sensory neural hearing loss. He had been wearing hearing aids for about 17 years, 20 years at the time. Very active. He owns his own company. His hearing aid audiologist had told him that his hearing is too good for a cochlear implant. And he kept coming in for testing, or he went somewhere for testing and saying that he was scoring too well for a cochlear implant evaluation, but yet he is still complaining that he can't function very well at work. He can't hear on the phone or in meetings, and it's really impacting his quality of life. So what we discovered when we talked to him is that when he underwent a cochlear implant evaluation, they did some testing with aids, but they did the older testing, the hearing and noise test, which is no longer used because of the ceiling effect, that too many people were scoring way too high and we couldn't measure improvement anymore. So that's when we moved to AZ Bio. So when he came in, on the next slide, you'll see that this is his audiogram. So he has pretty good low frequency hearing and profound high frequency hearing. So even with the best fit hearing aids, we know that they're not going to be able to touch those high frequencies to bring him into a good audible range. And so when we tested him, we tested his monosyllabic word score. So again, we score both on words and phonemes, and he scored really quite poorly, only understanding 38% on the left side, and on the right side, he was understanding 44%. When we looked at his sentences in quiet, it was 68% and 81%. And, 81% is pretty good, but if you look at his case history, he's not in quiet. He owns his own company. He's very active, and he's around noise. So that's not really a good gauge of how he's performing in his real life. So if we put him in the most complex noise condition, which is likely what he's experiencing on an everyday basis, his scores go all the way down at the very bottom line there to 31% and 45%. So it was definitely, at this point, we decided that, if he's motivated and he's ready and he wants to give it a shot, then he definitely meets candidacy criteria. So on the next slide, we'll look at his pre-op. There's his audiogram on the left side, and then his post-op. So he was implanted on the left ear. He did lose some hearing, but it is still functional for that electric acoustic stimulation. So he was able to wear that hearing aid, and it's like a hybrid device. It has a hearing aid and a cochlear implant on the left side. And on the next slide, we'll show you a little about how he's hearing now. You can see that the left side, the hearing came up just a little bit, but when we test him at initial activation, oftentimes they still have some blood behind the ear. So he's still, he's recovered a little bit, but still not to where he was preoperatively. But you can see his improvement. So his pre-op is depicted in green. His word scores, his sentences in quiet, his sentences in noise. The biggest improvement, as you can see, and this is at 3 months, he was at about 35% and the left ear, and 3 months later at +5, he's at over 60%. So definitely benefiting from that. And for our next case study, so, you know, this is the newest criteria. So the cochlear implant for single-sided deafness. This has been recently approved. It does help with localization. It's not something that they can localize as well as somebody with normal hearing, but they do definitely get a little bit more direction. It has been shown to help with some tinnitus perception. It doesn't cure it. And if somebody comes in and says that they want a cochlear implant for the sole purposes of improving their tinnitus versus improving their hearing, it's a different conversation. But with a cochlear implant for an SSD, that we do continue to see these same benefits that we do for bilateral hearing loss, and that's improved quality of life and a subjective benefit. So just as a review on the next slide, MED-EL, their indications are they have to be 5 years and older. They have to have less than 5% on the CNC word test, obviously in the ear to be implanted. They do need to have some sort of amplification trial, which is usually with a cross device. And cochlear, they were just approved for pretty much the same indications, but just this year. So this is kind of what the hearing loss would look like. They have completely normal hearing or near normal hearing on the one side, and then profound hearing loss on the other. So when we look at a case, so for case number 2 on the next slide, we have a 52-year-old male. He had a history of head trouble from a motor vehicle accident. So he's had 40 years of duration of deafness on that right side. So it's one of those things where we're going to counsel him very differently than we do somebody who has a progressive hearing loss. He's been deaf on that side for 40 years. There's auditory deprivation has set in. So our counseling at this point may be, you know, you might get some sound awareness on that side and a little bit of direction, but understanding speech on that side will probably continue to be very challenging for you. So his preoperative, you can see in the green box in his right ear, he didn't have a response to word recognition scores, and that is, I'm sorry, that's unaided pre-op score. On the next slide, we'll see his preoperative. They did put a hearing aid on that side just to see if there's anything that could be improved. There was 0% understanding with the left ear masked. We did do a promontory stimulation just because when we do aided testing, even though we verify it, sometimes we'll do a functional gain, and he didn't even show any responses to the hearing aid. So we want to make sure that the nerve is still active or viable for a cochlear implant. So despite his history, he decided that he wanted to go ahead and go through with the cochlear implant. And in the box below, you can see his scores. So he went from 0% to 26% in quiet, his CNC words on a list of 25. We typically do 50, which is all the way to the right. He improved from 0% to 24%. So this is a very different, but you know, still the expectations were that he might get sound awareness. So the fact that he has some word understanding is really impressive. So that I just wanted to show you a case of single-sided deafness. And then of course I have just one more case. This was one of my patients that I saw recently. He was 81 years old. His etiology, he believes that he was born with some hearing loss, and then over time it's progressed due to noise exposure. He was in the Navy. His main complaints are his difficulty with television, telephone, and in small groups. And this was referred to me from someone who had used the 60/60. So as you can see from 5, 1, and 2, the pure tone average is 60 dB or worse. And the word recognition score in the better ear is 60% or worse, and in the poorer ear it's 48%. So they referred him for a cochlear implant evaluation. So I performed this on the next slide, and here are his scores. He did qualify for cochlear implantation on both sides, but what ultimately, so in quiet, he's scoring right around 60%, and in noise, what's interesting here is in noise, if you look at his +10 score and his quiet score, they're really about the same. So when I see something like that, it tells me that maybe the testing is more testing his memory and cognition versus his auditory abilities. So when I was testing them, if you listen to the AZ bios, they're very quick. And so he said that a lot of times he would hear the sentence, but he couldn't remember what they said. So that's why his scores look really the same. But so we counseled, and I was really trying to get an idea of what does he want the cochlear implant for? He ultimately chose not to proceed because really, when we tell them that you do have to do some listening exercises, it's not something where you just put, once you get activated, you hear and that's it. It's, it takes time for your brain to adjust to that new sound. And he admittedly said he would not do listening exercises. And after talking with him more, he's like, really, I just want to hear the television better. I don't interact with people. And I asked him, do you not interact because you can't hear? Do you not interact because you just don't want to? And he basically said that he doesn't like people and he doesn't want to interact with them. So we decided that maybe a cochlear implant isn't the best for him. Just looking at his lifestyle, I don't think he would have really gotten a lot of benefit from it. So I referred him back to his managing audiologist, his hearing aid audiologist, and they had fit him with a new set of hearing aids, a little bit stronger hearing aids, and some streaming accessories for the television. And just recently we found out he's doing actually quite well with that configuration. So the cochlear implant isn't for everybody. So what I'd like you to take away from this is that no referral is a bad referral. So if you see a patient that, think about your patient and they are constantly upset with their hearing aids or anything like that, you can refer them and they can at least learn about the devices and see if they even meet the qualifications. And just by referring, it doesn't mean that we know they're going to meet candidacy, and if they don't, it's okay. At least we have the information now, and at least they know that they're with the best that they work with, and that's their hearing aid. And having them undergo all of this testing and all of the subjective questionnaires, all of that doesn't commit a patient to surgery. So a lot of, just as I showed you in that last case, we went through all this testing, we went through extensive amounts of counseling, and he decided not to pursue surgery after all. And it's that's perfect for the patient. Every patient is different, and we look at them all differently and individualize their plan. So on the next slide, what if your patient's not a candidate? Most patients find a CI evaluation very helpful, regardless if they meet candidacy. So they just learn a little bit more. Again, like I mentioned earlier, there's a lot of places that aided testing is not part of the routine. And when you're in a busy clinic, you can't just be testing everybody all the time and doing this extensive testing on them. We've got busy clinics, we have a lot of patients to see. So it isn't a part of that, but this at least gives them, when they're referred, they get some insight to how they're performing and what we consider a good candidate and what we consider, they might benefit or not benefit. And if they're not a candidate, we refer them back and we give them back to their managing audiologist and say, you can work with them about hearing aids or assistive devices. But what we don't want you to do is if you see a patient that has, something like severe to profound hearing loss and really, just looking at the audiogram, we know that the cochlear implant or the hearing aid may not provide benefit. You don't want to say, well, let's just see if they work first, and then we'll refer you. If they've been trying hearing aids for a while, and you've tried several different sets of them, several different configurations, several different levels of technology, probably if it's not working, it's not working, and it's maybe time to refer. A cochlear implant is no longer a last resort for treatment. So it used to be where you just had nothing left, but now it is a great effective treatment to mitigate some of those, especially precipitously sloping hearing losses. So it's not necessarily something that's meant to, there's nothing else for us to do for you. We can intervene a little bit quicker now. And if you're not sure if a patient is clear cut, then just ask a CI team, or ask somebody who's working with them. And maybe, I've had several people send me pictures of audiograms, and I've had discussions with them, and we'll just talk about it and see if it's an appropriate referral. And again, it's not just based on the audiogram, like, your patients too, if they're willing to do the work to make sure a cochlear implant will be successful for them. What you don't want to do is assume the patient is too medically involved for a CI. I don't see a lot of the kids, but we have multiply handicapped children that are successful with hearing aids, with cochlear implants, and that's not for me to decide. That's for the surgeon to decide if they can sustain the surgery and make the most of it. And then lastly, you don't want to assume that a patient is too old for a CI. So with the criteria, the expanded criteria, just to kind of sum things up here, the CI criteria has expanded to, on the next slide, for those with more residual hearing, shorter durations of deafness. We can implant all the way down to 9 months of age now. We do testing in noise for candidacy versus just looking at the unaided word recognition score. Single-sided deafness, asymmetrical sensory neural hearing loss. So even if they have a mild hearing loss on one side, but maybe a moderate to severe hearing loss on the other, we do test the ears individually to look at the benefit with the hearing aids. So, and fluctuating hearing loss, this one's a little bit more tricky, but with the cases in Meniere's, if we see one ear is, completely gone from Meniere's and the other one is fluctuating, we may consider implanting, obviously, the ear that's bottomed out. So if the other one is fluctuating and then eventually bottoms out, then they're not completely deaf. So a lot of the criteria has really expanded to almost anybody who is reporting to you that they're just not doing well with their hearing aids anymore. And as I mentioned earlier, it's not for everybody, and we can certainly look at the whole patient. We're not just going to judge them based off of, even if they meet candidacy, are they willing to put in the work? Are they, do they have realistic expectations? Do they have the support to do this? So in conclusion, on the next slide, the CI evaluations are very complex, not what they used to be. It's more than just the audiogram. It's the entire patient we have to look at. A skilled team is really necessary to manage the whole patient. So even if we can improve some of the hearing, if there's, we need to make sure that, for some of our patients that are having a hard time at home or whatever, we have a social worker to help mitigate some of that. So we want to set them up for success. So it is an excellent treatment option for those that are really continuing to have issues with their hearing abilities. And it is something that we can continue to work towards to improve their quality of life, which is really the goal of what we're all doing here. So my references are on the next slide, and I do want to thank you for listening. I have my emails listed on the next slide if you have any questions, or if you want to contact me for anything, I'm more than happy to correspond with you. So I'm not sure. I can't hear anything. There we go.
I was asking about bimodal patients and referral where we would get our patient back for the bimodal fitting. And how do we communicate that with our referral?
Yeah, so if somebody comes in and they are a bimodal hearing aid fit, if you work, so for instance, if we use Cochlear, for example, we will do the cochlear implant, and then if you work with Resound, we would give you the order form so that they can order it and they get the discount through Resound because they have a cochlear device. And then what we do is once we do have to link them up in the cochlear implant software. So we just have to tie the hearing aid and the cochlear implant together. But then once that's done, they can go back we would refer them back to their managing hearing aid audiologist, and they can have the hearing aids program there.
So you actively would refer back to the referral source that sent them to you to begin with?
We often will. Now, it is some of the patients don't necessarily want to go to two different places, but we do encourage them, if they're having a hearing aid issue, then we do encourage them to go back to their managing audiologist for the hearing aid part of it. But if they're in the clinic and I have to balance the two, I do manipulate the hearing aid from time to time just to, if they're there and if the hearing aid is now too soft because of the mapping changes I made. So we try to refer them back all the time, but if sometimes it's easier for them to just be getting services at one spot.
Yeah, I certainly understand that.
Yeah.
I wonder what you think of the choices that the patient has for bimodal options, as far as one company seems to have a lot more options, one or two, than one of them does. Do you prefer one over another because of bimodal? Or when a patient would probably be bimodal?
And I think to make sure I understood your question. So you're asking if, based on the implant company, do they have more options with one implant company versus a different one for bimodal?
Mm-hmm. Yeah.
Yeah. So really, with Cochlear, they just have Resound. With Advanced Bionics, they only have Phonak, and it's just one hearing aid that works. And then for Medel, they have a number of different options because Medel isn't tied to one company, but the hearing aid has to be specific in that it has to have the capability to connect to an Android phone, and it has to have some Bluetooth. So it's limited. So when somebody is choosing a cochlear implant device, we do leave that mostly up to the patient with guidance. So we will ask them about their lifestyle. So for instance, a lot of my patients who are older, they can't really, some of them don't even have cell phones. So having all these other accessories for a cochlear implant is something they're not going to use. And so in that case, if, an Advanced Bionics and they choose the Phonak hearing aid as an accessory, so they're not even, that it doesn't even, there's no out-of-pocket cost for the hearing aid other than a fitting fee, but it comes as an accessory. So those are the kind of patients that I would say, all right, well, you don't need all these other accessories. So, but there are more options for Medel to have different types of hearing aids to work with bimodal with different manufacturers. It is a little bit tricky to find the right one and to make sure that it works with to make sure it's compatible with their streaming devices.
Yeah, have you had any experience with patients who have mixed hearing losses where the bone conduction has started to deteriorate, such as otosclerosis, or patients who have had a history of middle ear fusion, but now the hearing has gotten worse for air conduction as well as bone conduction?
Absolutely. So we have quite a few that most of the time it is from otosclerosis that they have these severe mixed hearing losses. We do take a very close look at their bone scores. If their bone scores are still kind of following that of a, you know, moderate to severe hearing loss and their air scores are you know, severe to profound or something like that. We definitely do have quite a bit of experience with cochlear implants in that case. If the bone scores are still well within, you know, something that maybe a BAHA can manage, then we do talk to them about their different options. Otosclerosis, as you know, is very tricky when it gets to an advanced stage, and it's, you know, oftentimes they'll have 2 failed stapedectomies at that point. That there's some ossification there, so it can get pretty tricky with a cochlear implant. We do counsel them a little bit differently.
All right, well, thank you very much for joining us today, Dr. Francis. We will have all of your information available, so everybody can contact you whenever necessary.
Sure. Thank you so much for having me.
We'll talk soon.
All right. Bye-bye.
Okay, we are going to take about a 5-minute break again. Please visit the exhibitors, take some time to use the restroom. And also I wanted to mention 2 things. For our virtual attendees, you are welcome to ask questions as well. Please send them to our website or our email address, which is njahhp@gmail.com. It should be on all of your invitations. Also, our association has a silent auction in play. So there's information for that on the back table, I believe, or let them know. And it's going to be going for a couple more weeks, so definitely take a look at that. And we'll be back in about 5 minutes.
Well, I want you, let's.
It would ring on my wrist. Is my,
guys hear me?
Yeah.
Awesome. Absolutely.
No, it'll ring on my wrist. I see it. It's down there. Yeah, my phone's on silent.
Okay.
Great. Welcome back from break, everybody. Our third speaker for the morning is Sherry Eberts. She is a hearing healthcare advocate. She is an author. She will be having a book signing outside of here when she's finished her talk. Her book is called Hearing and Beyond, Live Skillfully with Hearing Loss. Sherry's going to help us have a better understanding of living with hearing loss, so we have a better understanding of how to help our patients, give them better care, and understand their path a lot better. She also has a blog in a community, living with hearing loss. And she is a producer or an executive producer, right? We Hear You, which is an award-winning documentary about living with hearing loss. So on to Sherry. I hope I didn't go to your credentials too much.
Well, thank you so much. It's great to be here with all of you this morning. Thank you for that warm welcome. So like Sharon said, I'm Sherry Eberts, and I'm a hearing health advocate and also a hearing aid wearer. So definitely here today to discuss that perspective, which I think is one that is often missing at conferences. So very excited that it's being included in this one, so thank you for that. So I'm excited to talk to you today about patient-centered care from the person's perspective with hearing loss. And I plan to tell you a little bit about my hearing loss journey, try to explain as best I can the experience of what it's like to have hearing loss, share some of my experiences with hearing care professionals over the years, and then lay out my formula for person-centered care from the patient's perspective. And throughout all of this, well, are we gonna put the slides in? But the worst part of any presentation is like the technical slides and the videos, so thank you for bearing with us on that. And then throughout the presentation, I'm going to share some case study examples to highlight some of the common pitfalls that people fall into. And then, of course, some questions. And then there'll be a second presentation that will be more from the patient, a different point of view from the patient, but sort of the skills that the patient needs to use in order to live well. So the first part is sort of the skills the practitioner needs to do to help the patient, and the second is sort of how we help ourselves. All right, so let's get started. And I'm gonna go to the next slide. And I thought I would start off and just tell you a little bit about my hearing loss story, because I think that every story is powerful, and it's just so important just to give you a little bit of my perspective. So my hearing loss began, I noticed it when I was in my mid-20s, when I was in graduate school. And pretty quickly into the first semester, I started missing things in class, right? Maybe somebody made a joke, maybe there was a comment that was made as an aside, and I would be left looking around the room, trying to figure out what was so funny. And I knew what was happening. I knew that I was developing hearing loss. My father had developed hearing loss as a young adult, and his mother had as well. And I had been hoping that it would skip my generation, but obviously no such luck. And I felt like I was entering a path that really had no escape, and one that had really destroyed a lot of my father's life. So I was terrified. I went to get my hearing tested, and I don't remember much about that first appointment other than the diagnosis, which was mild hearing loss. It's too slight to do anything about. Monitor it and come back later. And so this gave me the perfect excuse to just ignore and deny and pretend that I didn't have an issue, even though I did. But as the years passed, I noticed that I was having trouble hearing at work, and certain clients were giving me lots of trouble. And as I suspected, I needed to go back to a hearing care professional. So I did, and this time it was recommended that I get hearing aids. And I was really devastated. The stigma surrounding hearing aids was very, very strong in my home growing up. My father did anything that he could to hide his hearing loss. It was an unmentionable topic. And eventually he became very isolated and withdrawn from everyone in his life and in the family. I remember family events where he'd be sort of off sitting at a table by himself with his back to the festivities. And I remember as a child, I went up to him and I said, "Why are you sitting here by yourself at the party?" And he said, "When people want to talk to me, they know where to find me." And as a child, I thought, well, maybe he's just shy, I don't know. But as I developed my own hearing loss, I understood the truth, that he was probably having trouble hearing in that space with all the background noise. And he was just exhausted and really just couldn't put in the effort anymore to participate. So my experiences with my father were definitely impacting how I felt about getting hearing aids. And I knew that I needed them, but obviously I wanted them to be as small as possible, right? So nobody would see it, because he taught me that. I remember getting the hearing aid molds taken. My audiologist was very, very gentle and kind, but I had never put anything into my ears like that before. And I remember the gel hardening, into the mold, and it was painful, and all sound receded. And I just sat there thinking, is this what it feels like to wear hearing aids? And I just went home and cried because it just was such a foreign experience. So I hated my hearing aids, obviously, when I got them, because my father taught me that as well, unfortunately. But I did have to wear them. At work, I would sneak them in, to meetings before important meetings, and I would rip them out as quickly as I could afterwards. And I needed to wear them more and more as my hearing loss got worse, but sometimes I did, sometimes I didn't. And I was really just following in my father's footsteps of shame and isolation. But then I had children of my own, and everything really changed for me because my hearing loss is genetic. I worried that maybe I would pass it on to them. They still don't know yet, they're in their teens. But I saw them watching me do the same things that I had watched my father do. And I knew I was passing on to this next generation the stigma and the discomfort with hearing loss, and I needed to break that cycle. So I did. I started wearing my hearing aids all the time and working to educate my family and my friends about how they could help me hear better. I remember one Thanksgiving, probably a lot of years ago at this point, where I rearranged the whole seating arrangement so that I could have a better seat. It was sort of the first time that I had really taken that action. And my family was very supportive about it, and it encouraged me to continue to advocate for myself. And now I do advocacy more broadly, obviously coming and speaking. I have a blog that Sharon mentioned, livingwithhearingloss.com, where I'm trying to share my experiences with hearing loss. And also sit on the board of Hearing Loss Association of America. And today I see my children are still watching me, but now they're learning a better attitude and they're learning the skills that they might need if they should develop hearing loss themselves. Okay, so the next slide, the pandemic really highlighted the difficulties that people had with hearing loss and with communication. And Carla, we're gonna do the next, thank you. But there's not really a lot of awareness about hearing loss. And so what we tried to do is create a documentary called We Hear You that Sharon was mentioning. And unfortunately, we don't have the sound, but this is the trailer for it. So you'll see the captioning. effective it is to watch a trailer with no sound. But maybe it is sort of an interesting experience, right? Because it's a little bit of how people with hearing loss are watching things, and that's why the captioning is so important in terms of media and all of that. So I hope that gives you a little bit of a sense of the documentary. We put it together for a couple of purposes. First, to bring the hearing loss community together. We felt like in major media, often the deaf experience is shown rather than the hearing loss experience, and so wanted to also raise awareness about that. But what is it like to have hearing loss? So I hope you can tell a little bit from my story, as well as from the trailer, that when you have hearing loss, it impacts every aspect of your life. And it changes the way that you see yourself, especially if it's something that you developed later in life. You may feel less worthy of love. You may feel less competent. You may feel stupid when you don't hear things properly and you answer questions wrong. So the stigma that we feel and we put on ourselves sometimes makes it harder to ask for the help that you need in order to communicate, and that just compounds the problem, right? It also creates communication barriers that make it more difficult to create and sustain relationships. And so we might avoid friends that are more difficult to hear. I know that there are friends of mine that I sometimes still to this day avoid, even though they're very kind and they do their best, but they're tiring for me because I can't hear them as well. It's also tough in romantic relationships. Frustration can be a factor if communication is not flowing so easily. You lose some of that feeling, some of that closeness. And hearing loss is also exhausting, and you all know this, that it takes a lot of processing power, right? I describe it as sort of a game of Wheel of Fortune, right? Where you're trying to sort of take the sounds that you have and then use what you know about the context of the situation and speech reading cues and other things to put it all together. And then of course you're not done because you need to reply, right? You need to continue the conversation. So it takes a lot of mental energy to communicate. And the world's also not set up for people with hearing loss necessarily. Everywhere we go, there are ramps and other things which help wheelchair users. And this is terrific, and this is how it should be. But we wish that we had access to those types of things for people with hearing loss just as easily. Okay, so the next slide, I want to talk a little bit about my experiences with hearing care professionals over the years. And, I think the influence that a hearing care professional has is really paramount. So you need to understand how important you all are in terms of setting us on the correct journey and the correct path. And as I told you, I arrived at my first appointment with an audiologist when I was in graduate school, and they just sort of sent me home, right? They said, well, there's nothing we can really do for you. Go back to class. Despite the fact that I was having trouble hearing in class. I was there for a reason. I needed help. So I think thinking back on that standard of care is definitely disappointing. And I have seen definitely a number of hearing care professionals in my life since that time, obviously. Only one of them has asked me, what are the most important situations for me in terms of hearing? And only one, which is a different one actually, ever tested how well I was hearing when I was wearing my hearing aids. And so I tell you this because, not that I want to complain, right? Because obviously I'm doing very well with my hearing aids, and I have my hearing care professionals to thank for a lot of that. But I think it's also just to explain the patient experience and sort of some of the things that we walk in and we walk out with. Okay, so moving on, let's talk about person-centered care and a little bit about what it means to you. And I am going to go through my definition, like I said, but I thought before we did, I would take just a little poll to see where you guys are on this. What you think of person-centered care. So is it a critical part of every interaction you have with a patient? So Good. Maybe something that's useful for first-time patients only, or a nice to have. Okay. But there's not a lot of time, and we'll talk about some of the barriers later. And an afterthought, my job is really to fit hearing aids. So it seems like this is a very person-centered, focused crew here, so that's excellent. Okay, so let's go on to my definition, the next slide. And in my definition, there are 5 main parts. And the first is to partner with your patient. And this means taking the time to understand each person's specific needs. And each of our journeys is unique, as you know, and so a one-size-fits-all approach is not going to work. The second piece is to make your office hearing loss friendly. And I think sometimes hearing care professionals forget that we're here because we cannot hear well. So please set up the office so that we can feel respected and be able to participate. Third is to embrace creativity. So this is really, don't get trapped just in a hearing aid only approach. There are lots of other technologies that can be very, very helpful for people. Fourth is to think beyond the technology, and that devices are obviously a critical part of helping people with hearing loss. But as Gail Hannon and I write about in our book that Sharon was talking about, there's so many other things, softer side type of things, behavioral change, attitude change, and we'll talk about those later. And then fifth is to support the hearing loss community. So there's a lot of advocacy that still needs to be done in order to make things more hearing loss friendly out in the world. And all of you as experts can really contribute a lot to that effort. So in the discussion, I'm going to cover each one of these in more detail with, with the pitfalls, some case studies to show the pitfalls, but I don't want everyone to feel sad walking out of here. I have a very good story, a good example to end with, so it'll be positive again. Okay, so let's move on to the first one, partnering with your patient. Okay, in the first case study, it was John's second trip to see an audiologist, and his hearing problems had gotten worse, and he knew he probably needed hearing aids, but he definitely did not want them. But he knew it was time. So he didn't know a lot about the types of hearing aids that there were. He didn't know about communication best practices. He didn't really know anything. He expected his audiologist to ask him lots and lots of questions. But the conversation really centered around, what type of device did he want? What did his budget seem like? What did he want the device to look like? And so he walked in scared and impressionable and really looking for answers. And he didn't really get a lot of that, but he did get a hearing aid. So he felt like it was more a successful visit maybe for the practitioner and less so for him. So what is missing in that scenario? Partnering with the patient, obviously. Okay, so the next slide is why should you partner with your patient? And I hope that this is a little bit obvious, right? Each person's journey is unique. They each have specific needs. Some people maybe are working. They need technologies that are going to help them in a work setting. Others maybe work on their own, but it's really just out at restaurants or socializing. So taking the time to understand what it is that they need and combining that with all the technologies and information you do in terms of the audiogram, the speech and noise tests, is really going to get them to the best solution. Okay, so how do you do this? Next slide, please. The first thing is to ask for their input. So I think to prepare for the appointment, you give them some homework. Ask them to think through the situations where they're having the most trouble hearing. Where are things going well? And write down as many details as possible, because then you can incorporate that into your recommendations. Second is to listen to their priorities. So it's really having that attitude that the audiogram is not everything. It's definitely something, and it's an important something, but it's how do you apply that to each person's personal situation. The third is to build the treatment plan together. And I think this is something just in human nature, right? That if someone's involved in the creation of a plan, they're much more eager to carry it out and to believe in it and to continue to do it. So involving them will help with that. And then setting realistic expectations. So work is definitely going to be required by you all, but it's also going to be required by the person with hearing loss. And I think sometimes we don't know that, we forget that. We think it's going to be just like glasses. You put the hearing aids on and poof, you're done. And it's definitely not that type of experience. Next is to empathize with their journey. I can't emphasize how much respect and compassion can go a long way in terms of creating that partnership and really building that trust so that we're more willing to take in the ideas and implement them. And then also to involve the family. The family is really your patient's most important support network. And so including them in that is going to be very helpful. Sometimes family thinks that, maybe the person's just not trying hard enough to hear, or they need to, turn their hearing aids up a little bit. And I think sometimes hearing from the professional how real the situation is, looking at that audiogram and seeing some of the issues can really put that type of attitude out of the family's mind. And that goes a long way in terms of developing that support that people need. And plus you'll learn a lot from the family, right? About where are these people struggling, or maybe they don't even know what they're missing, right? That's a lot of the issue with hearing loss is sometimes we don't even know what it is that we're missing. So they can be helpful in that way. So. All right, so the next way is to make your office hearing loss friendly. And another case study example. So Jill's tinnitus was flaring up, and she wanted to go to a doctor's office to get some more information. So she arrived and she went up to the receptionist, and the receptionist is sort of mumbling and typing into the computer. So she didn't know, is she supposed to have a seat, fill out forms, what exactly is she supposed to be doing? And she was very disappointed and surprised because this was a doctor's office for people with hearing loss. And the same thing happened on the way out the door. And she just felt completely disrespected and never went back to that hearing care professional again. And so what is missing from this piece is a hearing loss friendly office and experience. So next slide is, why should you do that? And I think this aspect is often overlooked by hearing care professionals, but it's really the first thing that your clients are going to notice, right? Is the office, is it easy to hear in the office? Is it hard to hear in the office? Are the lights up? Is the noise down? If there's a TV, is it captioned? All of these things are going to make people feel more welcome and feel like they're at the right place. And they're small steps to take, but I think they're overlooked. So how can you do this? So the next slide. And the first is really, it starts with making the appointment. So it's very challenging for people to hear on the phone when they have hearing loss. So make sure that your receptionist speaks slowly, clearly, and even better, maybe let appointments be done by email. When you call to sort of confirm the appointment, send an email or text. That is much easier. The next thing is to keep your office quiet and well lit. We all know how to set something up to make it conducive to good hearing. So make sure that that's the case in your office to the extent that you can. And I'd encourage you to share relevant literature in your waiting area. So there are brochures, maybe for a local Hearing Loss Association of America group or Hearing Life magazine. When we go in there and we see stories and information that's available, it helps us feel less alone in our struggles. And that's a huge part of being welcoming. And then use hearing loss friendly procedures. So I know when I go to the doctor, I'm always sitting there on high alert because a lot of times I'll miss my name if they're going to call it. So that shouldn't be the case of the audiologist or the hearing care professional, right? So maybe let them know when you're checking in, okay, we're going to send you a text, or maybe we're going to just come tap you on the shoulder. And that way they can sit there and relax and not be on high alert as they're waiting to go into the office. Small things. Also, I think it's important to supply a written summary of the visit. So a lot of people with hearing loss are embarrassed to say they didn't understand, or they didn't follow the information, or they didn't get all of that. So if you can supply it in writing, that takes away that issue. It also makes it easier for them to share it with their friends and family. And if they have any questions, they can refer back to it later on as well. And then the last thing for that is to make checking out at the desk stress-free, right? So maybe you have a hearing loop there or some kind of PSAP that makes it easier for them to hear and interact with the receptionist. Or, and if there's any financial information, obviously for that as well. Okay, so moving on to the third one is embrace creativity. So our case study here is about Pedro, and he loves his hearing aids. He wears them all the time now, but he doesn't have them fulfill all his needs in all situations. And a lot of times if he's out at a restaurant or if he's going to the movies or the theater or some other place, he wishes that he has other solutions. And when he asks his hearing care professional about that, sometimes they suggest another program on the hearing aid or maybe a different volume control. But there are other things as well. And most of the innovations he uses, like speech-to-text apps, other things like that, he learned more from other people with hearing loss rather than his hearing care professional. So what's missing here is creativity. And why is this important? We go on to the next slide. And I think here it's almost like you have to do it at this point, right? Technology is changing so fast and people are aware of these changes. And so if you're not going to keep up, you're going to be left behind. And I think COVID-19 really did a good example of showing why creativity is such an important aspect. So with the masks, we were struggling so much to hear, right? Because we lost the lip reading cues. And a lot of creative hearing care professionals and hearing aid companies created new programs, mask wearing programs, right? To boost up those high pitches so that are blocked by the masks. And so that's the perfect example of how creativity can really help enhance somebody's life. So I encourage that, in every situation. So what can you do? Next slide. The first is I encourage you to spend a day in your patient's shoes. And maybe you do this in your training, I'm not sure. And, so wear earplugs for the day. Now, it's not going to be the same thing, right? Because it doesn't mimic the distortion. But use them on your commute. Wear them at a family dinner. Wear them out to lunch with a colleague. See what it's like. See the frustration, see where you struggle, and that I think will give you a much better sense of things that you could suggest that might help them in their daily life. I'd encourage you to try the devices yourself as well, and not just for an hour or two. Wear the hearing aids. Obviously, they have to be programmed at safe levels. How do your ears feel at the end of the day? What situations may there be feedback? What situations were more or less challenging? I think you learn a lot from that experience. Also embracing assistive listening technologies. And this you could do, in conjunction with sort of these hearing aid wearing adventures. Go to the movies maybe, take out a caption reader, see how easy it is to manipulate. How does it help you to enjoy the movie or not enjoy the movie? Try out a hearing loop at a theater locally. All of these things, the more that you can experience life in their shoes, the more you can be creative in terms of creating solutions. Obviously being willing to teach, and that's something that's hard for people, right? That's not necessarily why people would go get into the profession, or maybe they like the technology side of it, or the analytical side of it, but putting that knowledge out to the world is really what it's all about. And then unbundling fees, which I know is sort of a controversial thing. But I feel like if you're able to charge for your expertise and your time, it's much easier for us to understand the value of that, right? Rather than have it being sort of all bundled into the price of the device. And so perhaps there are other issues with that in terms of insurance coverage and things, obviously. But it's something to consider because I think it shows a creative way to communicate to your clients how all those other aspects are really what you're paying for in addition to the device. Okay, so think beyond the technology. So Paula knows that she sounds like a broken record to her family and her friends. You know, I need to sit in the corner, please face me. And these are all important things that she needs to communicate so that she can communicate well with her friends and family. And for years, she didn't really know a lot about these communication best practices. And while they seem obvious today, she wishes that she would have learned about some of these maybe at that first appointment and every appointment thereafter with her hearing care professional. And over time, she learned these, but again, this is, I think, a missed opportunity to think beyond the technology. And so why should you do this? The next slide. Many people from hearing loss are really starting from scratch, right? We don't know anybody else with hearing loss. I mean, I knew my father, but he wasn't going to talk to me about it. He wasn't going to share any of these tips and tricks with me. And this is really one of the main reasons that Gail and I wrote our book, Here and Beyond, because we developed all of this knowledge over our lifetime with our experiences and also the experiences of all the other people with hearing loss that we know through HLIA and different advocacy initiatives. And we wanted to put it all in one place. And so you all are really important in being able to fill in some of those gaps. And I would encourage you to take the opportunity to focus on that as well. So how can you do that? Next slide. Oh, there you go. So first is to share these communication best practices. And again, I think some of these things are obvious, right? Don't cover your mouth, face the person, get their attention first. But they're obvious, you know, when they're obvious. They're not obvious before they're not obvious. And so I would encourage you to talk to the people with hearing loss and their families about these simple ways to improve communication. And you can even include them, you know, maybe on the back of that written summary sheet that you hand out. It'll show how important they are, and it'll make them very easy to share with other people. The other thing is to teach your patients to be better listeners, right? So we're reliant a lot on other people to make changes to improve communication, but there are things that we can do as well. So for example, scheduling important appointments for the morning, where for many of us, we're a little bit fresher. We're not as exhausted. Maybe we hear a little bit better. Keeping up on the news so that when you hear names or places or things of that nature, it's easier to sort of process and find that name rather than something that's just sort of a random word that you have to fit into your brain. Also, it's important to talk to them about how to manage hearing loss exhaustion. So we talked about, you know, I often feel exhausted at the end of the day, right, from all that energy that I'm putting into hearing and understanding. And I didn't know that that was normal. So I think if someone had told me that, that would have just gone such a long way for me to not feel bad about that. I wouldn't feel like a failure. I would feel like this is a normal part of the experience. And guess what? These are some ways that you can handle it. Life-changing. Also is to promote self-advocacy skills. So we really need to learn how to ask for the assistance that we need. Hearing loss is not a passive sport, right? It's very active. So you can really empower people and encourage them to do that. Small things, like just even going like this in a conversation lets that speaker know that maybe they need to raise their voice a little bit more. And you don't feel bad for doing that. You're not interrupting the whole flow of the conversation, asking for repeats and all of that. And then recommending peer support groups. I mean, I can't tell you how important it was in my life to meet other people with hearing loss, in addition to my father. It was the first time that I really felt like there was someone who understood what I was experiencing. And this is true for hearing loss, this is true for any life challenge, but really that peer support is overwhelming. I've learned so much from people like that, and you can introduce us to those groups, right? There are probably groups, there are plenty of them. I think there's a Morris County chapter of Hearing Loss Association of America. I'm sure there are many in New Jersey. And if there aren't one, you can consider starting one for your patients. You know, there's definitely an opportunity there as well. Okay, so we're now at the fifth one, support the community. And at the latest Walk for Hearing in New York City, where I live, there were many audiology groups that came out, and lots of student groups too, that came out to support the walk. And we were very excited to see them there, very warmly welcomed. And they were really good fundraisers too. You guys are good at that, actually. And so their efforts were met with a lot of enthusiasm. And so it was a time where we could all be on the same team, right? Sometimes people with hearing loss feel like maybe we're not exactly on the same team as our hearing care professionals we want to be. Sometimes we feel like we're not. This was an instance where we were all in it together in a very visible way. So why should you do this? Next slide. There's a saying in disability advocacy, which is nothing about us without us. And I think that's hugely important. It basically means that there should be no product or procedure or anything that's developed that's going to impact the person with a disability without including their perspective. And so I know Google does that. I'm actually one of the trusted testers for some of their different products. And I think it's also a wonderful standard for the hearing care community as well. The more that you understand and interact with the people that you're trying to serve, the better off your product and your service is going to be. So how do you do this? You can meet with us outside of the clinic, obviously, and the easiest way to do that is to come to an NJAHHP meeting. Has anyone ever been to an NJAHHP meeting? Oh, guys, let's put that as a takeaway from the presentation. We would love to see you there. Truly, truly. You can volunteer to speak at one, or just go and listen to the speakers, listen to the questions, soak up the ambiance. You'll learn so much about what's important to your clients. And then join our community activities like the Walk for Hearing or things of that nature. You can also help advocate for communication access. So there's so much advocacy that still needs to be done, installing hearing loops, making sure there are open caption performances at theaters and in public spaces. And your voice as an expert really takes a lot of emphasis. I mean, it really can have a very big impact on a state leader or a legislature, someone in the legislature. So I encourage you to use that expertise for that. Also educating the medical community. I mean, I'm always surprised at how often doctors overlook hearing loss, or they don't know as much about it as they maybe should. So you can work with some of them to explain some of the comorbidities and trying to get them to refer people to you for additional testing. And then promoting hearing loss prevention. So you could work with local schools, go in and talk to elementary students. I did that in my son's class many, many years ago. And it's actually a ton of fun because these kids are so interested in everything. I mean, you show them a decibel reader and they go crazy. And they walk around and they really do understand that, you know, if you're further from the sound, oh, look at that. It doesn't hurt my ears. It's very simple things, but it's a very valuable way that you can give back and educate others about that. Now, I know there's only so many hours in the day, right? So you're not going to be able to do all these things that I've suggested. But maybe just pick one or two of these in terms of the advocacy initiatives that resonate with you and do your best to incorporate them. So let's talk a little bit about barriers. So that's the next slide. Because this all sounds great, right? Like, let's do it. Person-centered care sounds like what everyone wants to be doing. So I wonder if there are some barriers that you would be interested in sharing as a group at this time. If anybody has barriers, like why doesn't this happen? No? Okay. All right. So then I'll talk. Oh, okay.
Well, obviously, code is a barrier because you've got these glass things in front of your secretary. You've got masks on, which you've been through. Those are negative to visuals, supportive communication. And if you get necessary, then the distancing is stretched out even further with double the distance that you're trying to do. So yeah, those are things that we've been all through for a couple of years now. It seems like
some of the practices I work in are still going on. Because that's certainly requires stuff. Because we have a sensitive population, so it's not very high students. So those are the ones I can think of where we're at. And I think there's a fatigue on all sides of this, paradigm. Both the caregivers should be served by privilege, and also the practitioners practice because they're highly exempt. It's not only the most directly, they're enhanced, and I'm really, goes on, they're, in two practices. They're just retired. And that's the part of the issue. For both the hearing care, it's gotta be there for hearing care, I have to do one. And it's just that there's both pieces, it's just a hard time. So, and I think how do you break it down, you gotta be positive, you gotta be very positive with talk to patients, encouraging, realistic, and helping them understand, yeah, it's a struggle, you know, and this is the privilege we're given, we want to. Family, a huge family. Sometimes you end up talking about the patient, not to the patient. Sometimes the family member, we all tend to be somewhat self-centered, so the family member may be focusing on his or her issues and not necessarily the person with the hearing loss. And therefore, the person with the hearing loss becomes invisible.
That's great.
I would say the big one is economic concerns, as far as everyone wants to do all these things. And like you said, it becomes how much time can you devote to these things compared to how much money you make. It's like when it comes down to it, we all need to make money, so there's a trade-off. Right? So some people do it better than others, but it's a big one.
Plus, I think economic on the patient end also is they want everything for nothing, and you have resources to be able to help them with, but they don't want to put the money into that too, in their economic situation too. And there are some definite avenues that help more, but they have their own, patients have their own limits of what they can do.
Right, so the barriers on both sides, really.
Yeah.
And just piggyback on what Dan said, I think with economics, we have time constraint issues. So we want to be this way, and maybe we can be this way with our first patient, and then we have business, criteria that we have to deal with, scheduling limitations, meetings and seminars, and things like that just really buying our time, and as Chip said, it's exhausting. And, you know, and it really, it makes it a lot harder for us to just be, centered on the patient's expenses. It's really a stretch.
No, thank you for sharing all those. I mean, I hear all of that, and those are all excellent points. And they resonate, I think, with a lot of what I've heard in the past. So if you go to the next slide, I can show you some of the common ones that I hear. It really resonates with a lot of what you all were saying. Not enough time, right? In the appointment itself, even. And some suggestions for that would be doing some of that homework ahead of time, letting the patient be more prepared to come in, having thought through some of the situations that they really want to focus on, and maybe explaining to them, this is the layout of the appointment. This is how much time you have. We're going to spend this much time doing this, and this much time doing this. And perhaps that helps them understand a little bit more that their input is important, and this is where they have that opportunity to give it. But it's definitely an issue. Also, not having the necessary counseling skills. I don't think anyone mentioned that one necessarily, but I think that's a big deal. Counseling is hard, right? And sometimes that needs to be a bigger piece, I think, of the curriculum that you all are going through, and training on that, because counseling isn't something that's for everyone or comes naturally to everyone. Also, emotional discussions sometimes make people feel uncomfortable, right? I mean, people are probably not happy in your office a lot of the time, especially the first time that they're there. And so I think I'll just encourage you that just because your patients are emotional, doesn't mean that you have to be emotional. And that really, they're not expecting necessarily that you're gonna have the perfect thing to say. It's just listening and sort of having that empathy and that compassion. And that can really go a long way, just a little bit of kindness. And then selling hearing aids is my livelihood, right? We talked about that one, and that's definitely challenging, right? It's like, how do you make sure that you're getting paid for your time and able to contribute? And I go back to the unbundling, but you know, that's hard, right? Because there's this legacy of putting everything into the hearing aid. So people don't want to necessarily pay for a lot of these free services because we've been trained that they are free services, and they're not free. They're actually the real crux of what's happening there. So we all need to sort of change our mindset there. And then some people think my patients have done fine without it. I don't think there's anyone in this room that thinks that, but sometimes I do hear that as well. And I would encourage people, if they think that, you know, maybe do a survey, maybe see if it's really true, or try it and see if their patients actually do better with person-centered care. Okay, so what, the next slide is what is the client role in all of this, right? Because you guys are not miracle workers, maybe a little bit, but we need to contribute as well. So what do we need to do? We need to share our hearing loss story and our struggles. It's not the time to play Mr. Tough Guy. You know, maybe people come in and say, I'm not really having any issues. We need to be open and we need to be vulnerable. And we may need your help to get there. So ask us the questions that can really draw us out. We need to be responsible for coming armed with facts, right? Back to that homework again. The more specific details that we can give you about this situation went well, this situation didn't well. I tried this program, I tried that. Write it down so that we can give you the information. Also leaving anger at home, and that's tough, right? Because hearing loss is frustrating. But if we come in angry and blaming others for the issue, we can really miss an opportunity to find a creative solution. So if we're angry, you know, acknowledge us. I see you're angry, I understand it's very, very frustrating. But let's try and focus on some creative solutions and see if there's a way to sort of divert the conversation. We also need to respect your expertise, and I think most people with hearing loss do, but it's important that it's a mutual respect, clearly. And then we can teach what we know. Right? I'm finding apps all the time, like different speech-to-text apps, the new iOS and Apple has captions built right in. FaceTime now has captions built right in. I don't know if you guys know about this, but your patients probably do. And so if we tell you about them, then you can pass them on to the next people. And then staying in touch, right? I mean, hearing aids are not like glasses. It's not like you walk out the door and you don't have to maintain them. They need to be cleaned, they need to be serviced, your hearing needs to be checked, so we need to take that into consideration as well. And like I said, we may need your help in sort of reminding us and educating us about our responsibilities. So change is hard, and so I don't want this to be a discouraging discussion. You know, I know that I sort of put a lot of things out there that can be very overwhelming, and that is not my intention. My intention is to sort of inspire you to take little bits of this and incorporate it the best that you can. It doesn't have to be overnight, it can be gradual. And so I wanted to end with a positive story, but for this part of the presentation, because I promised that I would. So this is a story about my current audiologist. So I wear lyric hearing aids, which I don't know if you're familiar with. They're sort of extended wear, deep in the ear, and I really like them. They're not perfect solutions, but they work well for me. I can hear my kids at night, I can do all my sweaty hot yoga, and I can wear my hearing aids. But a couple months ago, they were shorting out quite a bit. They were just, I don't know, it was like liquid, they would just die. And so I knew I needed to talk to my audiologist about it. Went in and he explained to me that I guess this is a common issue that you would get liquid in your ear or fluid in your ear. I've been wearing hearing aids for 20 plus years, it's a new thing for me. But I was educated and it was, you know, annoying because I had to deal with this, but he explained it to me. And I was also planning on going on a trip. And so I was worried, what if this happened when I was on vacation with my family? So we talked through the issues, he educated me, we came up with solutions of how I could handle this on my own when I was away. And he gave me some extra lyric hearing aids to take with me so that I could take them out, put them in. And it was just a tremendous experience. I felt heard, I learned something, we were a true partnership, and my problems were solved. And I left that feeling like this is somebody that I can trust with my care. And I wish every appointment was like that. So that's it for this part of it. I want to thank you for your participation and your attention, and this is all for my details, how to get in touch with me. I don't know if you have any specific questions about this, if you want to take a break before the next one, or just go right into it. It's up to you. Any questions about any of the person-centered care stuff? Yeah.
I have one question. What do you think of as a hearing impaired individual implementing some of the self-help programs for retraining therapies for speech and noise? There are some programs that are out there that if you cost something to the patient or on our end to be able to provide, and would you, how many would you, or do you within the hearing impaired people you talk with will use this and benefit by it?
That's a great question. So the question is where there are sort of these oral rehab programs that cost money both for the practitioner and the patient. You know, do people want them? Who's going to use those? I think they're terrific. Now, again, it's getting people to see the value in them. So maybe there's a way of doing a trial so that people can see that they're getting benefit from it before they're laying out a lot of money. You know, for better or for worse, a lot of people with hearing loss are on a fixed budget, right? And so there is definitely those economic issues. But that's really what it's all about. I mean, it's not the hearing aid itself. That's a critical piece, but it's not enough to get you where you need to be. And so if there are training programs, I think the world of them. And, you know, HLAA, other organizations that represent people with hearing loss are very much behind these types of trainings. Okay. Well, we can go on to the next part of the presentation. We're gonna get another slide deck up and going. Now this one has a bunch of videos. I don't know how effective that was. So you guys tell me if you want to watch videos that don't have sound or if we want to skip it. How about we watch them? Let's see. Yes. And how about we skip it? We'll see how it goes. If it gets like, this is stupid, just tell me.
Are they closed captioned?
They are, they're all, of course, all my videos are closed captioned. They all come from the documentary, We Hear You, which is closed captioned. Okay, so the first part of the talk was all about sort of person-centered care and more about the things that we would all love to see from our hearing care professionals. And this part of the presentation is about sort of the other side of that. The person with hearing loss, right? So the person that's sitting across the table from you. And hearing loss doesn't really come with a how-to guide, right? So you have hearing loss and you don't necessarily know what to do about it. So this session is sort of that roadmap for your patient. So hopefully my goal in talking to you about this is that you sort of incorporate some of this information into what you're talking about with your clients, and then also refer them to things like this book or like this documentary or like blogs or Facebook groups or whatever that's out there in terms of that peer support so that they can learn some of this information on their own as well. So what I'm going to do is I'm going to talk about the stages of the hearing loss journey, and then talk about how you live skillfully with hearing loss. And so there's a formula that we go through. in our book, and so we'll be talking about that. And I don't use the word skillfully lightly, right? When we really started, Gail and I started working on the book, we're thinking, okay, do you want to live well with hearing loss? Do you want to live successfully with hearing loss? We said we want to live skillfully with hearing loss, because that means it's something you can learn. There are skills that you can apply, that you can learn, that will help you live better. So that's just an important piece of it. That's a very skill based approach. And we've based this approach not just on our own personal experiences, but the experiences of many, many other people with hearing loss as well. And I believe that they're corroborated by science, by research, by tremendous advances in technology, and also by person-centered care. So I'm excited to share some of this philosophy with you. Okay, so the next slide, and as we talked about earlier, each hearing loss journey is sort of unique, and I shared mine with you. There's definitely similarities and differences, but when Gail and I got together and we started talking about it, the thing that we realized is that when everything changed is when we shifted the goal, right? It wasn't about hearing better, it was about communicating better. And it's a very subtle shift, but it's a shift in something that we can be successful in. We are not going to hear better. We'll hear better, but we're not going to hear well, right? Even with our devices, we're going to fail, but we can communicate better, right? And that's what it's really all about, is that connection with people. So if you can shift that mindset in terms of what the goal is, I think your patients will be much more successful. Okay, so let's go to the next slide. And let's talk about, why are some people more successful with their hearing loss than others, right? Because it really does vary. To some extent, we all share the same challenges, right? But some people adapt to those challenges better. First is really how well a person thrives is sort of their life experiences, right? So what's the degree of their hearing loss? What type of, audiogram do they have? I have a little bit more of a cookie bite, which makes it hard to fit me. So it's always sort of a challenge there. The personalities, how do they do in challenging situations? How do they adapt to change? How comfortable are they disclosing and asking people for help? These are all important aspects. How well do they understand hearing loss? So it's a whole education process, right? You guys know a lot about it because you studied it. When you don't sign up to study hearing loss when you have it, you sort of have to take the extra credit class. And then the family attitudes are also an important piece of it. I really struggled a lot with stigma because I learned it from my family, and other families are sometimes not as supportive as I'm lucky to have my immediate family right now. Right? Again, turn up your hearing aids, pay more attention. So the way that your family is approaching it can have a big impact as well. And then, of course, access to hearing health care is something that's not available for all people. A second big influence is all of you, right? The service that you provide. So imagine having a qualified hearing care professional who cares about your needs, who teaches you communication strategies, who makes you feel empowered. This is a huge positive impact on a person and their journey. And then on the other side, there's sometimes you go in and maybe you don't feel as heard or as understood or as respected. And that can have a negative impact in terms of the beginning of that journey. And then the third influence is peer resources. And I'm a little bit of a broken record on that, so I'm going to be talking about that quite a bit. And it was a life-changing experience for me. It took me from being isolated and ashamed and frustrated and sad to being part of a larger community of people that I was inspired by and who I could learn from. And now it's such a huge positive part of my life, so it's sort of a silver lining of hearing loss. Okay, so the next slide, please. And this is, what does it mean to live more skillfully with hearing loss, right? So we have a little bit of a formula here. And the first step is understanding what to expect, right? The big picture is what we call it. And because if you don't know where you're going in terms of your hearing loss journey, it's pretty hard to get there. And so this allows you to see, if you can understand sort of this big picture, it lets you see that ups and downs are part of the process, right? Hearing loss is not something where you check a box and you solve it. It's not a problem. It's a journey where there's going to be ups and downs. And so if you understand that, when you put the hearing aids on and they don't immediately work, you don't feel that you failed. You say, okay, well, that was supposed to happen. And now I'm going to do step 2. So it's laying out sort of that path. The second step to living skillfully is embracing what we call a 3-legged stool of skills to improve communication. And this includes changing your attitudes about hearing loss, something that we call mind shifts, we can talk about. Embracing a broad array of technology, so hearing aids, but other assistive listening devices as well. And then non-technical communication, game changers, things like behavioral change, communication best practices, things like that. And then the third step is putting it all together, which is easier said than done, right? So it's taking what you know about the journey, the 3-legged stool of skills, and then applying them in your life in different situations, in your family, your friends, your work, all different types of environment. So let's take a look at the hearing loss journey itself. So next slide, please. Okay. Okay, so most of us don't start off with a good view of the big picture, right? So this is something you can help us with too, in terms of setting the stage at the beginning, explaining that it's not like, we're not going to give you the key to the castle, but it's going to be sort of this thing that, that we're going to work on together. And the big picture shows you that there's support available, but it also shows you that it's okay to ask for help. So let's look at the next slide, which is the 5 stages of the journey. And so again, every journey is different, but most of them, can you do the next slide for me? Most of them show 5 distinct pieces. And so the first one is really debating with yourself. And this is if you wonder if you're having trouble hearing, or is everyone else mumbling? Maybe you're just having these subconscious suspicions. Maybe you're just in denial. A lot of times this stage can last 7 to 10 years for people. It lasted a long time for me, with help from my first hearing care professional who told me, well, there's not much we can do for you. But this is definitely a stage of the journey for sure. The second stage is validating, and that's when we finally, get smart and come to you all and get the hearing test. And it might not be what we wanted, but at least now we know that there's something we need to deal with. The third step is taking charge. And I think this is the most exciting part, because it's when you finally acknowledge it and you decide that there's something that you can do about it. And this first step's often getting hearing aids, but again, there's a lot more to do than just that. And then stage 4 is living skillfully. And that's really the goal. Right, that is the ultimate goal and phase of living well with hearing loss. And here you're open-minded about trying new solutions. It doesn't mean that every day is going to be perfect, right, when you're in the living skillfully phase, but you know that that's going to happen. You're okay to and open to adapting, trying something new, and that's just part of the process. And then there's stage 5, which is refreshing and restarting. And this is kind of what makes the hearing loss journey a little bit more of a journey rather than sort of that thing that you can solve, because it's always changing, right? Maybe you finally think you figured it out, but your hearing loss gets worse. Or a pandemic comes along and it changes all the rules and you need to learn how to adapt all over again. And so this might take you back to a different part of the journey, a different phase of the journey, but it's just, you have to look at it as an opportunity to just learn more skills and continue to move forward. Now, in reality, some people are never going to get out of stage 1, right? And some people might be so shocked by the diagnosis in stage 2 that they sort of run for the hills. And parts of 3 and 4, can happen at the same time. But I think with support and understanding, everyone with hearing loss can have improvements and live more skillfully. And so that's really, our goal with the book, and I know your goal in terms of helping your clients. Okay, so let's go to the next part of skillful living, and that is the 3-legged stool. And so the thing about a 3-legged stool is that it never wobbles, even when the ground is bumpy. If someone can explain to me why that is, I would love to know, but it's true. And so that's why we kind of talk about it this way. And the legs are mind shifts, technology, and communication game changers. And each of them is important in and of itself, but when they work together, it's really when the magic happens. So the next slide, please, is a quote. "I have the potential to change my journey. The person with the most power in my hearing loss success is me." And this is really a moving statement, and it's a life-changing one because it's the moment that you discover that you are in charge of your hearing loss and your journey, and that a lot of that comes down to attitude. So the next slide, please, is going to show you some common attitudes that people feel about their hearing loss. And you may be familiar with some of these. But people ask themselves, why me? They say, nobody understands what I'm going through. I want to hear better the way that I used to. I don't like to advertise my hearing loss. People will think I'm old or slow. My family and friends always forget about my hearing loss. Hearing aids are ugly, they're expensive, and they don't always work. I don't want to bother anybody with my hearing loss needs. And who would want to hire me or love me or be my friend? I get angry at myself and others when we make communication mistakes. And everywhere I go, there's no access for people with hearing loss. So these negative attitudes feed into that stigma, right, that can prevent us from asking for the help that we need. And so stigma is such an important piece of hearing loss that I wanted to show this clip that I'm hoping is going to work, that talks a little bit about stigma. So I hope that was okay. I always love that story about how she literally let someone throw her hearing aid in the garbage rather than acknowledge that she had hearing loss. And I mean, it's like we can laugh at it, but it's so indicative, right, of the way that we put that onto ourselves, and it's just such a shameful thing. And it can't be. So let's go to the next slide. And I think that the clip really shows you that the attitudes that we have towards our hearing loss affect our emotions, and they also affect our behaviors. And this is very, very powerful because it means that life with hearing loss can be different. It can be better if we change our attitudes about it. And so these better attitudes help us create better communication and better conversations because we're more willing to ask for the help that we need. And they might make our technology work better too, right? Because we're more willing to experiment. It just gives us a little bit more freeness of feeling. And so when we can reframe our unproductive, destructive thoughts about hearing loss and turn them into constructive, actionable statements, we'll have a healthier approach. Now, I'm not trying to be overly simplistic, right? A mind shift is not going to cure hearing loss, but when we actively support our technologies with other skills, including a better attitude, we will do better. We will live more skillfully. So let's look at a couple examples. Next page up. So the first, the attitude is nobody understands what I'm going through. And the mind shift is that many people experience the same challenges as I do. I can learn from them. I'm not alone. And this is when, that the power of that peer support, right? So when I first realized that I was losing my hearing, I didn't know anyone except for my father. And he wasn't going to discuss it with me. And I didn't know anyone to commiserate with. And I got my first hearing aid, it was in 1995. But I didn't meet anyone else with hearing loss until 2010. That is 15 years that I know of. I may have, but we didn't tell each other, right, that we had hearing loss. And that's 15 years of wasted time. And it took me another 5 years to discover Hearing Loss Association of America. And that was life-changing, as I mentioned, because I didn't feel alone in those struggles. I felt supported. I understood that there were others like me. I didn't feel like an outcast. And I learned so much from people. And I was inspired by watching all these people with hearing loss out there doing great things. They were teachers, they were entrepreneurs, they were musicians, they won Grammys. I could do it too. It gave me confidence that I could do it too. So let's see. So I think there is another clip for the peer support. Do we want to watch that? No, okay, so let's click. All right, so let's go on to the second example on the next slide, second example of a mind shift. And here the attitude is, I want to hear better the way I used to. And the mind shift is, I want to communicate better. And it takes more than hearing aids to do this. I must use other skills and additional technology. And this is really what we talked about at the beginning, right? It's sort of shifting that focus from the hearing to the communicating. All right, so let's go to the next slide. So say your client's like, okay, I'm all in for this mind shifts. How do I do this, right? This is not an easy process. So there are a couple of strategies to do that. And the first is really to talk about optimizing rather than perfecting, right? So sometimes perfect is the enemy of the good, right? And so we need to shift our goal to making it better, not necessarily to making it perfect. Because communication situations are going to be challenging, period, end of sentence. But we can make them less challenging, we can make them better. So trying to have that sort of a goal in mind is helpful. The second is practicing to build confidence. So, how do you identify yourself as someone with hearing loss? I would always tell strangers first. Like when I was first starting out, someone next to me on the bus or on the airplane, I have a hearing loss, so I might not hear the announcement. If there's something important, can you let me know? And then each time you do it, it becomes easier. And it's just lower risk. Who cares? You're never going to see that person again. Practice, practice, practice. And then reinforcing the new attitudes. Things like a mantra. It sounds silly, but what you tell yourself is what you start to believe. Talk about how I can do this. Look at yourself in the mirror. I am going to focus on communicating better. And if you say that to yourself every day, eventually that's going to sink in. And then prioritizing self-care. This is an important thing for everyone, but one of the major realizations that Gail and I had about how we do well with our hearing loss is we take care of ourselves. We need to have energy. We need to have mental stamina. We need to have ways to deal with our frustration. So meditation, yoga, exercise, whatever your thing is, take care of yourself. Even if it's just sitting in silence for 5 minutes a day, with listening to some nice music. Anything you can do to strengthen yourself and your resolve to go out there and tackle the problem is great. Okay, so let's keep moving to the second leg of the stool is technology. And so for people with hearing loss, technology is sometimes difficult, right? We had that negative attitude about hearing aids are ugly and expensive and they don't always work. But to make sure that we're really getting the most out of this leg of the stool, we need to shift our thoughts to something like this. Technology is my friend. My devices let me hear sounds I had forgotten or had never heard before, and they connect me to the world and to the people that I love. So we should all be grateful for this piece of technology. So the next slide, please. And part of the issue is that people have with technology is they don't have the right expectations. And we talked a little bit about this too. Like hearing aids are not like glasses. They're not easy. It's not going to be perfect. We don't have the capability yet to make things sound normal, right? Back to normal. But this is what a lot of people expect because they're not told any different. So I really encourage you, and I encourage all the manufacturers out there with their products to explain that this is a help, something that helps. It's not going to transform back to normal. And so if people are expecting that, then they don't feel like they're failing with their hearing aids. They understand it's a piece of the puzzle and they can do more. So things like external accommodations, things like OTC devices perhaps for people with perceived mild to moderate hearing loss. I know that's probably a lot of fans of that in this room, but I think the more that people learn to take care and value their hearing in a variety of settings, the better off it's going to be for all of us and the entire industry, because it's those are the people that are doing nothing. So let's have them do something, and then as they get used to hearing better, interacting better, they will find their way to more professional devices and assistance when they need it. That's my thought. And then no matter what the device, we really are big proponents of both Bluetooth and T-coil because they're needed in different situations. And eventually T-coil will be phased out when Auracast comes in with the new Bluetooth technology. But for the moment, we need both. So I encourage people to embrace both of those for as long as we need. Okay, so let's go to the next slide. Here it is, I want to communicate better, and it takes more than technology to do this. I must use softer skills as well. So let's go to the next slide. And this is the third leg of the stool, which we call communication game changers. And this is sometimes just small changes in behavior can make a really big impact on how well you're communicating. So things like self-identifying. It sounds simple, but again, this is very difficult. There's a stigma. So do the practice, tell the person on the bus. You can even do it with your clients. Tell me, how are you going to explain to someone that what they need them to do? What do you need them to do? Do like a little dry run. Every time you do it, it gets easier. Self-advocacy, because self-identifying is really not enough, right? It's like, I have a hearing loss. Okay, what does the person do about that? You need to make sure that you explain to them what it is that you're asking them to do to help you to communicate. And bluffing. This is something that we call the anti-self-advocacy, right? And we all do it. I try not to do it. I admit I sometimes still do it. But it is the evil twin of self-advocacy. And we bluff for many reasons. Maybe we're exhausted. Maybe we're just not assertive enough. Maybe we just don't have the confidence to do it. But it's something that we really have to get out of the habit to do. And it's a hard thing. So encourage your clients, please, to be more honest about it. And then using other tools like speech reading and communication best practices. And then we have one favorite tool, which is on the next slide, which we call HEAR. And this is a communication checklist that your clients can use to improve any situation. So the first step is, am I hearing well? And can I understand what my communication partner is saying? And if the answer is yes, then you're done. But if not, then you go on to the next step, which is to evaluate the situation and figuring out what do you need to improve. And some of this might be environmental fixes, like maybe you need a different seat, or the lights need to go off, or the background sound needs to be turned down. Or maybe they're communication partner issues, like they need to speak more slowly or more loudly. And also technology tools can be helpful here as well. And then articulate it, and this is the hard part, to ask for what you need in a very specific way. People do not understand hearing loss, and they don't know how to help. But if you ask them very specific intentions, most people will want to help. And then revise and remind, because maybe a musician shows up, or maybe your communication partner forgets and falls back into their old way of speaking, which is very often the case. Revise, remind, and let people know that this is what we had agreed to do. Can you please do that again? Maybe use the nonverbal signals so that it doesn't feel like you're harping and yelling at the other communication partner. But the more that we apply these steps to every situation, it gets easier and easier. It becomes second nature. Now my family and I, we walk into the restaurant, they all look at me, they wait for me to figure out where I'm gonna sit, where they're all gonna sit, and then we sit down. So it just becomes part of the process. Okay, so next slide is putting it all together. And this is the final feature of skillful living and applying it to the most important areas of life, like your relationships, and also, I can tell you that in my family, we have some family meetings about my hearing loss. And this might be something that you can advise your clients to do as well. So we set ground rules for we're going to go on this hike, or we're going to go out to this restaurant, we're going to go out to this theater. These are the things that we need each of us to do to make it successful. And sometimes the teenagers are not so happy about having this family meeting, for the 15th time. But it's effective because even when I say we're going to just discuss this before we go out, they remember all the things and it just gets a little bit of a flash in their memory. So, and then there are hearing hacks, and we have a lot of these in the book. Hacks are sort of those workarounds, right? Efficient ways of doing things. And there are hearing hacks too. And one of our favorite ones is to make partners out of the people in our life. So a support network. You know, bring a hearing hack partner with you on a trip or to the movies, or someone in your work, someone in your office who you trust, who you can borrow their notes at the end of the meeting, something like that. Okay, so the next slide is all about hearing care professionals. And we're looking to you really to be our partners in all of this and our guides as we take on this challenging issue of hearing loss. And part of this is person-centered care, like we talked about earlier. And so this is really our philosophy, is that the best hearing care professionals are communication specialists who create personalized solutions, including both technology and non-technical strategies. We're really looking for a partner, and I hope after this talk that you'll be even more willing to partner with all of us. So this is the last thought on the next slide to leave you with. And living skillfully with hearing loss is an ongoing process. And so for each of us, the journey continues, and we invite you all to be on the journey with us. So I thank you all for your attention and your interest. I'm happy to answer any questions. There was a slide there with like my email and my websites and things, and I encourage you to stay in touch because I think it's so important to have an ongoing dialogue. So if there are any questions or comments, I'm happy to answer them. Yeah.
I just want to say I really enjoyed your presentation today.
Oh, thank you. You guys were really good listeners, and thanks for dealing with the technical issues with the videos as well. Yeah.
You brought some baggage to this particular situation.
I did.
Because of your family, okay? What about people who have a basically normal function and their hearing gets worse, okay? I kind of think I like to use a normal model because people want encouragement. One of the things that I really had to question was, well, it's not, whatever it's not gonna do, it's not gonna do. I like to say it will do, or build that kind of hope. And I found some of what you said to be a little discouraging, because what happens when somebody, you know, they don't hear it fine, they got a little older, they don't hear as well, their hearing aids done, they need to a lot better and they enjoy life. That's one thing that I think it depends upon where you're coming from, what your history is. If you have a history that basically was negative, then you may come into it with a negative feeling. If your history is positive, you know, everybody else hears, now I want to hear a little bit better and this will help me. I think that's one of the things that you need to differentiate when you see a patient. Is it somebody who comes with that kind of baggage, or is it someone who comes, you know, I had hearing loss as a kid, I was always in pain, like there's a, you know, that's a big problem. That may not be everybody. So I think we need to differentiate on patients who come in with a normal model as opposed to people who have been bruised in some way.
Right, no, thank you, that's a great point. And I think it's important to meet each patient where they are, right? Because each journey is different. But I do think that it's important to be realistic with everyone, right? And so I'm not trying to say that we shouldn't be hopeful, right? Things can be better, 100% they're going to be better. But I think it's also important that people understand that they're not going to be the way they were. Because then you're just disappointed. You're just setting yourself up for that disappointment. So it depends, right? It's every person. And, you know, these ideas are not just, you know, my own in terms of my negative experience. They're for people who, thousands and thousands of people with hearing loss. But you're right that you need to understand who that person is sitting across from you, what you think the best way to get them to take an interest in their hearing, right, and do better with their hearing. But I would encourage everyone to be as realistic as possible, because hearing aids are huge helps, but they really don't transform it back to the way it was. And a lot of them end up in the drawer with frustration and missed expectations. But it's good to say what they can do and what they can't do, and set the level playing field. So thank you for that.
Just a couple of questions, and we'll do it personal. You mentioned that you wear a wig, is that correct?
I wear lyric, yeah.
So I've practiced for 2 years. And lyric came on the scene, and I just discouraged people from it. Yes, for a couple of reasons. Number one, they're more invasive positioning, they're difficult for many clients to get out. They're generally a lower technology just because of the proximity to compound memory in higher sound vectors. They don't have Bluetooth, they don't have a cell phone connection by telephone, which you can advocate for. So if I can be very, specific, why are you wearing lyric and not behind you or something that has those technologies and more flexibility, directional microphones, just a whole bunch of things? So it's a personal question.
Yeah, no, that's a great question. And I think it highlights just, again, how personal it is for each person. So for me, when I started wearing these hearing, I had actually in the ear hearing aids before that, digital ones that I would take in and out. But I was so stigmatized that the fact that I can't take them out made me wear them, number one. Number two, at the time, I had young children, and they would cry in the middle of the night, and I wouldn't hear them if I didn't have my hearing aids in. So that was a huge positive impact for me. Number three, I have terrible tinnitus. And so when I have no sound coming in, I really struggle. But when I'm sleeping and I have the hearing aids in, I struggle less. And also in my lifestyle, I do a lot of like hot, sweaty yoga. That's what I do every day. And so to me, to be able to wear my hearing aids and be able to hear the teacher and hear people in that setting that I do every day is important to me. But you're 100% right. I wish they had Bluetooth. I wish that they were more sophisticated in terms of their programming. So I think of it all as a trade-off. Right? It's what are you getting from it? What are the things you're not getting? There's no perfect solution.
The second part to that question, you mentioned that you were using them and in your journey, you had not had measurements done in situ in your ear except once. Did you have measurements with these?
Yes, I do. I try and do it like every couple of years.
I don't mean that. I mean, did they put a probe microphone carried in my ear? And see, that's another real limitation of hearing. Because, we do an audio and you know how a patient hears. The next, when hearing at a base level is improved audibility at a base level. So without any measurements of in situ functional hearing, how do we know how you're hearing? We assume based on your report, and that's important, but there's the other side as well, the science side that says this is what you're hearing. This is your speech mapping, not too much pressure, you're above pressure, you're below UCL, all that. So I guess I'm just that concerned.
Well, no, I understand you. And so what I do is I go into the sound booth with the hearing aids on, and they just test me with the ambient sound. Yeah, so it's not in the ear, but it's basically my functioning, right? It's sort of how well I'm functioning. So, no, but thank you for that. Well, thank you all very much. I appreciate it.
Is everybody ready for lunch? Yeah. So Sherry will be out here with copies of the book if you'd like an autograph signed copy. And all the contact information. Please visit her, I'll talk to her personally, as well as enjoy the manufacturer's certified over at around 1 o'clock. Anything else, Carl? Definitely
you got
don't forget to check out a virtual auction. And for the virtual attendees, sign back in at 1, right?
Yes.
Okay, all right. Enjoy the great time.
Okay. I know, but I was. Can you hear me now? Get away from there. Okay, hi. So everybody's on lunch, but we're here with some of the exhibitors.
Yes.
And we are.
Caption call by Sorensen.
Okay, so tell everybody what you do.
Absolutely. So caption call is a captioning telephone right here.
Okay.
We also
That's
provide
cool.
the captioning telephone service. It's provided cost-free as a part of the Americans with Disabilities Act. And that includes the installation of the phone as well as the service itself. The standard for eligibility is folks that have hearing loss that requires captions, right? So in short, if you need captions to function normally when you're on the phone, then you're eligible for caption call. Absolutely no cost at all to those that require it, and we're happy to help. So feel free to reach out.
Yeah, that's amazing. So this is a resource for, obviously this is an educational workshop. So how do people, where's your contact information? Anywhere on here?
Caption call.
Oh, look at that, guys. If you were here, you could get one of these.
By Sorensen.
There we go.
Let me try to find it here. We don't have our new business cards yet because we're in the process of rebranding from Sorensen to Caption Call.
All right. Well, anyway, so support your sponsors,
everyone.
everyone.
We will get you some contact information.
We'll post it in the
Thanks
feed.
so much. Appreciate
All right. Now we got, who do we have? Hello.
Hi, Melanie Holman from Signia.
All right.
You're going to do it on NOAA.
So I cover New Jersey and Delaware.
What office are you in?
Pretty soon, Jamie Lotion will be on
Where's
to
your office?
present virtually to everyone.
You're unemployed right now. So how do you have
card?
no? You have no on your personal computer?
And here's your information. So, you guys are basically hearing aids.
Oh, yeah.
I know. I'm the video person, so I.
Oh, my friend's talking to me.
Oops.
So we're all pretty much hearing aids. Yep.
Yay. Okay. Thank you. Thank you.
You're welcome.
All right. Who's up? Who's speaking? Wave to everybody. Okay. So.
I'm Beth Christie. I'm actually going to be presenting for Phone App later.
Oh.
So you guys will be seeing me online. And then this is Natalie.
Hi, I'm Natalie Faison. I am.
Okay. Well, I'm going to give you John Russo's
Awesome.
number.
All right, guys. If you were here but you're not, you would get all this cool stuff because we all like the tchotchke. And then we got the notebooks over here. So anyway, tell everybody who you are.
Hello, I am Mindy Stoller with Unitron, and
Welcome.
to our table.
Nice.
What would you like me to
Well, you
share?
want to tell everybody who's watching potentially what you guys do? Here, also hearing exams.
We are obviously hearing aids. The Unitron brand has been around for a very long time. We are most known for our connectivity.
Oh, look at your little
Our
bus.
little bus. We are most known for our connectivity to both Android and Apple, and having two simultaneous connections at the exact same time, as well as our Flex upgrade.
Nice.
So both our hearing aids and our child aids can be upgraded.
Cool, very cool. I'm learning a lot today, and I'll be back for one of these notebooks. Oh, so she's talking to someone. Oh, we're going to come down here. Hello, I know everybody's at lunch, everyone, so excuse the food.
Yeah, excuse my plate.
So we have another exhibitor who sponsored this. Hello.
An audiologist with E3 Diagnostics. We're the equipment company, so we do the calibrations, we do all of the equipment from the audiometers, Tim's rear, everything. We're even in the occupational health area now, so we do everything. So if you have any,
You have all these little gadgets.
yes,
Look at
that's
that.
the audiometer. So
And you show people how to use this?
yeah, so I am an audiologist, so I do the clinical training as well. When people purchase equipment, we go in, our techs put it in, they calibrate it, we show them how to use it, we show them how to use the software for data transfers, set up templates, networking, because the Verifit kind of works in NOAA as well, and some of our equipment works in NOAA as well, so that everything can save in their future.
So one of the key things I think you said here was customer support, because technology, we're getting into new age. A lot of people in this industry are older, like from, that have the need for this, right? So you will help them.
Yes, so that's what's good about E3 Diagnostics. They used to be regional companies, so they bought everybody around the country. So we're now a nationwide network. So I was E3 Northeastern out of New York, and Northern New Jersey, there's E3 Mid-Atlantic, and Philly, South Jersey. So Sherman was supposed to be here. He got stuck at a customer call. So I'm by myself today, but yeah, usually there's always a local rep close by with E3.
Nice.
And we do booths and everything, so if people need booth moves or set them up, we have booth installations.
So you do it all.
Yes, we have everything.
You have everything. Well, enjoy your lunch.
Thank you.
Let's see who else we have over here. We'll be back. Oh, we have, WitX. Hello, you're on streaming now. We figured while we're at lunch, tell everybody a little bit about yourself. I know you're speaking soon.
Yes, I am. I'm speaking 1 to 2. This is our WideX table. We are a hearing aid manufacturer. So we'll be talking today about our new WideX Moment Cheer launch. We'll talk about our premium technology, why we have the most natural sound quality in the industry, and kind of back that up with some research that we've done. We will also talk about our new modern design packaging, which isn't laying out at the moment. Wish we could give you guys away some free stuff.
Oh, you guys would have had some mints.
I know. Oh, no.
They're virtual.
But we'll talk about our new premium packaging that we have, as well as what's new with the Moment Cheer update. But yeah, we have a whole range of products from behind the ear to in the ear. We have direct Bluetooth streaming. We just won an award for our app, so really, really easy to use, user friendly. And hopefully everyone can join in on the presentation. Can they do that virtually?
Yeah, they are watching you now.
There you go. So you'll see me in like 30 minutes.
Yep, I was just saying. Okay, everybody. So this is it for the vendors, and some of them will be speaking. We have our author. You heard her earlier speak. She's over here book signing. But you can purchase her book on her website, which is being streamed right now during the breaks. So anyway, if you liked what she had to say, which I thought was very interesting, definitely go out and purchase the book, support a local author. And then we have one more person we can't miss, Otakon, right? Did I say that right?
It's Otakon.
Otakon, just saying. Yeah, just say hi. You're going to be speaking as well today.
I am.
I know. So everyone, you're streaming live now, just so you know.
Okay.
Yes, we're going to be talking a little bit about what we've had addition to the Polaris platform today, and a little bit about wireless technology and what's new on our product portfolio. That's where we're going to be heading today. So we have custom in the new Polaris platform, and that's been added recently. Plus, we have our new smart charger. So I'm just going to talk a little bit about that when we go up front presenting.
Okay, awesome. And thank you again. This is one of obviously with the sponsors to make this happen. And here's some of her information. All right, we'll see you soon. Bye, guys. Okay, everybody, we're going to go back, but say hello. Anyway, so this is the room. I know you guys aren't here, and it's been hard to, you guys to see the speakers and stuff. But basically, this is behind the scenes. Okay. Well, anyway, we're going to go back. We'll see you guys at 12:55. Right hand, the other one. Share screen. There she goes. So.
Yeah, that's your sister. Are we ready to get started?
We're started.
I know, that power to the afternoon. Where is Okay, everybody. And hope everybody enjoyed their lunch. There was some good stuff out there. And got to visit with the manufacturers and discuss things through networking. So our first speaker of the afternoon is Ashley Gutierrez. She will be discussing sheer perfection, as Widex has always been in pursuit of a perfect sound, and the Widex Moment Sheer line is no different. She is joined by her co-worker. I don't know, you're good. Michael Steinman from Widex, who's been with us many, many, many years in a row. I'm told he has 1 minute to speak, and then Ashley will take over.
Start doing it after 60 seconds.
I already told Ashley it'd probably be a little bit longer because I see all this excitement in the crowd.
Right, that's it.
Especially Dan. Hi, Dan. I'm Michael Steinman. I'm the, can you hear me without the microphone?
Yeah.
I'm the regional sales manager for New York City and New Jersey. I see a lot of familiar faces here. First off, it's a pleasure to have Ashley come up from Washington, D.C. area to present and go over our latest product launch on this year. I just wanted to maybe take a minute to get some feedback from the audience on the market, what you guys are finding. Are you seeing now that in October, OTCs are entering the market, any feedback from you guys on what you're feeling out there?
Well, I certainly hear more from patients that come into my office, but they almost discount it themselves because they're coming to me for the service of fitting. So I may be a little bit different office as far as, smaller.
So you're seeing them, they're bringing it up, but they're really there for your services.
They understand, right.
Any other comments on that? Yes.
I had one patient called the other day, and I saw him in 2016, and he has tinnitus, and he wants to know over how hearing aids are going to help with his therapy. So he scheduled an appointment to come in, and I told him to contact him.
So that is more complicated of getting this tinnitus.
I told him it's not how to affect his head.
Yeah, I think it's really interesting. I think it's a pivotal point right now in the industry. In fact, the questions we look at for someone that's been in the business for a couple decades or more is, there's always been something out there that would try to disrupt the industry, and then you come back and step into reality. What do we do as a profession? What do we do as an industry? And what do we do as a business person? I found it very interesting. The Widex position is, Widex is it against or for OTC? We'll work with every private practice and healthcare provider and help them evaluate what's good for their business and what's not good for their business and support them. And what really differentiates Widex right now in the marketplace is our new technology, which Ashley will get into, but it's in detail. Our dedication to the profession. The founding fathers of Widex are still highly engaged in a big investment to grow the Widex company with the WSA merger. And that is to be able to continue providing top tier you guys who are very good professionals. So that is one of our biggest dedications to the profession. And lastly is our service. For those of you that work with Widex can attest that, you know, we try not to miss a dime. We don't see a lot of head shaking, but my team handles everything with alacrity. We're part of the process because we know how important it is when patients have cancer. And we know how important it is for you not to question in that moment on how you can do it. And I think that's
Hey, Michael,
a big thing.
we had a couple people say they have a hard time hearing at home. If you don't, I know it's
Use the
to use the microphone.
I'm sorry, guys.
Take it
I
out.
just babbled for a while.
You can take it out.
But the bottom line is I'm just trying to emphasize on where Widex fits in the industry, what the, you know, the state of the industry and kind of our position. I've been having a lot of meetings with a lot of people, both, you know, peers of mine in the industry or in my company, as well as with a variety of different types of hearing aid mediums, whether they're ENTs, hospitals, private practices. And it's been really interesting, and I think one of the most important things when it comes to OTC is understanding the difference between what is a consumer-driven product and what is a medical-based care provider product. And we are care providers here. And in relationship to that is understanding your numbers, understanding your margin per hour, and knowing that if you do go down these venues, yes, there could be financial rewards and there could be also financial failures. So that's kind of, you know, my personal viewpoint of working with, you know, our various partners. But to finish it off, we're very happy to be here. We're very happy and excited to support the organization and support the group. We hope next year more people will be able to come here in person so we can have a much larger group and really be able to brainstorm. So before Ashley gets started, I just wanted to take a moment to see if there's any questions about WSA, about Widex, or about the industry that I can personally answer. And if not, I'll move on. Yes.
Recently, I've noticed that Signia started sending UPS labels with the Widex address on them for repairs. So are repairs going to you guys for both manufacturers?
That would be more of a Signia question, but what's happened is I know that through our manufacturing part of the merger, you know, we've invested significant amount of resources to handle service, manufacturing, repair. I know Signia is manufacturing in a plant in Mexico. Widex products in the US are all made out of our facility in Hauppauge. So there's probably, they also, I believe, service some of the Signia VA out of Hauppauge, so maybe that might be why that's happening. But it would be, but just to be perfectly clear, the Widex roadmap and product roadmap and production roadmap and the Signia product roadmap are apples and oranges. We're continuing, and which Ashley will get into one more point is Widex is very different in how we design our product, our technology, and our circuit. You know, Widex bases its technology on a time-based filter. The rest of the industry is basing their products on a frequency-based filter. So to make it simple, in a frequency bank, you have to handle each frequency exactly the same during the time of processing versus a time bank where you're focusing on the specific areas that you're trying to handle. And that enables us to process a sound for an open fit candidate in 0.5 millisecond, which is groundbreaking in my opinion. And so we're going to continue going down a different channel. Any other questions or? Nope. All right. Ashley, I did it in 4 minutes and 37 seconds.
Yeah, right. We all know it's longer than that. Hi, everybody. Nice to meet you. I'm going to be snapping at the back because I have my slide changers back there, so I'm not being weird, I promise. I'm just trying to get the next slide. So we can move on. Perfect. So I do work for Widex, and thankfully they pay me. That is my financial disclosure. All right, so you can actually click probably 3 times, pardon all of our slide fun that we have.
Yeah, there we go. So today we'll be talking about the WideX Moment Share launch. I'll try not to be long-winded, but I definitely want to get all of the important points specifically on our unique technology and what makes us different. So with WideX Moment Share, we are not abandoning our Moment chip. We are still using our Moment technology. However, we've added technology to our platform to really focus on these three areas, especially coming out of the world of COVID. We're really focusing on engagement and well-being. The number one thing that they have seen and studied in the Department of Health and just in various research, not at all related to WideX, is that the number one thing that people relate to their well-being is social engagement with others. And as we know, people with hearing loss have a lot of trouble in this area. So we need to really enhance that as much as we can, going beyond hearing and just really looking at how they're living and how they're engaging to make sure that they have this concept of well-being, right? And then we will talk about our perfection of natural sound, as well as our new updated modern design of our packaging and our devices. Everyone online is probably like, what's going on? So looking really quick at modern design, we could actually go to the next slide. Basically, what we want to drive home with this new design that we have of our products is that it might not matter to everybody, but it definitely matters to some people. Me being one of those people, I am guilty of paying $20 extra just because I think it looks prettier. So that is kind of the story of my life. And we have patients coming in that are spending a lot of money on hearing aids, and hearing aids should look like the premium technology that they are. We should not be giving them in just a cardboard box and saying, thanks for your $5,000, I hope it works well for you, right? Think of packaging an Apple iPhone or a MacBook and kind of how that experience is. That is something we want to really as well, especially in the climate of OTC, where we are really trying to distinguish ourselves and set ourselves apart as this unique product, as this luxury product that they're going to get good service, good care, good technology with. So if we look at the next slide. Oh, we have technical difficulties, so now you just get to stare at our pretty hearing aids. Thankfully, I memorized this PowerPoint. So the next slide talks about a study where they look at consumers of medical devices. It has nothing to do with WideX, it's just regular medical devices. And it basically is showing, in a way, the placebo effect, but how it doesn't just stop there. So things that looked better and were presented better, people actually felt worked better, even if they didn't, right? Now, we're not saying that our technology is bad, so thank God it's pretty because they're gonna think it works good, right? It doesn't always go that far. And we kind of saw that with Bose, right? Like they let out a product under the Bose name and we're just gonna think, oh, because it's this product, it's gonna be wonderful and that's all we need is the name. But it goes to show that you always need more than that. You need the technology to back it up as well, right? Which is something that we all know in this industry. But the way that aesthetics look in medical device design does drive the consumer report of that product and their confidence in that product. You can click. And that's everything I said, but in a quote. Moving on. So looking at our elegant design a little bit more up close, we've changed the body of our receiver as well as our charger. We didn't just make it more pretty, but also more stable. So the electronics were moved a little bit more towards the bottom to make it bottom heavy. And since all of you were ripping off the cap anyway, we just ripped it off for you permanently. And now there is no cap on top of the charger. You can move on. And then our updated jewel case and packaging, again, to go with that aesthetic. And we actually are a very green company. Our international headquarters in Denmark is actually like completely wind powered. So we are also very much focusing on making sure there's nothing in our packaging that doesn't need to be there, that's just getting thrown away, as well as sending things digitally as much as possible, QR codes. But of course, patients who still like those hard copies, we can still get those out. But that was another thing with our modern design that we wanted to push forward was sustainability. Okay, moving on. And then our new TV play and our sound assist, they also got that design update, and we will be talking about the sound assist a little bit later, which is our new technology for our accessories. So we can move on, and I'm pretty sure now it's gonna go to natural sound. Beautiful, so we can click again. looking at our natural sound. So this is something that we say, Widex has the most natural sound within the business. We have the most natural sound quality. And I don't want that to just be my opinion. I want to show you why we truly see that as fact. So when we look at people with an open fit, and you have fit them with a hearing aid. So let's say they have mild to moderate hearing loss, they have an open dome. How many of you, by a show of hands, when you turn on the hearing aid and the patient starts talking, they go, oh, my voice sounds really weird. I sound like I'm in a barrel, or I sound like I'm in a tunnel, or it sounds echoey. Has anyone ever heard that from their patient? Yeah, pretty much everyone. So I heard that from my patients all the time. And I remember I'd just go in and do programming changes, like, oh my gosh, and I'm like, you'll get used to it. You'll be okay. Come back in a week, listen to it. Your brain will adjust, right? But there's a reason why that's happening. It's because they have the natural sound coming in through their open dome, but they also have sound coming through the hearing aid. And that sound takes time to get processed. On average, 5 to 8 milliseconds. The brain detects anything above 1. So the brain can tell that there's dual signal coming in. The signal they hear naturally and the signal they hear through the hearing aid. So they're actually not just trying to annoy you, they're being serious. They do hear that dual signal that's coming in. So if we go to the next slide, in the industry, the average is 5 to 8 milliseconds for open fit hearing aid in terms of delay. At Widex, because we process on that time domain filter bank, we are able to get that down to 2.5 milliseconds in universal and 0.5 in our pure sound program. So that is below the detectable millisecond range of the brain of 1 millisecond, and it is able to eliminate that barrel echo sound with people who have an open fit hearing aid. Now, a lot of people ask, then why doesn't everybody just do that? If it sounds so much better, right? Why wouldn't we just make that the standard and make that for everybody? And that's where my next slide comes in. So the reason being, again, I memorized it. The reason being is because not everybody works on that time domain filter bank. So since we are able to get that down, you can now see the signal that's in the ear canal. It isn't that dual comb filter signal. It's very smooth because they're meeting up in an undelayed way, and the brain is getting that pure signal that's coming in. And in the next slide, it shows where that happens in the hearing aid. So we won't go through a whole acoustics lesson, but the input signal comes in, it hits your A to D converter, your filter bank separates that signal into a bunch of pieces to be processed. It then puts it back together and gives it to the ear, right? The delay is, how long does this take? 5 to 8 milliseconds on average. In pure sound, 0.5 because of that filter bank right there. We are the only hearing aid manufacturer that uses a time domain filter bank, and what that means is that we get to choose our bandwidth. So our bandwidth is specific to the frequency, lower bandwidth for higher frequencies, higher, wider bandwidths for lower frequencies, so that we can mimic the cochlea as closely as possible, instead of being forced to have the same bandwidth for each frequency, which is what happens when you're processing on a frequency domain. So that is why, because we process on time, we are able to get this delay down, and it is able to sound as natural as possible. And that's why we have the most natural sound quality, because we're able to do that. So we can move on to the next slide. Data, right? So how does that actually correlate in the real world? Does it actually mean we have the most natural sound? And the answer is yes. So when we look at studies, people perceive their space in a room as just sounding right. Whenever we are in a room, just hearing someone talk to you, when that reaches your ear, so you can kind of see by those blue and those red lines, that is one spoken word and how many times it hits the patient's ear. So you have the initial reflection that tells you how far away I am from you. You have the early reflections that help you understand what was being said. You have the late reflections that tell you how big the room is, whether it's carpeted, wood floors, right? It's the equivalent of when someone says something to you like, hey, can you grab this for me? And you go, what? Oh, yeah, I'll grab it for you. It's those early reflections that are kind of processing in your brain that help you to pick up on that. Imagine you get those, and then you get them delayed and amplified. That's when those red lines come in, right? So now that person has no idea where they are in space. They don't know how far that person was. The early reflections are a jumbled mess. And that's how that delay really affects them. And imagine a person who is also blind, who uses their ears to know where they are in space. This is extremely detrimental. Similarly, with the low delay, we have a lot of EFR data. So looking at brain waves and how they respond to the envelope of sound, with less delay, there's a better neural representation as well. So, next. You can go ahead to the next slide. All right, so looking at our new ear tips, you can move on to the next slide, and I think it's gonna make you click a couple times. Yeah, just go click happy like 2 or 3 times. Beautiful. So this is just showing that we do have our True Acoustics software. So in our software, when you're running a feedback test and when you're setting the acoustics and running your sensogram, you are not just looking for feedback and running an audiogram. It's actually getting all of that information, such as vent effect, ear canal volume, vent diameter, insertion loss. It's measuring all of these things to get as close to a real ear fit as possible. And we've studied this on hundreds of ears with all of our different dome ear tips, because as we know, people's ears are all different, and a dome isn't just gonna fit every person's ear perfectly and make it so that they have perfect occlusion, right? So if you move on to the next slide, it'll show our new ear tips that we have, and you can click 2 more times. We have our open round, our sleeve vented, and our sleeve power. Open round is gonna close up a little bit more compared to the open, so that person who isn't quite an open fit, they need a little more gain, that open round will come into play. And then our sleeve domes are kind of elongated and curved, so they fit the ear canal very, very well. And the sleeve power actually on average is gonna be able to hold in around 5 to 10 dB more in the low frequencies compared to even our power dome. So that's gonna capture a lot more hearing loss with the dome before having to move on to a custom. And if you click on the next slide, you'll kind of be able to see that data that we got from that study. And this is pretty much showing that you need vent effect and you need to get all of that information from a fitting. You need that real ear data, because at any given time, a dome can be acting in any way. So let's say that double dome, right, that power dome in the orange. At any given moment when we looked at these patients, they were losing anywhere from 10 dB to 40 dB in the low frequencies, just depending on how it fit their ear canal. So that information is extremely important for us to know that we're fitting what we think we're fitting. And if you go over to the next slide, it'll show the averages of these, another animation you can click again. It'll show the orange line, and that is going to be the average for the double dome, and the pink line is the average for the sleeve power. So as you can see, it's holding in much more gain in those low frequencies, closing it up a little bit more. And then this is just what it'll look like in the software, so you can click, 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 click. And this will be the new recommendations. So it'll determine the hearing loss, and it'll look at that true acoustic study, and it'll target which dome it finds most appropriate based on the patient's hearing loss. And no fear, the tulip dome is still an option, so we're not taking any of the domes away. Okay, you can move on. You can move on. So this is just showing the importance of that. This is a really good feature that we have with Moment Shear as well. So a lot of the times when you have a repair, so let's say the patient needed to repair their right hearing aid, it was sent in, they go home with their left hearing aid, you're in the office and the right hearing aid comes back. Typically, you would need that patient to come in so that you compare the right and the left ear together in the software. With this option, you no longer have to do that. So you just click replace one hearing aid of a pair. It'll detect the new repaired hearing aid and then ask you which hearing aid is being repaired or which hearing aid is new. You would click right. It would connect them both in the software, and now you can just leave that at your front desk for the patient to pick up. They're paired together, they're working together. They don't need to come in just for the matching. And if you pair that with our express repair, which brings in a hearing aid overnight, you can express repair, replace one hearing aid of a pair, and now that 5 to 7 day to appointment repair process just turned into a 1 day 0 appointment process. So it saves you a lot of time. Okay, move on. All right, you can keep clicking. So now we'll look at how we are helping with engagement and well-being. So if we click 3 times, Our new Sound Relax, My Sound, and Sound Assist is what's going to be contributing to this new engagement and well-being technology. So first looking at Sound Relax on the next slide, this is the update to our tinnitus performance, and we can click one more time. We can click 3 more times. So we started with Zen in 2008, and now we're working with Sound Relax. So it is our patented technology. You can click, I think, twice. And this is just looking at our, that's okay, I could talk about it. So this is just looking at our fractal tone technology, and this is patented by Widex. It's something that is very, very well researched and studied as our patented tones, and it makes it so that they sound musical and they stimulate that central nervous system, but they do not repeat. So the brain isn't able to just latch onto it and ignore it. It actually is continuously listening to it in conjunction with the tinnitus to really work on that tinnitus management and that habituation. So if you move on to the next slide, and then the next one, and the next one, and the next one, and the next one. If I knew I didn't have a clicker, I would have eliminated all of these, sorry. And then when we look at our new Sound Relax tones, everyone, we looked at them compared to Zen Aqua, and all of our new tones were actually preferred to Zen Aqua. So all of the new 8 are kind of the new favorites, and not only were they good for tinnitus, they were good for people without tinnitus as well. So they promoted well-being, they promoted relaxation, concentration, and just had the patient feel better. So think of like studying with classical music on, right? It just helps to promote this sense of well-being and concentration. So now anybody can use these Sound Relax tones. It's not just appropriate for tinnitus. Did you have a question? Yeah, go for it. Yes, so they are still dichotic, and what that just means is that they play differently in each ear. They're not as dichotic as Zen Aqua and NEM were, because Zen Aqua at some point would be like da 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 da, and it would like scream in one ear. So we made it a little bit more peaceful, but they are still dichotic in nature. Yeah, a lot of people were like, absolutely not. So we changed that. So you can move to the next slide. Next slide. This just shows them, so these are the 8 new ones. You can go ahead and listen in the software. We don't have audio in the PowerPoint, but you can take a listen to them. They are really peaceful to listen to. And then you can click like 3 times. These next slides are just showing that we have Pure Sound as a base program for Zen now. So that 0 delay, 0.5 millisecond delay program can now be a base program for Zen as well as Universal. Okay, you can move on. Click, click, click. I don't want to take all your this time. Okay, so My Sound is the artificial intelligence in our app. The new update with My Sound is basically that it now includes compression. So the AI in the app is where the patient can make changes in real time using our database of suggestions, and they can geotag that program that they make to that location. Now, while that program is being made, there is also compression that's going on in the background to make it even more specific for the patient. You can click compression. Michael took all my time, so I have to hurry up. Keep clicking. That was just a long way to telling you everything. So. I really just want to get to Sound Assist, so you can click, I think, 2 more times. 3 more times. There we go. So this is the last part, and then I will be done. You can click like 2 more times or 3 more times. Perfect. So this is our new Sound Assist technology, and this is kind of where I'll end. This is our new accessory. It's about the size of an Apple Watch face. I think it's coming around. It pairs with our Direct Connect hearing aid, so any hearing aid that has a D, and it serves these 6 functions. So it can be a table mic that you can directionalize in any direction. It works as a remote mic for the patient and for their speaking partner. It can Bluetooth, Direct Connect Bluetooth with up to 8 devices, laptops, phones for 2-way audio streaming. It is a portable telecoil as well as a remote control. So it serves a bunch of functions, really, really tiny, and not too expensive, but you can talk to Michael about that. Moving on. So right to the next slide, this will just show you the functionality. Techie diffies. Anyway, I'll just tell you. So there's a middle button in the center, and when you push that, that's going to be all of your functionality for whatever mode you're in. So let's say you're in Bluetooth mode, that middle button is answer and hang up. Let's say you're on a phone call or you're streaming audio, it's for play and pause, right? So depending what mode you're in, that's what it's going to work for, that center button. You have the volume and the program on the side. Your clip for remote mic and your feet grips for table mic are embedded, and the device knows what mode it's in based on the accelerometer. So if it's up and down, it'll automatically be in remote mic mode. If it's on a table, it will automatically be in table mic mode. And then there's a power button. Next. And that's it, thank you. Okay. Oh, 135, I actually did really good.
Thank you, guys. Any questions on this?
Thank you guys for your attention.
All right.
Thank you, Flicker.
Sorry, I broke your finger with all my animation. I'm like, click, click, click. You know, it's the afternoon.
I've been considering.
It's Friday.
Okay, we're.
I had to put up on my. So I do have a few videos in this. I know that the audio is not there, so I will walk you guys through it. Okay. Hi, everybody. I am Beth Christie. You can go to the next slide. And I am the South Jersey, Eastern PA, and Delaware PHONAC representative. I have Natalie here as well. She is the North Jersey, Eastern PA, and then Staten Island, a little bit Staten Island representative. So we're outside, so if you guys have any questions, today I really want to discuss with you guys our new product line called Lumity. There is a video, so you can watch it. I'll just kind of walk you through it. So you can see here that conversation time with Lumity, and it's going to kind of go into and show you some of our new products. Well, you guys got to see some of the new features with the products. So you were able to see just some of the new features that are in the product. All right, perfect. Sorry, a little bit of display difficulty. So at PHONAC, we really are looking at the well hearing is well-being, and with the new Lumity line, we really focused on the algorithm. So as you know, we've launched Marvel in the past, and Paradise was our recent line, and then Lumity has kind of come out recently in August, actually, and it's really focused on specific areas where patients have been saying that they need help. So we really want to make sure that we're hitting on all these different things, from the cognitive, the physical, and the emotional part of well-being for a patient. And today I'm going to kind of go through some of those aspects with you guys. So I'm going to talk about some of the features and some of the new features of the products. There's going to be some things that are going to be very reminiscent of our Paradise and Marvel lines. But I think all of it will make sense to you guys because it's really what's going to help the patient out. So we can go to the next slide. So you can see here, what do consumers want? So if you can just click 6 times, it's going to fill in each box. These are probably not new areas for you guys. They're all the things that you guys deal with on a daily basis. Distance, environment, loud noise, being able to hear TV, speech cues, not being able to see somebody with and being able to hear them talk, and then even soft speech in a quiet environment. So what we did was, when we focused on updating the algorithm, we looked at these areas and how can we help patients with these specific issues. And when we did that, we didn't just launch something where we didn't have any studies. We want to make sure if we're going to upgrade a product that we're actually gonna have some kind of information to tell you whether or not how the patients are going to react with them. So AutoSense 5.0, which is basically our upgraded automatic AI-based multitask learning system. Some of the things that many people may not know is it's analyzing the environment 700 times per second. So that really does kind of come up with some of our new features that have come out with this product line. But that's pretty fast, and that's a lot going on in that little hearing aid. Because it's analyzing the environment like that, it's creating unique programs. So we do have a lot of set select programs, but what happens is the hearing aid hears the environment and then it puts in a little bit of this, a little bit of that program, which creates these unique programs to match the environment so that the patient can hear the best in there. We've kind of, and you're gonna hear a lot of S's, we really wanted to really hone in on the S qualities of speech with our new characteristics and our new features. So smart speech technology is something that we kind of coined as far as the new features, and some of them are older features, but we really kind of clumped them together. These are the ones that are gonna help your patients the most. So we go to the next slide. And if you click 3 times. Oh, sorry, go to the next one. So similar to Marvel, with Marvel was our first Bluetooth connect to all technology. And then Paradise, we kind of upped the ante by connecting to 2 devices. So we still connect to all, which means your Peloton bike, to your smart TV, to your hearing aids, to whatever phone you have. We do have that made for all connectivity. We have 8 Bluetooth pairings, which some people don't realize. What that means is you can connect to 8 different devices in your home or wherever, and they're stored in the hearing aids. So I could be connected to different devices, and then when I don't want to be connected to those 2 specific devices that I'm streaming to at one time, I can turn the Bluetooth off, and I can just switch to a different device. Which just makes it easier for the patient, so they're not constantly repairing, and doing all the pairing incidences. So you have 2 active, so my iPad and my iPhone at the same time, and then I can store 8. That was something that was available in Paradise. Can you go to the next slide? Watch this.
Hear the big splashers with Monaco Neolite Lumity, a waterproof hearing aid with smart speech technology. So no matter who is speaking, conversations shine with Lumity.
So I guess you guys can hear that then. So that's me up here. So some of you have seen the new Lumity product, the new Lumity Life product, or maybe the Paradise Life product. Can I get a show of hands of who has experienced Life? Just figuratively? Okay, great. So this is the first waterproof rechargeable hearing aid. So as you can see here in the front, and we'll pass this around if you guys haven't seen it yet. This product has been thoroughly tested in different environments. One of which was, they've done salt water, fresh water, and then we also did chlorinated water. We put it in a humidity chamber, so we made sure that, if a patient was traveling into the rainforest, which I do have one that actually went to the rainforest, and they still work. So they are completely sealed with silicone, and they have the ability to be dropped in water and then picked right back out. There's no pins, if you send this into us for repair, we send you back a brand new one. So this type of hearing aid is very, very durable. It has a unique charger in it. So the charger is a power pack built in. So you'll see in the front that there's a bunch of little lines. This is the charging of the power pack. So this has 3 full charges in it. It is an inductive charging, so you just drop it right in. And it has the new Lumity algorithm in the new Life. I know we did a lot of L's and everything, so I'm gonna try to simplify it for everybody. Waterproof Lumity, so it's Life Lumity, and that's gonna be your waterproof one. Then we also have our just plain rechargeable. So the just plain rechargeable Lumity, this comes in T-coil or no T-coil. So that's our tree, right? Waterproof, so if they want waterproof, you go down a waterproof route. And then if you want just the rechargeable T-coil, you go down the other route. People have asked me, well, why would I want waterproof versus life? Like, what's the difference? So size. So when I pass this around, you can compare the sizes. If someone wants something smaller, I would probably go down the illuminated rechargeable route. If somebody doesn't really care about size and they want a sun up to sun down hearing aid, which means they can go in the shower with this hearing aid, they can go out swimming. I have students that are on a swim team. They wear this and our Roger product. They literally swim all the time with them. So you have that ability. If they want a power pack, they have to go with life. We do not have a power pack for the rechargeable. So there is a difference there as well. If they need a T-coil, you're gonna have to go to the rechargeable T-coil. So they all come in 30, 50, 70s, 90s, so they're all available in all the different lines, but that's kind of your breakdown, I would say. Size, you're gonna go with the smaller one, but if they don't care about size, and they don't need a T-coil, I would go with the life, mainly because you never know what your patients are gonna do. I feel like this is like future-proof. Like if your patients decide all of a sudden they want to do water aerobics, they don't have to worry about their hearing aids. If they decide they want to take a trip somewhere, maybe Seattle where it rains all the time, they can wear the life hearing aids. Yes, Jim?
The rechargeable one, just having to know someone take off the bottom box, if you take it on the plane.
You can carry it onto the plane. I wouldn't pack lithium ion in the suitcase. Yes. And if you guys have any questions at any time, just raise your hand.
You guys have a warning in the box, not the
Correct, because they'll go ground to you. So just an FYI, because this has the larger lithium ion inside of this goes ground. So, for the most part, it's not supposed to be, flown in the air and so forth. So you'll see, like, it has all those warnings on the box when you receive them. But the patients can bring them in their carry-on bag as they go into the plane. I know.
Well, the plane up inside.
Yes. So as for the comparison between Paradise and Lumity, is the big difference is going to be what I'm going to go through next is basically the features. The colors are very similar. Obviously, the Life is a similar product as far as the waterproofing goes. So we do have a Paradise Life and we have a Lumity Life, but it's really the algorithm. If you go to the next slide, all the receivers are forward and backwards compatible. So you don't have to worry about getting new receivers or anything like that. And then if you go to the next slide. So smart speech technology. So this is where we really kind of get into the nuts and bolts of the differences. Next slide. So this is just a little diagram of the features that I'm going to go through that we've either updated or I'm just going to kind of emphasize because a lot of people may not have realized that we've had some of these features in some of our previous lines. You can go to the next slide.
With smart speech technology, so no matter who is speaking, conversations shine with Lumity.
So the first feature I'm going to talk about is called speech enhancer. So I'm sure we've all had those patients and you're in a calm room, just your room where you're doing your audio and you're talking to the patient and they still can't understand you. And you're like, oh, we're in a calm situation right now and they're struggling to hear me. What am I going to do? So in our 9th level product, we have something called speech enhancer. This is a little snapshot of Target, and you can see it is the second one down. It's called speech enhancer. Typically, it's going to be set to 0 because we give you guys the ability to turn it up. And so what it focuses on is that soft voice and enhancing that soft, like that we just saw a video of a little girl talking to her grandfather, so just being able to hear that soft voice. And what we've done is we've tested it out on and off in quiet environments to see how the patient was perceiving listening effort and whether or not they felt like they were still struggling in those quiet environments. So this is basically one of the, you can see here, the green line is with the speech enhancer on, and then the gray line on top is the speech enhancer off. And so, oh, sorry, I'm going through the slide, sorry, next slide. So here's the listening effort. So you can see the bottom line is the green line where the speech enhancer is on, and then the gray line is the speech enhancer is off. And so this study is just showing you that the patients who were wearing it and they had it on versus off, they weren't struggling, they weren't leaning forward. And so this, including too, we also have something called, the soft noise reduction, which is like the fan and just normal soft noise background. By adding that and this speech enhancer, you really kind of get like a 1-2 punch for those calm environments and really helping patients to hear better. And this is kind of a reason too, I know a lot of times we think of 90 level products, we think that's only for loud noise, because that's where a lot of our features and a lot of the studies are shown is just for loud noise. This is something for quiet noise. So you have a patient that's struggling in quiet environments, this type of product, this level of product might really help them. So you can go to the next slide. So the next feature I'm going to talk about is motion sensor hearing. So this is actually what enables our tap control. So some of you guys had some good and bad experiences with tap control, I know. But in general, the concept of what tap control is when the patient taps their ear, they can basically put themselves into either pausing their streaming or answering a telephone. It really helps with patients that struggle with dexterity and hitting the button on their hearing aid. So the motion sensor chip enables that, as well as when the patient is walking, instead of it being a beamformer directly in front, it opens up and it creates this ability to hear on the sides. A lot of times when you're walking down the street and you're walking with somebody, you're not as much listening in front, you're more going to listen to the left and right, just like you would want to hear a car coming or something like that. So this is basically the feature that's in our products. It's in the 50s, 70s, and 90s, and the rechargeable only products. So it is something that is available. The next feature, now if you can hit it, I think it's click next, click again. Very good. So the next features that I'm going to talk about is more about directional microphone technology. I think we're all quite aware of what microphone directionality can help patients with. 26% better speech understanding is some of the benefits that you get from the hearing aids being able to focus on the front and quiet things around them. You can go to the next slide. So this feature is called Ultra Zoom. It's probably something that you guys have heard about in the past. We've had it in a lot of our other products. I like to think of Ultra Zoom, and we're going to be talking about beamformers for the next few slides. I think that's my floodlight. So I basically can see about 25 or hear about 25% of what's going on in front of me. The rest of it gets quiet down. When we first launched this type of beamformer, it was launched in the higher end products. We've actually brought this down to all levels. So this is now available down all the way down to a 30 level product, and it improves the signal to noise ratio. We can go to the next slide. Next slide. So the next two features I'm going to talk about are our two upgraded features. We're good. You can go to the next one. It's the Stereo Zoom 2.0 and speech sensor. So Stereo Zoom 2.0, Stereo Zoom should not be that new to a lot of you who have fit our products before. What Stereo Zoom is I think of, so we just talked about the floodlight, now we're going to talk about the flashlight. So we're going to go from a wide beam to a narrow beam. And here's where all the yeses come in. So it's smoother, smarter, stronger. So if you can flip it to the next one. And yep, it's up there. Go back. Sorry, just go back one more. There we go. So it's a smoother transition. So I know a lot of times when people have used our Stereo Zoom before, they felt like they were in a tunnel because it would go from that Ultra Zoom down to that narrow beam, and it was kind of like a tunneling feeling. It wasn't a very smooth transition. So with this new algorithm, with analyzing the environment like it does, it's going to smoothly transfer and make it into this nice beamformer, but it's going to be an easier transition for patients. And it's just going to sound more natural. Then we also have it smarter because it's analyzing the environment 700 times. It's putting it into the correct activation level when it needs to go in there. So if we can hit the next one. It's stronger, so we've now updated our app to have the ability to create now even a tighter beamformer. So we can hit the next next. So we did noise reduction, which sounds like what it is, it reduces noise, right? So actually, sorry, speech focus. So it goes from wide to narrow. So you saw that wide beam go into a narrow beam. So think of a flashlight that is now going to a police light. So it's like really nice, like really, really tight. And the patient has the control and the ability to control that. And when we do this, we increase our ability for the signal to noise ratio. So if we can go to the next slide, and the next slide. There we go. So about 2.5 dB better signal to noise ratio. And the patient has the ability to control this sample. So it's really going to hone in and help the patient to hear exactly what's going on in front of them. See the next slide? So it's just showing you here what it's doing. Again, yep. And one more. Keep going. There we go. So this is just going through, and again, I told you that we made sure that we did some data and we analyzed the features before we launched them. So here you can see what the ability of the new stereo zoom has for challenging environments, as well as compared to just our regular set default for this type of environment. And when we flip to the next slide. So this feature is available in 90s and 70s of our product, and it is manual in the 70s, which just means you have to add it as a program, and then in 90s it's automatic. And it basically helps decrease listening effort as well. Switch to the next one. So now I'm in my tight police beamformer, and I'm hearing the person a little bit better, but if they're standing in front of a band, I'm still hearing noise. So I could have the tightest beamformer I want. If you're in a noisy environment with a lot of noise going on, the patient's still gonna struggle to hear. So what we did was we launched our dynamic noise canceller. So this takes out a lot of that low frequency noise. And the patient can do this in the app. If you can flip to the next screen. It shows you here, it is now available in our 70s and 90s. It's called noise reduction in the app, and they just kind of pull it over to the right. It goes from low to high, and it reduces the noise in the environment. You can flip one more. This talks about how it reduces listening effort. So you can see the dynamic noise canceller set at minimum. The next line is with the marble, so it's comparing our older lines to it. Then we have it as whatever the default is. And then you can see a huge jump in that green line on the bottom, which is dynamic noise canceller max. So when the patient went in and cranked that up on the right in their app, they were able to significantly feel the reduction in listening effort. You can start to the next one. And the next one. All right, so speech sensor. So this is brand new technology for us. This is a lot of S's as well, spatial speech detection algorithm. It accurately detects the direction of the primary signal. So what that means is if a patient is at a baseball game and they're looking forward, again, if you're in that tight beamformer, you might feel like you're in a tunnel because you're not hearing any other sound come in. So what this does is it's analyzing the environment, and if I'm watching the baseball game, I'm obviously going to be focused to the front where the announcer's going and most of the information. But then if someone to the side of me starts to say something, my hearing aids immediately recognizes it, and then it picks up that sound, and it actually, creates the beamformer going over to where the patients whoever they're sitting with is speaking. And it gives more of a real feel, because if I was sitting there normally, someone starts talking to me, I can hear them. And normally you don't have to completely turn your head. Your hearing aids will just automatically pick it up, so you catch the first set of whatever they're saying. You don't miss anything in the action. So if you can go to the next 4 clicks. There you go. So you can see here it's 360 degrees, so it's going to pick up behind you, to the sides of you, and then it picks up in the front. It accurately detects the speech signal in the environments to basically give the patient that information. If you click 3 more times. So when we did our analysis of this, we saw that it was a 3.4 dB better signal to noise ratio with fixed directional from speech from the side. So from the side, it was 3.4, and then from behind, it was 2.5. So again, the patient is getting more input, they're hearing better, they're able to feel like a more natural type of experience. And that's the kind of, I would say that would be the most kind of feedback that I'm getting from patients that are in older technology to the newer technology, and they're utilizing these different features. What's the next? How many of you guys have heard of Roger? All right. So Roger is, and I like to think of this as like Lumity is the base of the tree. You get a patient hearing better at the base, but you get a patient that comes back after 6 months and they're still struggling, or something happens and they can't afford new hearing aids, but they want to get better hearing. That's where Roger comes into play. If you have patients that have used it, you know they love it. It is definitely one of those products where it takes an experience to get to really use the product. I will let you know that all of our demos now have Roger receivers in them. So all you need is a Roger product to connect to them. So you can connect to any of our demos and you can let patients try them out. The biggest thing is the 61% improvement of speech. I definitely think the Roger on IN is my favorite out of all of them, mainly because you plug it in, it's a TV connector, as well as now it has all these four different microphones on the front, so it's directional, so it'll pick up in one mode, it can pick up in a group mode, and then I can also click it on my clipboard or I can point it, and it'll pick up in a pointers mode. So it has a variety of different uses, and you can download an app and you can put it on one side of the table and then completely control how it works. I think the biggest stat is that 90% of Roger users would recommend it to another patient. So if you are interested in these types of products, please reach out to me or Natalie or whoever your representative is. It is definitely something that you can utilize. It is able to be utilized with any manufacturer out there. They just have to use some type of boots or some type of receivers, but it is universal. And it can really help a patient that's struggling because it's almost like a third hearing aid because it has that directionality in it. So even if they're in a 30 or a 50 level product, they use something like this, they're going to get noise reduction in it, and they don't have to buy brand new hearing aids. And in certain cases that, due to financial restraints, that could be a huge thing for them. Go click to the next one. So the next one is ActiVent. This is something relatively new. To make it nice and simple, it basically what it does is it's a receiver that opens and closes depending on the environment. So I go to a soccer game and all of a sudden I get a phone call. I hear a slight popping noise, and then the receiver actually goes from an open vent to a closed vent, and I get about 10%. It says 10% in noise when compared to target, so there is an improvement of speech, but you can literally hear it quiet down when you're wearing the devices. Some patients are able to handle the popping noise. That is one of the caveats with the product. It also is a larger receiver, so it depends on the ear canal size. If they have a waxy ear canal, they're not necessarily candidates. But it is available. It's not for everyone, but it's a tool in your tool bag. Again, someone comes back in after 6 months and they're struggling in noise. You don't know what else to try with. It's not a device. They don't have to put it on a table or anything. It's just going to help with hearing that quality of in noise. You go to the next slide. And then the one. So Target 8.0, if you can click to the next slide. The nice thing about this is there really is no updates. Yay. So this product launch was primarily just the algorithm. So I just went through all the features. Those are the features that are in the new hearing aids. You as the dispenser or the audiologist, you're not doing much. Like it's all there. We did add, you can see the quick sync, which was requested. So that's the ability to split your volume. And then we also had increased our hands-free profile. So you go to the next slide. So the features that we just talked about, highlighting the dynamic noise canceller, that is now available in your 70s and 90s. Click to the next slide. We also now have wind block, which a lot of people really like, especially if the patient is outside doing a lot of things where wind noise is causing problems on their hearing aid microphones. So wind block is now all the way to a 30 level. And then Roger Direct Plus mic is all the way down to a 30 level. And what that is basically the Roger can hear at afar, but then the microphones can still be turned on. So if a patient says something or someone says something to the patient, they can then hear them as well as hear through the Roger mic. If you click to the next. You can see now the quick sync, it's just a checkbox in Target. That's one of the only things that we added. And then you click to the next one. So phone calls and streaming. So we opened up the bandwidth. So from Paradise it was 4.5. Now it's going to be 6.5 with Lumity. So we really opened up that bandwidth. And if you haven't seen this in Target, you do have the ability to write the Bluetooth name in. So that basically just helps with identifying your hearing aids when you're connecting Bluetooth, so your patient or you don't connect to the wrong hearing aids. You can click to the next. I'm just going to do a quick overview of the My Phone app. Click next. Keep going. 2 more. Is it stuck? Oh, it's okay. So the My Phone app, we've recently updated everything on the app, as you probably have seen. We now do battery monitoring, personalization. We have the new focus slider and the stereo zoom, and then the health features and the support, remote support app. So we have a variety of different things that we've updated in the app. I think the biggest thing is that just having the ability of that dynamic noise canceller, being able to cut the noise out, being able to change the beamformers. It counts steps now, so all the products in Lumity will count steps, and you have the ability to create goals and kind of create all those different things that you need in the app. It's pretty easy. You just click the little heart, and it goes to the heart monitor. That makes it easier. Can you go to the next one? You just keep going. So you can see these are just some different screenshots of what I just told you about. Keep going. Yep. Tapping through. So that's that wide to narrow, and then you can see for the speech focus, and that's the low to high for the dynamic noise, or the noise reduction. Keep going. So this is the health part of it. So this is where the steps. Sorry, keep going. Here's some screenshots of what it's going to look like. So it's live steps, tracks time, activity level. Keep going. We're almost through this. And then that's the little heart that I was telling you about. They have the tiles, which will tell you how much steps you're walking. We now have the activity level. So if you're sitting and doing nothing, it's going to say none. And then if you're walking around. The cool thing about the aids, though, is like if I'm not connected to my phone and I go for a run and I'm not connected, when I do connect back to my phone, it'll download all that information in. So it does have a storage feature. Keep going. So this is just a summary. The only thing the Lumity product does not have is it does not have, and I do have a set. I do have a set of the fits here. This is the one that actually records the heart rate. So it is a different receiver. You'll see it has a receiver in it. And it's a black receiver, and it shines light through it to measure the heart rate inside the ear. So if you have a patient that wants heart rate, we do have the fit available. So you would have to go back to the Paradise line to get that, but everything else the Lumity product has. So besides, and the only other thing that Lumity is a rechargeable only platform, so there is not any battery operated. You have to go back to the previous line for battery operated. Can you go to the next? So in summary, conversation shine with Lumity. So this is just an overview of the product and of the features that I just reviewed with you guys. Go to the next slide. Okay, so together we change lives. So if you guys have any questions, please let me know. I do think with the new Lumity line, from what I've experienced and what I've seen with patients, is a lot of it is being able to just hear a little bit better, having that ability to, it's just a different sounding product than what we've had in the past. Giving them a lot more input to be able to really have those types of, changes that they need. The usability, I do think the chargers are a lot more reliable. Both chargers have something that's going to basically monitor the voltage. So it's a voltage regulator. So that'll prevent patients from charging at home and then charging in their car or charging from their computer. Those are all potentially different voltages, which can cause issues with the hearing aids or with the charger themselves. So all of our new Liberty products, have that already built in, so you won't have those issues. You can literally plug it into anything, and you'll have a better, have less problems with those types of things. Does anybody have any questions about the new Liberty products? I think I finished. That was a little bit. Thank you, everybody.
Okay, next up, we're going to have Nicole from Oticon. Nicole has been an account manager for Oticon for 16, 17 years. We've known each other for a long time. She's going to talk to us about the new technologies with Oticon with the more product and clean product.
That's awesome. That's what I wanted to be. That's cool. Thanks. We found out why the one video worked. Solution or not, Ken?
That's what I thought I would bring mine too. So, excellent. How's everybody doing running the phone so yet? Of course I get to go. So we could, stand up and exercise. Anyway, I know most of you, which is crazy. I'm Nicole, born in Kalugi, so I'm in the New Jersey and PA area for Oticon. I'm the only one representing today. It's okay. I usually have a couple other colleagues. Carla is our new trainer. She's been with us for a little bit. Most of you probably remember Megan Mapes. So she's not with us anymore. Our trainer, Carla, is new to us, but she couldn't join me today. So I'm going to go over just a few things, pretty much the surface of our product portfolio. And if you have questions like in between, just please stop me. I'm getting my computer up here so I can have videos. I'm not gonna worry about it for a second. Sorry, I'm still gonna hit the video so they can see the one video. So go on, we'll just get started. So most of you know the Polaris platform, which is more products. So I'm gonna talk about the product portfolio today. You can go ahead and hit next. Yep. So just hit go ID 4 times, 4 or 5 times. There you go. So most of you know, and most of us have been in your office to go over the more products, but we recently have had some additions to the product portfolio, and we're going to talk about those too. So the Oticon More line comes in various levels of technology, more 1, 2, and 3. And then we have our Oticon Zircon, which replaced Ruby, which is our essential line. That's our essential product line. And then we have the Oticon Play PX, which finally came. We were waiting for something to come for pediatrics. And we have the Oticon Cross PX. And the reason we actually have it up there, it's not new, but it's new that we have rechargeable and battery operated cross. Okay, so it's compatible with all our product lines, which is huge. I really didn't think cross
was so, it's, you know, you never know who's gonna be sitting across from you in your practice, and it's been huge. And because of the platform in the Polaris chip, the speed not only matters, but cleaning up the signal before it gets transferred over is a big deal. And so in the More platform, that's why our cross has been actually a huge success. So that is our product line. The Oticon Zircon, that is all levels too. So we have a Zircon 1 and 2, just like we had Ruby 1 and 2. Our philosophy has always pretty much been the same in the past. We don't launch everything at the same time. So if any of these product lines do look new to you, it may be because we don't launch everything at the same time. During COVID, we have launched things sporadically. So we also still have our severe to profound, which I did not add on this slide, and that is the Exceed. So the Exceed is something we're well known for too. Oticon has always been pretty well known for severe to profound patients and the devices and the research that goes into learning about those patients. I feel they're special in a good way. So we have the Exceed 1, 2, and 3. Okay? If you are doing any Medicaid, make sure that you do have your updated list to be sure that you know what is on and available from our product portfolio line. Go ahead to the next one. So what we've added recently to our platform is custom. And I haven't thought I would have shared with that. It's been a very, very long time that we've been waiting for this. I think I'm probably gonna get in trouble while I'm on virtual. I shouldn't be saying this. Yeah, it's been since we had open. So we have now added custom line. Like in my territory, which is mainly New Jersey and a little bit of PA, I really do only have a handful that do quite a bit of custom, but we still have to have the opportunity and the solution for you to have that to choose and go by, because I know most are fitting RITEs at this point. But our customs now, we do not have rechargeability, and I'm not afraid to say it. So why we focused on our custom and the size is because I have heard often from customers out there that getting everything into one chip is not easy if you want rechargeability. So we went the route of size and also still being able to stream with our custom products, okay? So I don't know, I'm sure that has answered some of your questions on if we have rechargeability in custom. So it's half shell and full shell that you can do streaming with, okay? Anything smaller than that, I'm sure most of you remember when we had wireless in our really small instruments, and typically something had to be remade, revamped, if the custom had to be remade again, and it was very, very difficult to do. So we have had streaming only in half shell and full shell, and then in our IIC and CIC, it is what it is. Okay, it's small. IIC has no options. CIC, we do have a button. Okay, you can go ahead and move forward. Yeah, and most of you guys know these have been our strong points in the More, but we've always go back to the brain to support the brain in order to hear better. So that's been our brain hearing philosophy since we've launched. I don't know, you guys probably know better than I do. One product, I don't know, EPOC, even going back all the way to EPOC. And so, and then the deep neural networks, I'm not going to get too much into that, but that was our significant and unique benefit launching More in the Polaris platform, to have the deep neural networks into the chip. So just quickly brief about deep neural networks. It's already trained, and it has all those sound samples already trained inside the instrument now. So it doesn't continue to train, it's already trained for all those sound samples that are already in the device, in More 1, 2, and 3. Okay, next slide. Here's our little video, but you can still take a peek, because this is just running through the research and development in Copenhagen, so I still feel it's important to watch. Sorry for my virtual people. So as you guys all know, if you visited Copenhagen and Denmark, that's where most of our research and development has been done. We still do have the US location in Somerset, but it's nice to know how we do things. We just had recently had the Montclair students come in and go through production. So it's pretty neat to know how things are built and how we do things. That's all right if you're stuck. If it's stuck, go ahead and move forward. Oh, there it goes. If you did not know, that was just up there quickly. The 3D scanner is new to us. Okay, we have that now, which is great. It definitely saves time. Next slide, if you can. And here, this one is our visionary road philosophy. So it's just a vision of where we started and where we've been. I like this slide a lot. It just shows a great deal of information with the Oticon products. I know a lot of you know what we do is when we develop a product, we have something and we don't typically get rid of it. We keep building on the product. So what we had in something doesn't mean we're going to get rid of it when we launch something else. So all these features, Open Sound Navigator, Open Sound Optimizer, More Sound Intelligent, More Sound Amplifier, those are all in our More product portfolio products, and they differ in other ways, but the main features stay in those lines, okay? So wanting to know the difference between a More 1, 2, and 3, we can go through that together with your trainer or myself, but this is the journey that we've taken, and I think it's just a great slide to see. So from 2010 until 2020, I have up here. Next slide. I think you gotta click a couple times. There you go. So I don't know if any of these are recognizable to you, but these are features as well. We focus on listening effort, the brain, okay? Reducing listening effort and full soundscape. So speech understanding, 15% better speech understanding. You've seen these probably since Open S, and also the More line. So that has also been something that we continue to focus on, making sure that we have a percent. And of course, we do have white papers and research to back up this. So if you ever want to read and probably fall asleep with our white papers, you can do so by going onto our website, and all our white papers are there. Okay, so if you want to read those, feel free. Those are all there. Next slide. And hands-free communication, we've had that too. I am just reiterating that we do have it. Next slide. Yep, and here's a little bit, you guys can just take a peek, but our hands-free communication was out with our More products and our Zircon products. Now, for streaming with the custom, it'll be the same for full shell and half shell, okay? Android or iPhone, okay? And you do need to, we have a website that you can go on to, the My Oticon website, and you can also take a peek at what phones are compatible. It's really huge for us that you do that. It updates daily, because the phone does matter, okay? So it's an iPhone and 11 and above, and then in the Android, there's specific phones. So we are updating that constantly and coordinating with Android and iPhone. So make sure that you go on the website. I would never say, hey, it's gonna work, because you don't actually know. You can still add the Connect clip if need be, but a lot of people, if they want hands-free, you need to make sure you're checking the website for the particular phone they have. Next slide. And you have the iPhone compatibility and the iPad, same thing there. Go ahead and next slide. Requirements. Yeah, this is all on the website, so you know what compatibility that you have to have, okay? So, here we go. Oh, can you go back one to the video? Yeah. For the OHM, this is important, okay? So if you do have the OHM, you use a short press on either push button, okay? And to reject the call, there's a press and hold on either push button, okay? That's for the half shell and full shell. Again, it's up here, you're gonna have to look at it again because you're probably gonna forget when you're actually fitting the patient, believe me. So I'm just covering on the surface. When someone's across from you, you're gonna have to review everything. It's all new. Next slide. And I think this might be another video. So she tapped it wirelessly to send to the hearing aids. Can you capture any call? And then she pushes the button again and holds it down to end the call. So pretty simple though. And there's only, Next slide, there we go. So the Polaris platform, the call handling on all Polaris instruments available to firmware updates. So that's an important slide as well. Firmware updates are super important for Oticon. So when we do have them, we expect, that hopefully you do them. They're taking up to 2 to 3 minutes per hearing instrument. So once you detect the instrument, it will say in the top right corner of Genie if you have a firmware update. And we typically recommend doing it if there's been some type of concern. I know out there right now, there has been a lot happening with wireless streaming, not just us. So make sure you're doing the firmware updates and it will tell you what it's doing. After the firmware update is done, which is, it does one instrument, then it does the other one, and at the bottom of the screen, it will in detail tell you what firmware update it did and why it did it, okay? So then you can at least intelligently talk to the patient and tell them why you had to do it. All firmware updates are free, and the patient should be aware of that too, but you do want to do it. Streaming is a big one that you want to do firmware updates. We just had a firmware update on November 16th, if you were not aware. So make sure, you don't need to call people in unless someone is having some type of concern. Otherwise, next time they come in to do it. Next slide. It's a remote there. This was probably something huge during COVID, and we still like to talk about it and make sure everybody knows that remote care is a possibility with our products, and you can do that from anywhere. You can do everything. You can do a fine-tuned fitting and adjustments. You can't do tinnitus or real ear measurements when you're doing a remote care fitting, but at least you know that it's out there. And I still think right now people are still doing virtual appointments if they have to. We have our snowbirds, and we also have people that, they come in, or if the winter is coming, it's still a good option. It was new to us, so that's why we still talk about it, because we launched it, I don't know, right around probably 2 years ago for us. And we might have been the last ones to do remote care. So just if you did not know, we offer it. It's available. Next slide. And that's helping more patients enjoy life in a full sound. Next slide. And that is it. There's a question. Yes?
For the remote care, did you do the update in that as well?
No, we are wireless now, though. Because I know that was a big one too. That deserves another class. You had to like do the course with us under babies, screaming and hollering about that. So no, you can't now. It's a limitation with remote. And of course not a first fit. You're doing a follow-up or just fine-tuning adjustments. Anybody else? I know that was just a surface.
Yeah, when you
Topics.
connect to the iPhone, you do the same way that you do with the other product.
Absolutely, yes. Yep, there's nothing different. We do recommend though, connecting and doing everything through the app. Okay, it appears, okay, not everybody may know that. So to do through our Oticon On app, okay, when you go into the Apple Store, you just click Oticon and Oticon On will come up and you can download that. That's another thing not only with the firmware updates, if their phone is not updated, their phone needs to be updated to have compatibility, their firmware needs to be done, and then the Oticon On app has also been updated. So you may have to delete, forget device, repair, open the app again, delete the app, download it again. There's quite, again, all this doesn't always have to be done on the first fit. Get them hearing better, bring them back in, do the follow-up and make sure everything is done if you can start to do streaming and wireless stuff. It can be a lot. Anybody else? Okay, I gotta get sleeping. It's good. I accomplished what I needed to do. Thank you so much for your time. It was good to be live with you guys.
Okay, appreciate you guys hanging out and listening to everything our sponsors have to offer. We're gonna take a 15-minute break.
They're bringing the snacks out at 2:45.
They're out already.
Oh, they are?
They are.
All right. And, grab
All right,
some.
so-
Good morning.
Yeah, 15-minute break and everybody come on back after that. And we do have 2 more speakers, one a little bit of a surprise. After that, and then we'll wrap it up.
Yes.
Okay, yeah.
Is everybody tired? Ready to learn more? Jamie, you have 10 minutes now. Okay.
Okay, I'll be here.
All right.
Yeah.
So I know that most of you, but for those of you who I do not know, my name is Melanie Holman. I am the Signia rep for New Jersey and Delaware, so thanks for having me today. Jamie is the clinical education specialist, one of them for the Northeast, so she is coming to us virtually today. I'll be around, so if you have questions, Jamie, you can hear okay, right? But
yep.
If I might interrupt you if there's questions, I'll try to answer whatever I can. So we want it to be interactive. I know you're tired, but try if you can. And if you have any follow-up questions, you can reach out to Jamie or myself. Okay? All right, take it over.
Do you want me to share my screen or?
No.
I think they're going to share theirs, and then you just let them know when you want the slide changed.
All righty. Perfect. So thank you so much for the introduction. And my name's Jamie. I am coming to you from Massachusetts. I live out on Cape Cod. And so let's go ahead and get started. If you want to advance to the next slide. I just am required to give you guys this disclosure. I do have a financial relationship with Signia. Thankfully, they do pay me to do my job. But aside from that, I don't have any other relationships to disclose. Go ahead and forward, please. So after today's presentations, you'll be able to describe the key benefits of Signia's augmented experience platform. You'll also learn about ear-to-ear wireless 4.0 and talk about the benefits of binaural processing. And then you'll also become familiar with just the AX product line and device features. Go ahead. Oh, and there's an animation here if you just want to click one more time. Pesky animations. Oh! So before I get started on the augmented experience platform, I just want to point out a couple things about Signia as an organization. We do have a comprehensive rechargeable portfolio. So whether a patient needs a custom in the ear rechargeable hearing aid or maybe a super power BTE, we have a rechargeable solution for them. Additionally, 1 in 3 hearing aids across the world is actually from our organization. And if you take a look at that bar graph, it just is showing you the amount of patent applications within the hearing health industry. And WS Audiology, which is us at Signia, we're at the very top. So we are constantly working on research and development and innovating for the next best solution. And you can see that clearly here by the amount of patents we have applied for. Go ahead. So I'm going to dive into the AX platform now, but in order to talk about AX, we do have to go back a little bit and just talk about traditional hearing aid technology. So when I say traditional hearing aid technology, I'm talking about devices that are 2, 3 years old. So we're not talking about grandpa's hearing aids from 30 years ago. These are relatively recent devices. And we see a limitation with traditional amplification because they rely on single stream processing. So that means sound goes into the microphones of the hearing aid. It gets sent through one lone processor that's responsible for sorting through all of that information and determining what speech information is and what noise information is. And the limitation there is that we have really one set of rules or parameters to apply to that processor. So even though we have quite a few features and things we can address, oftentimes those come with a price or a compromise. So, if we want to bump up sound clarity, you can of course turn up high frequency amplification, but oftentimes that means kind of turning up everything or creating some other sort of sound quality issues for the patient. So again, with a single stream processor, we're really limited by one single set of rules. Go ahead.
So that's where augmented experience comes into play. Augmented experience uses a technology called augmented focus. And what that means is we use split stream processing, meaning we included a completely additional and separate processor to the hearing aids. Go ahead. So the kind of essence of augmented focus and split processing is that we have one processor for each microphone, which lets the hearing aid more efficiently and accurately sort through all of that input. So the front microphone is able to take in all of that information and sort through it to find speech information and find surrounding sound information. And the rear microphone is able to do the same thing. So we really are able to offer kind of the best of both worlds in terms of sound quality because we can optimize speech information, but we can also optimize the surrounding noise. So what it means is that you could actually, be in a cafe, understand speech, but still feel like you're in that cafe setting. So it's a really natural sound quality. Go ahead. So, this is an eye check for everyone here because my eyes are barely seeing this and you guys have quite some distance. But this is showing you exactly how augmented focus works, and I'll describe what you're seeing on the page here. So in the bottom left, you're seeing two processors, one for each microphone, and they're both sorting through all of that input, again, to determine what speech information is and what noise information is. If we're talking about a premium hearing aid, each of those processors has 48 channels of processing power. So for one hearing aid, that means we have 96 channels of processing ability. And if you're talking about a binaural fit, that means almost 200 channels of processing power for a binaural fit of premium AX hearing aids. While that is going on, we still are able to use our soundscape analysis. So that means that we're using classifiers to determine the acoustic scene. We're also taking a look at signal to noise ratio to make sure that we're optimizing that. It's always interesting to me to find out that that's not always what's going on in hearing aids, despite how much we talk about signal to noise ratio. Oftentimes hearing aids are simply looking for noise levels and kind of leaving out that aspect of having a poor listening environment in the absence of noise, because we know speech is not always optimized. So constantly monitoring signal to noise ratio to make sure that the patient's not missing anything. Own voice processing is a unique to Signia feature that improves the comfort of the wearer's own voice without having to sacrifice gain or audibility. We use our acoustic motion sensor, so the hearing aids have a better idea of what the patient's actually doing rather than assuming, we're sitting looking straight ahead like a mannequin. We know life's a little bit more dynamic than that. And so the acoustic motion sensors give us, again, a better picture about what the intention of the wearer is rather than making assumptions. And then also we will always monitor for just ambient noise. If there's a fan going or some low-level ambient noise in the environment, we certainly want to know about that. So all of that kind of mixed in with our two processors that, again, are allowing us to optimize speech information by actually using more of a linear strategy for speech processing, and noise information, which we're actually able to apply some more compression settings to. And again, the result there is not only clear speech, but still a clear idea of what's going on in the environment. Go ahead. So in addition to all of that, we have some other exciting and really effective features within our AX platform. So we already talked about our 2x 96 channel output. We use a feature called ear-to-ear wireless 4.0. So I'm going to quiz you guys a little bit now. Our original ear-to-ear wireless was released in 2004. Does anyone know what that big deal of that feature was back in the day? Has to do with the buttons.
Volume control and it worked the other side.
Yes, and that was in 2004. That was a big deal. You didn't no longer have to press two buttons. We only have to press one for volume control or program change. In today's version of ear-to-ear wireless 4.0, it's much more than that. It is now a true binaural data transmission system. We have the lowest binaural data transmission rate in the industry, which is at 8 milliseconds. And what that allows the hearing aids to do is preserve timing cues. Since we're able to keep information from the right and the left on the same clock face, we're able to preserve more of those timing cues that are really important, not only for just sound clarity, it's important for making things sound familiar. It's also important for understanding speech and noise and sound localization. So again, if we can keep that information on the same clock face, we can make it a more familiar and friendly sound while not sacrificing audibility and sound clarity, speech understanding and noise, and all of those things that are really important to patients. We use a feature called True Ear 360 because when you put BTEs or RICs behind your ears, you lose the benefits of the pinna effect. So again, goes to timing cues and preserving those cues in order for a more natural sound quality. We improved our feedback cancellation, and we also extended our dynamic range input up to 117 decibels, which is closer and closer to the capability of the human ear, but that just means that a patient can effortlessly go from a quiet environment to maybe a live music venue and know that the hearing aids are going to be able to handle those sound levels and process it for, again, a more natural sound quality. We've been streaming to iPhone for quite some time now, but now with the AX platform, we can stream to Android devices so long as they are ASHA compatible. And we have our Signia Assistant, which is our kind of live neural network that lets patients make adjustments to their hearing aids in real time. So if they're at Bob's Diner, they can be at Bob's Diner, use the Signia Assistant, and really make some adjustments that, again, are really tailored to the environment that they're struggling in. We'll go ahead and forward. So we, again, with the amount of research and development that we put into our products and our features, we have some studies that we've done on AX that just show not only improved hearing in noisy situations, but preferred hearing from AX devices. So people are really preferring the sound quality of AX devices over their current hearing aids. And so again, we're not talking about 10, 12-year-old hearing aids. We're talking about 2 to 3-year-old hearing aids that are still being widely used in the industry. So go ahead. So these are just some highlights that I like to showcase from our white papers on augmented experience. The big one that I'm really excited about is just 25% better speech understanding and noise compared to their own hearing aids, which I think is an interesting kind of metric. You know, we're not comparing these to, again, 20-year-old hearing aids. We're asking people to compare them to what they're already using successfully. So I like to use this as kind of motivation and confidence in terms of making those recommendations for upgrades. Patients ask us all the time, you know, I'm thinking of new hearing aids. Do you think it's going to be worth it for me? And I think information like this can show you that, yes, you know, you can certainly benefit from new amplification. We're seeing significantly greater hearing understanding in noisy situations, which again is oftentimes what patients are looking for. Additionally, 94% of wearers do report excellent speech intelligibility while wearing Signia AX hearing aids. So I just like to think about 94% of my patients being totally happy and satisfied with their hearing aids. What a kind of big deal that would be for us as hearing care providers. So I have a video I want you guys to watch that just shows you exactly what AX sounds like and kind of the essence of not only being able to understand speech, but also getting a really clear idea of what that room feels like by an accurate kind of acoustical scene. So let's go ahead and forward. It should be a video. There it is. And I think you click one more time and it'll play.
We can't hear it, Jamie, but we can't skip through it.
Oh,
think it's good.
Yeah, skip through it then. I'm so sorry. I don't know why.
I don't think it's your, no, it's the.
Yeah, it's nothing. I was like, if I could fix it, I would. Well, you guys did get to see my Signia crush, Sebastian, so at least you got that part. So if you guys had been able to hear the audio, you would have heard exactly what I've been describing, where you can hear very clearly Sebastian's voice, but you can also hear everything that's going on in the environment, which is exactly what we're looking for when we're looking for a hearing aid, or exactly what your patients are looking for. So with the augmented experience platform, we have just plenty of options in terms of form factors. We have our traditional, pure charge and go, which is our RIC style of hearing aid. We also have a cross that is compatible with our pure charge and go. So your patients with single-sided deafness can still benefit from AX technology. We also have a pure 312 for those who prefer disposable batteries. Try as you might, there are just some patients that feel more comfortable knowing they can keep, a pack of batteries in the car and their hearing aids are never going to die on them. We go ahead and click. The latest and newest addition to the AX family, though, is our Stiletto AX. So this is actually our 4th generation of Slim RIC, and it's a consumer preferred design, meaning, if you give patients the option of a traditional RIC or a Stiletto, it can improve their perception of hearing aids, and in some cases actually kind of push them towards making a decision on pursuing amplification simply by having other style options. Go ahead and click one more time. And there's a cross. So Stiletto AX now has a compatible cross. So again, your patients with single-sided deafness can still take advantage of a consumer preferred design if they so choose. So go ahead. So we're going to talk a little bit about Signia Stiletto AX. So with Stiletto AX, we're actually offering 2 options for chargers. You can use the standard Stiletto portable charger, or you can use the dry and clean charger, which for me, being out on Cape Cod, it gets really humid here. I would have been fitting all of my patients with the dry and clean charger just to avoid moisture issues. So it is a really nice option. Go ahead and I guess every time I do this, I'll just say that'll be my cue. So the Stiletto AX, since it's on the AX platform, it still gets to take advantage of ear-to-ear wireless 4.0, own voice processing, and auto echo shield, which I'll talk about in some detail in a bit here. But you can directly stream from Android devices or Apple devices and still take advantage of Signia app and Signia Assistant. And like I mentioned before, it is compatible with Cross. So you can have more options for your patients with single-sided deafness. Stiletto AX is currently available in a level 3, 5, or 7. So again, plenty of options for all patients that come into your office. Go ahead. Battery life for Stiletto, you get 20 hours of runtime on one single charge. You have a heavy streamer, which we count as about 5 hours of streaming. That runtime will go down to about 17 hours. When you're using the fast charge feature, if the hearing aid battery gets below 20%, you can put it in the charger for a fast charge, which means 30 minutes on the charger will offer an additional 5.5 hours of wear time. Can I go ahead? And then kind of back in terms of the dry and clean charger, obviously it's going to charge the hearing aids, but it has a fan that will dehumidify them and then also a UV light to help sanitize the earpieces, because we know that patients aren't always great at cleaning their hearing aids and wiping them down on a regular basis. So the dry and clean charger is a nice option for them. The other thing I like to kind of consider with the dry and clean, with our previous versions of Stiletto, if you had a patient that needed like full shell ear molds, or if they had an ear mold that just was too large to fit in that charger, you were either, having to keep the lid open or, kind of, I guess, modify the charger in a way that would allow those ear molds to come in. With the dry and clean stiletto charger, there's more space for those patients who do need ear molds. So you don't necessarily have to kind of struggle with the devices anymore. Those molds will fit nicely into that charger. So now you can use stiletto for even more patients. Go ahead. We also included some more color options. So in addition to the color options that you can see, we have an all black, all beige, and an all deep brown color option for stiletto. So again, since it's a consumer preferred design, we do like to give you as many options as possible so patients can really match their style to the hearing aid that they're selecting. And that can be, as basic as a beige stiletto, which kind of boring, or as fancy as the rose gold and cosmic blue color options. So again, patients can kind of express their style a little bit more via their hearing aids. Go ahead. So a little bit about cross stiletto, and you can go ahead and forward through this. Has, again, since it's on our AX platform, we still get to take advantage of AX features. We have increased reliability just due to a hydrophobic and oleophobic design, meaning they're resistant to moisture and oils. I had mentioned before with our ear-to-ear wireless 4.0, a reduced latency time, and that applies to our cross system as well. So the hearing aids are better able to communicate with each other in real time in order to preserve timing cues. And the Stiletto AX gets 23 hours of battery life. So patients can really be confident that they can make it through a whole day with Stiletto and their Stiletto Cross without needing to put it on the charger. Go ahead. So our AX Cross, so that means our Pure Charge and Go AX as well as our Stiletto AX. We use skewed directionality. So what that means is if the patient's in quiet, those microphone modes are going to be set to more of an omnidirectional setting to give the patient awareness of everything going on around them. As noise increases, that microphone directionality is actually going to skew towards the poorer ear to give the patient, again, better access to sound from their poorer side, better access to speech information. However, as noise increases, if it gets to a level that is just not going to be a helpful situation to have that cross active, the hearing aids will actually go into more of a narrow directionality mode to address the high levels of noise and improve speech understanding in those situations. Go ahead. So another product that was relatively new, we've had it around for a year or so by now, is our NCO Charge and Go AX. You can leave it there. Yep. And NCO Charge and Go AX is our custom rechargeable hearing aid. They're contactless, meaning that the only thing on the faceplate that you'll see is that button. And the charger is very, very user-friendly with color-coded ports. So go ahead. So as I mentioned, that single button on the faceplate gives it a really nice design. And I always think when you order it in the black color, it just looks like an earbud. And the fact that there's no charging contacts on there kind of, again, gives it that sleek design. The button can be programmed to use volume control, program change, or both. And like all of our devices, if you hold the buttons down for 6 seconds, it'll power the hearing aids off. You can add a removal string if you would like to, offer a removal string for patients as well. Go ahead. So again, since this is on our AX platform, you get the full AX feature set. So we're using augmented focus and split processing, ear-to-ear wireless, and they do have an IP68 rating, which means that they are rated to be underwater at 6 feet for 30 minutes. We've done all the testing though, so you guys don't test it. We've already done that, but it is rated for IP68 ratings. And also they are dust resistant. And they're currently available in a 3, 5, and 7 AX. So go ahead. And that is the NCO charger. So again, as I mentioned, it's really user-friendly. I always like to think of your patients that might have dexterity trouble or visual impairment and just how easy NCO AX can be for them to use. Especially, for the visually impaired, you can have the shells made red and blue so that they can color coordinate and make sure that they are keeping them in the correct side of the charger. So again, really user-friendly, no more batteries to have to replace. It's really challenging for people with neuropathy and dexterity issues. So it's been a really nice solution. You can go ahead. And as I mentioned, we introduced black as a color option. We do still have all of our other skin tone options. So if you want a more traditional beige NCO, you can absolutely order that for your patients. Go ahead. So battery life on NCO AX, it does take about 4 hours to charge them fully. You get about 28 hours of runtime. Now, again, if you have a heavy streamer, about 5 hours of streaming, that's going to go down to about 24 hours of runtime, which for most people is plenty to get them through the day. Go ahead. And again, the contactless charging allows for a really intuitive placement in the charging port. I remember when I first got mine, I was trying to, really cram them down into those ports, which is not necessary. We just ask that they are gently placed with the face plates parallel to the charger itself. And that's all that's required to put them on the charger. So again, you don't need to kind of force them down there. They are universal cavity size, so it's a standard charger, no need for custom insertion or custom ports there. And they use a USB-C power cable. Go ahead. So on to some features that we introduced this past year for our AX hearing aids. We have one feature called Auto Echo Shield, which I'll get into momentarily. We improved our own voice processing, and then we also introduced hands-free calling for iOS devices. So Auto Echo Shield, I'm going to quiz you guys again. So go ahead and forward the slide, and I want you all to think about these two environments. And so everyone raise your hand if you think that option A is going to be the problem option for reverberation. I imagine there's a lot of hands raised, but I can't quite see because I'm facing the other direction. Now raise your hand if you think option B is going to cause issues due to reverberation. So I tricked you. It's actually both. With just how open concept apartments are or homes can be nowadays, we can't always assume that our patients' home environments aren't causing them trouble due to reverberation. Of course, we know, option A, you can see things bouncing around in that space. So of course, we'd be concerned about reverberation. But my point is that reverberation can be really anywhere, and it can create some significant difficulties for our patients. Go ahead. So the reason why hearing aid wearers have such a hard time with reverberation is because as sound bounces around the room, it's actually hitting the hearing aid microphones at a softer level. So what do hearing aids typically do with softer input? We turn it up. So we apply a lot more gain to those soft sounds because we want people to hear those really soft consonant sounds, and we want speech to sound nice and clear. The problem is in reverberation, it gets amplified even more and can start to really interfere with speech understanding. So go ahead. So if we're looking at the components of reverberation, we have a few things going on. So you can hear directly, if you're looking at that red arrow, that's direct sound. You can hear early reverberation. So that blue arrow that just shows sound bouncing on the floor and then coming right back up into the recipient's ears. Those are early reverberations, and they're actually important for not only speech understanding, but room familiarity. So we rely on those early reverberations to make a room feel like a room. If any of you have ever been in an anacoustic chamber before, you might be able to just close your eyes and kind of think about what that room felt like due to the kind of sound quality or no reverberation. But if you were to kind of close your eyes and think about what it's like to be in a concert hall, you can probably also picture that. And that room feel is largely due to those earlier reverberations. So go ahead. So what Auto Echo Shield does, in our premium level hearing aids, this is going on automatically, meaning the hearing aids are constantly scanning the environment and identifying later reverberations, which are the kind of the problem reverberations. So what they do is they'll actually always preserve direct sound and early reverberations because we don't want to interfere obviously with direct sound, but we also don't want to take away from the room feel and speech understanding that you get from early reverberations. So what we're able to do is actually preserve those, kind of eliminate those later reverberations. So the hearing aids know those later sounds and they don't even amplify them. So it gives a really accurate kind of scene and accurately analyzes for reverberation and then cancels out the pesky late reverberations. So go ahead. And you can see Auto Echo Shield in action here. The image on the left is a transient sound in a reverberant area. And Auto Echo Shield is not active in the left graph. On the right, you can see that same sound with Auto Echo Shield active. And you can see that all of that reverberation is being eliminated through the use of Auto Echo Shield. Go ahead. So on to Own Voice Processing 2.0. We released our original Own Voice Processing back in 2017. Mel, you can correct me if I'm wrong there, but I think it's been around for almost 5 years. And Own Voice Processing lets the hearing aids know when the wearer's talking, and it's able to accurately identify the wearer's own voice and apply separate gain and compression settings to make their own voice more comfortable and help kind of reduce the occlusion effect. So go ahead. So before Own Voice Processing was available, we were still having to make more and more compromises. So, maybe we were increasing vent size or going to more open fit when we didn't really want to do that, but the patient's having a hard time adjusting. Or maybe we were just reducing gain and making things just overall more comfortable for them. But again, that can come at the sacrifice of audibility and speech clarity. So we don't always want to do that, and we really want to avoid doing that if possible. And then my favorite one that I'm guilty of too, I used to tell patients all the time, you'll get used to it. Give it a couple hours, couple days, couple weeks, and you won't even notice the sound of your own voice anymore. And sometimes that was true, but oftentimes it was not true. And we had to, again, make some more compromises along the way. Go ahead. So with Own Voice Processing 2.0, we've been able to improve how the hearing aids are separating the wearer's own voice from the surrounding sounds. So we took a really, really good thing and we made it even better in terms of just offering a more consistent and stable sound quality, even if there's, ambient noise or other things going on in the wearer's environment. Go ahead. So this is a clinical study we did on Own Voice Processing. And you can see we have Signia at the left and then two of our competitors on the right. I don't know who those are, so don't ask me. And the triangles show you a closed fitting and the circles show you an open fitting. And then we have satisfaction ratings here. You guys probably can't see my mouse. So what you're looking at is pretty close. I mean, almost no difference in satisfaction ratings between a closed fitting and an open fitting by using Own Voice Processing. So that's going to allow you to not only achieve a closed fitting where you might not have been able to before due to just patient concerns and comfort, but it'll allow you to have greater control over audibility and maybe get your patient the gain that they really need for their hearing loss, again, without having to make compromises or, tell your patient to just get used to it. Go ahead. So we released My Wellbeing this fall, and it is just a way for the hearing aids to track general activity. So if you want to forward. So they are able to track steps, which we found is actually more of an accurate picture of how many steps a patient takes with ear-worn devices. So we actually learned that having wrist-worn devices gives you kind of a little bit more credit since you have just natural motion throughout the day, that the wrist-worn devices are actually more likely to kind of miscount how many steps you're taking. And we're finding that the ear level devices are, again, offering a more accurate picture of step count. They also look at just general activity. So in addition to steps, how active was the patient during the day? So that can be, just moving around. It gives you a better picture of, how much time they're spending on the couch. My wear time tracks how many hours a day patients are wearing their hearing aids, and they can view that right from the app, and they can view that on a day-to-day basis. So it gives them, and maybe their loved ones, a better idea of actually, how the hearing aids are being used. And my conversations is a way to track kind of social interaction. So the hearing aids use own voice processing to determine when the wearer is speaking, and they're able to calculate how engaged that patient is, or how much time they're spending talking. The idea being, over time with hearing aid use, we should see my conversations, increase as patients get more comfortable with their hearing aids and more confident with their communication. So go ahead. Call control is another feature we introduced in the fall, which lets wearers with iOS devices answer and end phone calls from the button on their hearing aid. And go ahead and click. Oh, and then there's animation, so just want to click again. I think there's maybe 2 more. There you go. Go back. Sorry. I thought I got rid of those. So how call control works is, if the hearing aid has a button on it, then you just do a short press to answer and a longer press to end the phone call. You'll get a notification beep in the hearing aids once the call is answered and then ended. Our Stiletto AX doesn't have any buttons, so patients can still use call control by simply double tapping. So it's a double tap to answer and a double tap to end. So it's just offering more features and flexibility for AX users, and they can truly be, completely hands-free. Go ahead. So that is kind of the sum of my presentation. I do want to kind of notify you or let you know that we have this learning portal called Signia Learn. So you all can go into mysigniausa.com, log in, and you have access to not only recorded webinars for CEUs, you can sign up and register for live webinars, and all of your CEU information will be stored right within the Signia Learn portal. So it makes it really user-friendly for you in terms of reporting those CEUs, and it's free. So go ahead, and I really encourage you to use Signia Learn. It's a really nice resource, and we're constantly adding to that and kind of growing our database there. So definitely use that as a resource. Go ahead. So that's all I have from you. I'm shameless with my dog, so I put him in every presentation I do. So there he is. My name's Jamie Lucian. If you ever have any questions about AX, Signia, our software, anything at all, feel free to reach out to me. I cover the Northeast, so you guys are all in New Jersey. I am your clinical education specialist, so feel free to reach out to me if you ever have any questions, needs, tricky fittings. I am here as a resource for you and to help you kind of, familiarize yourself with Signia and be successful with Signia fittings.
Thank you, Jamie. Anybody have any questions for me?
Yes.
No? Okay, thank you. That was great, Jamie.
Oh, you're welcome. Thanks for having me.
Thank you all.
Happy Friday.
Yeah, happy Friday.
It's late in the afternoon, and we really appreciate all the awesome information from all of our manufacturers. They're always changing, and it's really hard to keep up with. So I hope everybody takes something away from at least 1 or 2 of the manufacturers. So we had a little bit of a change in our schedule. We had somebody that was going to speak from CogniView, and unfortunately they had to bow out at the last minute. So we are very thankful and happy to welcome something a little bit different. I'm sure those of us who have been in the field for a long time, people feel the way I do, we want the people coming up after us and the people coming into the field now to be well-trained and give great patient care And it's up to us to, in New Jersey at least, to train these people that aren't in audiology that are coming up as a hearing instrument specialist. And that gets kind of difficult. And we really need the need for an education program for these new hearing instrument specialists is a great need. And there's something new out there called My Hearing You. And it is an intensive online course to prepare a hearing instrument specialist. It's national for their state exams and make them able to go out into the field with really good skills so that we can trust them and feel confident that the people that are replacing us as we grow older and retire are going to do a phenomenal job. So we'd like to welcome Dr. Kelly Stahl, who is the Director of Student Experience for My Hearing You. Kelly has worked with manufacturing, she's worked in clinic, and now she is taking on this great new venture. You're on, Kelly.
All right. Hi, everybody. I am so excited to be here. And yes, my name is Kelly Stahl, and I am the Director of Student Experience for My Hearing You. And I am just thrilled to be able to share all about My Hearing You with you so that you can understand and know what we're about. But before we go on, I want to take a moment to just talk about the people within My Hearing You. So if you could switch to the next slide. So first I want to thank Sharon Storr and Laura Stever for inviting me to speak today. This is a wonderful opportunity, and I'm so excited for you guys all to hear about My Hearing You. Laura, and most of you probably know Laura Stever, she is a hearing instrument specialist, but back in the day, she started out as a paralegal. But then after about 5 years, she saw the light. She realized, you know what, I need to do something different with my life. And so now she's a hearing instrument specialist. And even better, she is working with me, and she's our enrollment counselor for My Hearing You. And I couldn't be more thrilled to have her and her experience, because I feel like she's going to give such a wonderful and unique perspective to our prospective students. So I'm very, very excited to have her with us. Next slide, please. And as was already said, I am an audiologist. I worked clinically for 19 years before I made the switch over and worked for Oticon for 12 and a half years. I also am an adjunct instructor at 3 different universities. So I've been teaching online for many, many years. And it's funny, you know, I used to ask people all the time, you know, is this your first course online? And back before COVID, pretty much that was a standard answer to get, yeah, I've never had a course online before. Now it's part of our life, and it truly has changed exactly how we learn. And that's really very exciting, because that's a big part of what we're doing at My Hearing You. All right. So before we get started about the specifics about My Hearing You, I think it's really important to understand how we got to this point in the first place. At Hearing Life, we realized that we're having a shortage of hearing care professionals within the clinics, not only across the country in our clinics, but in general for hearing care professionals. There's a definite shortage, and it's just going to seem to be getting worse through the next years. According to the World Health Organization, about 2.5 billion people are going to experience some sort of hearing loss by 2050. That's a lot of people that really need some help. Not to mention that 1 out of 3 of the baby boomers are going to experience some sort of hearing loss as well. So we want to make sure that we're providing lots of good opportunities. We also realize that seniors are living much longer lives, and because of that, there's a greater focus on improved quality of life. So they're more social. They want to communicate without difficulty. I don't know if you are aware of the book called The Blue Zones, and it talks about living longer. I can't remember the title now, I'm just doing totally blank, but it's Lessons for Living Longer from Those Who Have Lived the Longest. And it talks about different areas around the world where people live the longest. And one of the most important things about that is that one of the thing that helps them to live the longest is this connection to people, that communication, that socialization. And unfortunately, when we have a hearing loss, sometimes that makes us retreat from those social situations. And so we want to make sure that we obviously are providing good quality care so that we can have those good connections long throughout our lives. The other thing is the Lancet study that was published several years ago and talks about the effects of hearing loss on dementia. And we know that how that cognitive decline can be either abated a little bit or slowed down a little bit by fitting somebody with hearing aids. Does it fix it? Of course, no. We know that it's not going to fix it and stop it completely, but at least it might slow it down and keep the effects being quite so tremendous. So again, all of these things, along with those folks who have gone through strokes and trauma victims, they're all needing that hearing assessment and intervention. And we really need to have good quality providers available for them. And with the shortage, we're really running out of time to get them educated and ready to go. So of course, time and cost are extremely important in becoming hearing care professional. As an audiologist, it nowadays takes 7 to 8 years to become an audiologist with a really rather hefty price tag. And it can be rather daunting to look at that. Whereas for a hearing instrument specialist through My Hearing You, it takes 6 months and it costs a little less than $5,000. So huge difference in the price and the time that's involved. In the amount of time that it takes an audiologist to become an audiologist, a hearing instrument specialist can already be out in the world working and making a living and going on with their life. Whereas a student in audiology is going to be there for quite a while and then have that hefty loan payment when they're finished. And I have traveled around the universities in my previous job to many, many different universities and talked to students that are in AUD programs. And I constantly would hear them worrying about how they're going to pay back the money for all those student loans that they had to take out. So it's a real concern. And it was something that we took into consideration when we were developing My Hearing You. So as you know, there is a difference in the scope of practice between an audiologist and hearing instrument specialist. There's no denying that. But you don't need to, and I'm not going to necessarily go through, if you'll click the next thing. And there we go. I'm not going to go through each and every one of these differences between the two professions. I am certain that you are quite aware of what those differences are. The point I'm trying to make is that if a person is most interested in hearing evaluation and amplification, there is really no need to spend 7 to 8 years in college and $120,000 plus to earn a doctorate. The best path for a person who wants to do the evaluation and amplification is really the hearing instrument specialist route. And understand, I am an audiologist. I love being an audiologist, but I also believe in the right education for the right person and the right profession. And there's a reason that we're not all a nurse or a doctor or a baker or CEO or whatever. There's reasons that we all do different things. So it's important that we choose the appropriate education to meet our professional needs and goals. And the interesting thing is that the hearing care profession in general is one of the greatest professions that nobody knows about. So in general, if somebody asks what I do and I say I'm an audiologist, I usually get said, people think I say cardiologist or archaeologist. So it never quite comes out the right way. But it is a profession that is kind of hiding behind the scenes. But the really good thing is that right now, with all the hullabaloo about OTC and ear-level devices and things like that, it's actually bringing the hearing care profession into the limelight and getting that much-needed press that it's needed for a long, long time. I truly believe, however, that it's important and essential to have the hearing care professional as part of that fitting process for amplification and assistive technology. It's absolutely essential. So with that in mind, it's really important that we have professionals who are ready and willing to do this. Okay. So how do we do this, you might ask? Next slide, please. Well, with My Hearing You, of course. And you can click through all that. That's fine. I don't mind. And you probably, first question is, what is My Hearing You? Well, it's an online career school that prepares individuals to pass their hearing instrument specialist licensing exam. And you may or may not know, but 44 of the 50 states require the ILE for licensure in their states. The My Hearing You curriculum is based on the International Hearing Society's training materials. However, what I've done is I've expanded the curriculum to 24 weeks. And so it's a combination of synchronous and asynchronous work, and it includes lectures and videos and webinars, articles, web pages, projects, and discussion boards, and some other things that they'll end up doing. So there's lots of things and lots of ways for them to engage and interact within this program. The typical week for a student in this program is that they'll read their textbook. They're going to review the lecture, which will be a recorded lecture. They're going to complete the lessons and the exercises within their workbook. There'll be, like I said, there'll videos and webinars and web pages, articles that they may need to read, any assignments that are assigned, and also a discussion board where they're going to interact with their classmates and with me to have a discussion about various different topics for that particular week. And then, of course, they're going to have to take a quiz because we want to make sure that they're learning the material and can process through the rest of the other modules. There will also be live sessions from time to time that will review the previous week's information, and there will be periodic exams to do the same as well. In addition, there are going to be those other learning opportunities. They'll have hands-on projects that they're going to have to turn in and that are not included in those IHS materials. So you're probably saying, oh, no, we're still on this back one. You're probably asking what type of clinical training are they going to get? How are they going to be sponsored? Will they be sponsored? While My Hearing You, we are not going to find their sponsor for them. We believe that that's part of being a professional, is that they must figure that out and get that set up. We will certainly help them and try and get them in connection with people that are willing to be sponsors, of course. And as you know, state requirements, they vary from state to state. There really is not a hard and fast set of rules that are required to become a hearing instrument specialist. We wish there were. It would make life much easier for a lot of people. But unfortunately, it's a very varied group of requirements. But during their first, I'm still back there, sorry. But during their first week, they're also going to be required to do some research to find out what their state requirements are so they can make sure that they are working to the proper goal that they need to be working towards. And then, of course, the market, the types of students that we are looking at are, first of all, communication and science disorder students at the undergraduate level. Those folks who've realized that, oh, I like the hearing amplification side of things, but I'm really not thrilled about the dizzy patients or cochlear implants or anything like that. They're not looking to do that. They want to stick with just with amplification. And those are the students that we'll try and draw into our program. We'll also look for those who are trying to change careers mid-career. You know, people after working for a few years may decide, you know, whatever they happen to be doing. Laura is a prime example. She changed her mind of what she wanted to do. And so here she is as a hearing instrument specialist now. And then, of course, high school graduates. We know that there are vocational schools all around the country, and we will try and capture some students from those schools, as well as your traditional high school, because, again, a profession that nobody seems to know about. So we're on a mission to educate lots of people all about the profession of hearing instrument specialists. Okay, now next slide, please. So to summarize, basically, it's a 6-month program. The tuition, all inclusive with books, supplies, simulation software, etc., is $49.25. It satisfies the hearing instrument specialist distance learning requirements. There's async and synchronous work that is all 100% online, and it prepares the student to be an excellent apprentice in the clinic, which, by the way, leads me to my final point. Next slide. So what can you do as professionals, hearing instrument specialist professionals? You could offer to be a sponsor to an apprentice. And if you think about that, there's a couple of ways that can help you. Number one, are you thinking about retiring? If you are, apprentices can do those less skilled tasks as they learn to become a hearing instrument specialist. They can also give you, as a business owner, a chance to take a step back and do a little less work, so you're not doing so much. Or it might also give you a chance to cut your hours back so that you can do some other projects that you might have been interested in and haven't been able to do, or maybe some volunteer work that you were interested in. It also gives you an opportunity to make your business much more profitable before you're ready to sell it. So you can show some bolstered numbers before you're ready to sell. And also, we would like, even if you can't sponsor a student, if perhaps you would allow them to come into your office and let them observe, just so they can see what they're going to be doing in the future. But these are all opportunities and ways in which you can help students and to be able to springboard that next generation of hearing instrument specialists. All right, and last slide. So if anybody has any questions, I am happy to answer them. But I do thank you so much for the honor and privilege of your time today. And if you want to ask questions now, you may, or you can email me at kels@hearinglife.com.
Hi, Kelly. We do have a question from Jennifer, who's attending online.
Okay.
And, she asked, does the OTC climate raise any concerns for people going into the field? Fear of need for hearing instrument professional being eliminated over time?
I honestly don't think that's ever going to be an issue for us because of the limited fitting for an OTC. There are lots and lots of people out there that have hearing losses that are much greater, and they are going to need a hearing care professional for sure. And a lot of folks who start out with an OTC, many times they try that and they realize this really isn't what I'm going to need. I need something more professionally fit, and that's where they end up in your office. So I honestly don't think it's going to be a problem at all.
Thank you. Does anybody have any further questions? So Kelly, I have to say, I love you for embarrassing Laura the way you did.
Well, we love Laura, so I'm sorry. I didn't mean to embarrass her, but we love her.
Laura walked into my office one day in 2016 and said, I really want to do this. How do I do it? We didn't know who she was at the time, and look how far she's come.
I am not surprised. She is definitely a go-getter. She's amazing.
Yeah, Laura was my apprentice in his year.
That's wonderful.
I taught her well.
Indeed, indeed.
So again, thank you for filling in at the last minute, Kelly. If anybody has any questions, feel free to contact Kelly. And we'll talk soon, I'm sure.
All right. Thank you so much, everybody. Enjoy the rest of your conference. It's been a pleasure.
So on behalf of New Jersey Association of Hearing Health Professionals, thank you for our virtual and in-person attendees. We hope to see you back again next year. Check out our virtual auction online when you get a chance. Contact our manufacturers that were so kind to sponsor us, and thank them, and reach out if you need anything educationally. Anything else, Carla?
I think you covered it.
Okay. Again, thank you for coming. Everybody have some safe travels home.
Thank you.
Thank you.
Thank you.